really busy schedule to get to today. So welcome everybody to the Joint Committee on Child Welfare Systems Oversight. To my legislative colleagues that are here, congratulations everyone on winning your elections. And it's kind of been an exciting fall, hasn't it? So we're going to hit the ground running this morning and have a presentation on the settlement agreement that we call the McIntyre report. But we have with us on WebEx Judith Meltzer from the Center for the Study of Social Policy. Judith, are you there? Is she there? Are you on mute? Judith, we're having some problems. We can't hear anything yet.
You hear me now?
Yay. Yes.
Okay.
Yes, we can hear you well, the committee, and sorry we're starting a little late, but the floor is yours.
Okay. Can you see me or not?
Not yet.
Is there something I should be doing to?
No, nope. Yes, we can see you now. Okay.
Okay. Good morning. Good
Good
morning.
morning.
Good morning, Chair Concanon and Vice Chair Gossage and all of the committee members that are there. So I am Judith Meltzer. I'm a senior fellow at the Center for the Study of Social Policy, and I am the named neutral in the McIntyre v. Howard settlement agreement. And I'm very glad to be with you today, even remotely, although I wish I were in person. During my time today, I want to just provide some brief context about impact litigation and my role as the neutral in the McIntyre settlement agreement, an overview of the lawsuit and what's in the settlement agreement, the findings of our most recent period 3 progress report, and discuss briefly some of the recommendations we included within that report. The McIntyre v. Howard lawsuit was filed on behalf of a group of Kansas plaintiffs in 2018, and the court-ordered settlement agreement is designed to address structural and institutional limitations in the Kansas child welfare system that resulted in poor outcomes for many children and families. Kansas is not alone in having this type of settlement agreement. Dozens of states and jurisdictions are either under active settlements or currently litigating similar suits. As the court-appointed neutral, I'm charged with assessing the state's progress in meeting the commitments to which they agreed to in the settlement. I've served in a similar role in other jurisdictions who have successfully met their commitments and exited court oversight. And I know that while there is great urgency in addressing concerns and seeking improvements in outcomes, significant changes to systems as complex as child and family serving systems take time. To achieve the desired and expected changes, systems need strong leadership with a clear vision. They must have the support of the legislature and other state and local partners, and they must have the capacity and resources to identify, understand, and address barriers in order to more effectively serve children and families. The McIntyre settlement named me as the neutral for this case, and I'm responsible for independently validating data and reporting annually on the state's performance. This work is supported by a team at the Center for the Study of Social Policy, my organization, and by our data consultant, Action Research. And we do this work in partnership with DCF, KDADS, KDHA, and the plaintiffs. The suit itself was filed in U.S. District Court of Kansas in November of 2018 on behalf of a class of children in the custody of Kansas's child welfare system, alleging repeated and ongoing placement instability and lack of adequate access to mental health services for the children in care. The parties reached agreement in July of 2020, and it was ratified by the federal court in Kansas City on January 28th, 2021. So we are now more than 4 years. I think that's 4 years. 2, 3, 4. 4 years into this lawsuit. The settlement agreement defines performance goals requiring structural changes and measurable outcomes intended to significantly improve the primary concerns raised in the lawsuit, that being placement stability and mental health services for children and youth. And the performance goals in the suit are divided into 3 parts: accountability, reporting and implementation, practice improvements, and outcomes. And I'm going to provide a brief overview of the requirements in each of those sections, but we've also provided you with a handout of all of the performance goals in the settlement agreement and the most recent performance as it shows up in our most recent report. The accountability reporting and implementation portion of the settlement agreement, it required DCF to amend case management provider contracts to improve accountability and incorporate the goals of the lawsuit, and to establish a community advisory group. Both of these were accomplished timely in 2021, and the Kansas Foster Advisory and Accountability Board continues to meet monthly and provide recommendations to DCF. The section also requires DCF to track and report annual information on all children in foster care in detention or other juvenile justice facilities, and the caseloads of all placement caseworkers and placement caseworker supervisors. DCF has provided us as neutral with this data annually, but as you know, within Kansas's privatized child welfare system, each of the contract case management providers had different methods for reporting caseload data to DCF. And it was not until period 3, or calendar year 2023, that we were able to work with the state and the providers to determine a consistent methodology for reporting caseloads. And the neutral team this year has been able to validate caseload data for the first time. There are 5 areas of practice change in the settlement agreement. For each, DCF must achieve and then maintain substantial compliance for 12 successive months in order to exit court oversight for that practice improvement. The required improvements related to placements are ending the practice of temporarily housing children overnight in inappropriate settings, like offices, hotels, cars, or other non-foster care locations, and the state refers to these as failure to place. To end the practice of placements that only last one night, referred to as night-to-night placements, and of placements that last only 2 to 14 days, referred to short-term placements. And of course, that's because we all know that short-term placements and emergency placements contribute to the instability of children and exacerbate the trauma of family separation. And the third was ensuring that licensed foster homes do not exceed their license capacity without an approved exception. For example, if you're accommodating a sibling group within that foster home. The requirements related to mental health services are ending delays in the provision of mental health services due to children's placement moves. In the past, the provision of medically necessary mental health treatment services was sometimes delayed because of placement instability, and to provide accessible statewide crisis intervention services. The agreement required all practice improvements to be completed by the end of period 1, which was December 31, 2021. And I'm going to discuss the progress towards these when talking about the period 3 report. The settlement agreement also mandates 5 measurable outcome improvements for class members, with established annual benchmarks to be met over a 3 or 4 year period. Once each final outcome is achieved, DCF is required to maintain substantial compliance for 12 successive months in order to exit court oversight for that outcome. The outcomes related to placement stability are achieving a low rate of placement moves, ultimately 4.44 moves or less per 1,000 days of care, meaning the total of days of care of children in the system. 2, ensuring that placements are stable, ultimately for at least 90% of class members, and limiting placement moves to 1 or fewer per 12 months, ultimately for 90% of class members. The outcomes related to mental health services are providing an initial mental health and trauma screen by qualified and trained professionals within 30 days of a child entering foster care, ultimately for 90% of class members, and meeting the mental and behavioral health treatment needs of children in care, again, ultimately for at least 90% of class members. The settlement required outcomes regarding placement moves, behavioral health needs, and trauma screenings to be completed by the end of period 3, which was December 31, 2023. The outcomes for the rate of placement moves and stable placements are to be completed by the end of period 4, which is the end of this year, December 31, 2024. Reporting periods in the settlement agreement are calendar years, and so 2023 was the 3rd reporting period since the settlement was finalized and that we have reported on. And in assessing the state's progress, we use a variety of methods, including receiving and reviewing available state data from multiple data systems, and reading a sample of case records that validate the state's own findings when they read the case records, interviewing stakeholders, including advocates, foster parents, providers, and youth, meeting with state leaders in DCF, KDADS, KDHA, and others, and engaging in conversations with lawsuit plaintiffs and other state stakeholders. So the period 3 report, covering the period ending December 31, 2023, was released on September 16th, 2024, and overall progress was disappointing. It's important to recognize that the state has remained committed to meeting the requirements of the settlement, and more importantly, to improving the experiences of Kansas's children and families. I want to give Secretary Howard and her team credit for their commitment and ongoing work. However, despite focused efforts, it is far from meeting the majority of the anticipated final targets within the timeframes expected in the settlement agreement. Again, you have the handout which shows the performance over time for reference, so I'm not going to go into that kind of detail. But for sake of this presentation, I've grouped practice improvements and outcomes related to placement stability and those related to mental health services together. So they appear in a slightly different order in these materials than in my discussion than they do in the period 3 report, which you all should have. In terms of placement stability, DCF data showed that most children were in stable placements during period 3. But for those without stable placements, the instability they are experiencing seems to be worsening over the last 3 reporting periods. While the number of children experiencing night-to-night placements or short-term placements remained about the same, the total number of these placements increased significantly this year, because some children experienced many of them. Specifically, 30 children experienced 11 or more night-to-night placements, and that accounted for 420 total placements, or 20% of all night-to-night placements during the period. 67 children who experienced 11 or more short-term placements accounted for 29% of all short-term placements that occurred in 2023. The state came close to achieving the target of 85% of children in DCF custody at any point in the year having one or fewer placement moves. However, there's a subset of children in care who experienced extreme placement instability, with 367 children and youth having 6 or more placement moves during the 12-month period. And again, I think it's important to recognize that that amount of instability contributes to behavior problems and failure to actually provide for the well-being of these children. The data showed that Black African American children were overrepresented among children experiencing multiple placement moves, including night-to-night and short-term placements, and particularly among the children who experienced 11 or more night-to-night placements. In 2023, there was clear progress in reducing the number of failure to place incidents in which children sleep overnight in an office. 57 children experienced 68 episodes of failure to place. However, preliminary data from DCF that we haven't yet validated for this year shows that progress has not been maintained during 2024. As we know, and we know that some children who are not actually classified as having a failure to place are experiencing sleep-only placements, where they have a bed for the night, but they need to be out of the foster parent's house during the day, often till late evening, and are therefore spending extended time in unlicensed day centers. We're very concerned about this practice and that these children appear in the data to have stable placements because they return to the same foster home every night, and we think it masks the extent of the problem of their instability. Performance related to mental health services was mixed. The state made continued progress in expanding the availability of crisis mental health services and demonstrated a substantial improvement in screening children and youth entering care for trauma and behavioral health needs, though it did not meet the target of 90%. In 2023, 69% of children entering DCF custody received timely mental health and trauma screenings, an increase from 43% in 2022 and 34% in 2021. Performance related to the outcome of actually meeting the mental health needs of children in care declined substantially in period 3, and many children experienced a delay in the provision of mental health services that was sometimes attributed to placement instability. We determined this by case reviews that the department does of a random sample, statistically valid sample of cases, and then our staff reread half of them, and we reach agreement on the findings. The case reviews found that only 50% of children in care had their mental and behavioral health needs addressed, a decline from 70% of children from 2022. For children who did receive mental health services, more than half, 58%, experienced a delay before receiving needed services. As a result of our findings in the Period 3 report, we made several recommendations to focus specific attention on the children and youth experiencing extreme placement instability and those not receiving needed mental health services. In the near term, we recommend that DCF lead an intensive case review with each of the 5 CMPs to focus on the 367 children who experienced 6 or more placements in 2023, as well as children aged 0 to 5 who experienced a night-to-night or short-term placement. Given Kansas's decentralized system, it is necessary for DCF to get a close look at practice within each of the contracted CMPs and to better understand the needs of the children each serve and why they are not being met. Secondly, we think the state should put in place a response system that is triggered when a child has experienced 3 or more placement moves in a 6 to 12-month period. This alert should activate escalating reviews by the state involving the CMPs, DCF, and designated mental or behavioral health providers. And those reviews should lead to the development and implementation of individualized service plans to address each of these children's needs. Resources need to be available to the teams conducting these reviews to put individualized treatment and other support services in place. We also made 3 recommendations to address system barriers, where we believe the solutions are foundational to achieving and maintaining the requirements of the settlement agreement and improving outcomes for Kansas's children and families. The first is the implementation of a comprehensive child welfare information system known as CWIS for Kansas. Accurate and timely data reflecting practice and the experience of children and families served by the system is absolutely necessary for accountability and for any continuous quality improvement or change effort. The lack of current statewide data statewide data infrastructure and the variation between record-keeping practices of individual CMPs are real barriers to understanding the current state of practice or the potential impact of initiatives. The process for receiving data from CMPs inhibits DCF's ability to understand and address issues in real time. Kansas's current data collection and reporting methods are antiquated, and Kansas is behind most jurisdictions when it comes to the use of a statewide information system for child welfare. DCF and the neutral team now spend significant time, effort, and resources working to ensure the data necessary to report on progress with the settlement agreement can be validated. And these data are ultimately only a small snapshot of ultimate practice. With better quality data, more resources could be spent identifying and addressing challenges in practice and evaluating the effectiveness of initiatives, rather than compiling and reconciling reports from multiple data systems. DCF has issued an RFP for a vendor to develop a comprehensive child welfare information system. And I cannot underscore enough the importance of DCF having the necessary resources to carry out this project. While implementation of a system is expensive and has inherent challenges, until there is consistent quality data, measuring performance and outcomes, and providing necessary accountability to the CMPs will continue to be fraught with issues. The second recommendation is ensuring consistency of quality of practice among the contracted case management providers. While DCF met the settlement agreement requirement to amend CMP contracts to establish performance-based metrics and address corrective action measures for non-performance, there's an additional opportunity for the agency to develop a more robust infrastructure and framework to monitor these provisions and the performance of individual CMPs. DCF currently reviews cases from each CMP using the Federal Child and Family Service Review Protocol, but there is not a clear, effective structure to address concerns raised by these reviews in real time and to create shared accountability for the outcomes. We strongly recommend that DCF enhance its oversight of CMPs and implement a consistent CQI structure statewide to address practice concerns that arise during case reviews. This will also allow the state to transfer learning among CMPs about successful and effective strategies that, many of that they are using in some areas. As part of this effort, we recommend that DCF assess the effectiveness and application of its current practice model. Jurisdictions that have been successful in transforming child welfare systems have done so by looking beyond compliance with individual measures and operating with a shared vision and a set of principles to guide practice articulated in a comprehensive practice model. Practice models set shared expectations for approaches to case management and interactions with children, youth, and families. While at the state level, DCF has developed a practice model, it does not appear to be uniformly understood and implemented by the CMPs statewide. The practice expectations defined in the practice models should be the foundation for the expectations of all CMPs, but there is currently significant variation in practice across the state. Building out the practice model in collaboration with the CMPs with accompanying key performance indicators and metrics would help DCF more effectively manage their contracts and assess the effectiveness of strategies in improving the outcomes for children and families. The third recommendation, and this is my last, is a significant statewide investment in the mental health workforce and provider capacity. We noted concerns related to the timely provision of mental health services for children and youth in care, and understand that one of the barriers is the lack of available qualified mental health providers throughout the state. Enhanced funding is needed to recruit and retain mental health providers, including therapists, psychiatrists, nurse practitioners, and staff at treatment facilities. Without investments in this workforce, it will be nearly impossible to build out the community-based service array required to serve the needs of Kansas's children, youth, and families in general, and specifically those who come to the attention of the child welfare system. And many children fall into the care of the child welfare system precisely because their parents have been unable to secure the mental health treatment they need for their children without child welfare intervention. To better understand what specific investments would be most beneficial, we suggest that the state use the findings of the intensive case reviews we suggested earlier, as well as results from other ongoing case reviews, to compile and share information about the most urgent unmet needs for services for children and youth in foster care and for their families to prevent children's unnecessary entry into foster care. Again, thank you for the opportunity to be with you today and for your continued commitment to the children and families in Kansas. I will be glad to take any questions.
Hey, thank you. Thanks for your presentation. So, committee, if we have any questions right now, we can take those. I also will open it up after we hear a response from both Kansas Appleseed and DCF. So, Judith, would you have time to stay on?
Yes, I'll be glad to.
Okay, well, let me check and see if there's any questions right now. Senator Gossage.
Thank you, Madam Chair. Thank you for that presentation. I'm looking through your spreadsheet here. You didn't address it specifically. However, one of the things that I've noticed is that the target seems to keep moving. Can you explain that? I'm looking specifically on page 4. So we had...
Right. So the settlement agreement, in terms of setting the outcomes, set graduated targets for each year over a 3 to 4 year period, in kind of recognition that you're not going to be able to achieve those outcomes overnight. So there'd be a lower, you could assume that until you get to period 4, that the targets are interim targets, places where they expected the state to be at that point, recognizing that additional improvement was still needed. That's only true for the outcomes in the settlement agreement.
And one last question, Madam Chair. So on page 6, it says addressing mental and behavioral health needs. And the target was the 12-month period shall have had their mental and behavioral health needs addressed. So do we have a definition for addressed? And did the department feel like they fully understood that definition?
Yes. So the settlement agreement laid out the definition of how we would measure that using the federal Child and Family Service Review Protocol. So there's a part of that protocol which is used to make a judgment about whether children's mental health needs are addressed. So that is the part of the protocol that is used. It is the state's protocol that we use. We've worked with the state, to make kind of not really adjustments, but to make sure that when they read the cases and we read the cases, we're all on the same page, that we're looking for the same information and documentation. And we're required to reread 50% of the cases that they read. So the initial findings on that outcome come from the state's read, and then we read, and then typically what's been happening is that in almost all the cases, we're in total agreement. In a few cases, we might have scored it differently. And then we go back and we have a reconciliation process with the state case readers and come to agreement. Although basically there's been really very little of necessity to do that, given the fact that we are in looking for the same things when we read the cases. It is based on a case read, a review of records.
And you say you as a neutral, and how many people are in your committee or as part of your group that are looking at these settlements?
In terms of my work, we have a staff of 2 people who work with me at the Center for the Study of Social Policy. They're not full-time on this. Both of them actually are listening in. Nicolene Biddle and Shelby Zimmer. And then those are, and then we occasionally use other staff at the Center for the Study of Social Policy who are experienced case reviewers and child welfare professionals to help with the reading of the cases. We also, in doing this work, have had a data partner, Action Research, which has worked with us and with the state on making sure that they can provide, and we're in agreement about the data that they provide so that we can validate the data.
Thank you so much. And Madam Chair, if I may, I just want to introduce 2 of our newly elected legislators that have just walked in. We have Senator-elect Doug Shane, and we have Representative-elect Charlotte Esau. Thank you for joining us today. Thank you, Madam Chair, and thank you, Judith, for answering my questions.
Okay, thank you. Representative Howerton.
Thank you, Madam Chair. Just for clarification, you stated that the data showed the Black African American children were overrepresented. Overrepresented? I think that's that. Can you clarify that? What does that mean? Overrepresented.
So when we looked, I think the specific figure I gave was around the children with 11 or more placement moves. When we look at the data on the children with 11 or more placement moves, we look at the proportion, the racial breakdown of those children. We look at a lot of data about who these children are, and then we compare them to statewide population data. And when we say overrepresentation, it would be, for example, in your state, this population accounts for, 20% of the population. When we look at this particular indicator, there's a disparity between the number of children in the state who meet those characteristics and the number of children that we're finding who have 11 or more placement moves.
Thank you very much.
Representative Ruiz.
Thank you, Madam Chair. In the data that was being collected, was there any data collection regarding no-shows? Not on the part of the mental health center, but on the part of the placement agency or foster family taking a child to receive those mental health services?
So I don't believe that we saw or collected any of that data, but I do know that from my experience in work with other states that, frequently you can have a problem with, no shows and appointments. I don't know the extent to that, and I don't know that that was something that we looked at, specifically.
Thank you.
Okay, further questions at this time? Okay, then thank you, Judith. Next up, we'll hear from Brenna Vyskotsky, I said that right, from the Kansas Appleseed.
and also turn it on, which might make a difference. So close, Brenna Vizosky. But you were so close and I appreciate it. All right, I'm gonna jump in because I know our time is limited. Hello, and thank you so much, Chair Concanon and Vice Chair Gossage and other members of the Joint Committee on Child Welfare System Oversight for inviting us to speak on the Center for the Study of Social Policies Foster Care Report for Period 3. My name is Brenna Vizosky, and I serve as the Just Campaign Director with Kansas Appleseed. With the time that we have, I want to make sure that we're highlighting 4 key topics that we're going to really be centering on today, which are accountability and oversight, workforce issues and the needed investments to address these issues, youth's access to mental and behavioral health services, and then finally, the effectiveness of privatization. All of this is probably feeling very familiar after CSSP's presentation. So jumping right in, to be mindful of time, accountability and oversight. We recommend DCF work on increasing transparency and data access, and what we mean by that is access to robust data. Currently, as CSSP's mentioned, there's a lack of data which impacts their ability to assess performance. However, this is also really impactful for DCF and their contractors' ability to assess their performance internally as well. Accurate data is absolutely paramount to making informed decisions about kids' safety and well-being, as well as with system-wide management decisions. Also, it's important to point out that this data isn't just numbers. Each point is a child that currently exists within the system. So we really recommend better data collection and the establishment of more robust systems of data that DCF and contractors can review and have access to. Another hurdle to navigate is that currently there's an inability to exchange data between the contractors and DCF, and between state departments in a way that is streamlined. We need data systems within DCF and in other departments as well that can talk with one another, or at minimum, we need better bridges between these data systems that are easier to navigate. It is important to recognize that many state departments are currently working on building new data infrastructure, as we just heard with the RFP. However, this does effectively look currently like building fancier silos for each department versus what we need, which, sticking with my convoluted metaphor, is more grain elevators between these silos. We also need these data systems to be more user-friendly for workers. Something we've heard mentioned is a reliance on manual entry. I think that there needs to be less need for this level of time-intensive engagement from our frontline staff, so more focus can go towards meeting the ultimate goal, which is to spend as much time as possible in direct service of foster youth, their families, and their foster families. While we're talking about data access, I do want to mention that we appreciate the collaboration and efforts DCF have been making on their foster care report card, and we are looking forward to seeing how this shift in reporting impacts conversations we're able to have as a state to help foster kids, specifically as it relates to their educational outcomes and the disparities we may see there. Okay, moving on to kind of a big topic that's really been, I think, at the center of a lot of these conversations and leading to a significant amount of the major concerns we've been hearing, which is placement stability or placement instability. So first and foremost, when it comes to oversight, we really think there needs to be more oversight of funds that have already been spent and invested to create more suitable placements. We need to look into how effective this has been, what's worked, what hasn't worked, where should we be putting more money versus pulling money, et cetera. We also want to look at how the introduction of reasonable placement expectations have created unintended consequences, and we want to work to prevent those unintended consequences. What I mean by that is that we're currently seeing situations, as we heard with CSSP, where children are cited as having a stable placement because they're sleeping at the same place each night, but they're also getting picked up as early as 6 a.m. to go to school or a day center placement, and then they're being taken back to that home late at night. So really, it's just where they're sleeping, as we heard before, a sleep placement. It's not really where they're staying. We believe that this is in response to expectations set around stable placements and an effort to meet those expectations. But we also want to make sure that these kids are in legitimately stable placements. And so we want to look into how we can prevent things from being cited as stable that might not necessarily be, and ultimately working to provide what's best for those children. In line with placement instability is placement availability. So we really believe that there needs to be work to establish a plan to recruit foster families and also reconnect foster families that have quit fostering. We also need to grow the availability of therapeutic placements further to sufficiently meet the needs of youth who are entering the system with higher needs. In line with this, serious efforts must be made to bring foster parents who've quit fostering back into the fold, which likely means putting in real effort to hear the issues being raised by current and previous foster parents and creating achievable goals that will address their concerns and reasons for leaving. I can speak anecdotally that some of the folks we've talked to have shared that their struggles or the reasons they've left fostering are connected to a lack of general training or feelings of preparedness. Many folks feel like they were hit with more than they were expecting when they started fostering, and many also feel undervalued by their contractor in DCF. As mentioned previously, we also need to be looking into having more therapeutic home placements, and when we talk about this, I want to make sure that we're recognizing that DCF has made progress with regard to expanding contracts for therapeutic placements. There's now 23 available, I believe, as of August. However, it's important to note that even their target goal of 25 placements could be insufficient to meet the needs that we're seeing. We also argue that there should always be as many placements ready to go as we have possible children needing those beds and that heightened level of care, especially considering that we are also currently using something called secure care for kids who have chronic running behaviors or chronic elopement. And we would really like to know if having access to more therapeutic homes could aid in decreasing the use of secure care and better support youth being able to transition out of secure care effectively. We also, of course, need to be increasing efforts to identify and secure kinship placements. It's important that efforts be made to assess the barriers that potential kinship placements are having and addressing those. This could mean eliminating license requirements that can be eliminated, loosening requirements that can be loosened, while also ultimately recognizing that some things need to stay in place for general safety. We also recommend reintroducing and passing a bill like what we saw last session with House Bill 2554, which would establish a robust process for DCF to identify and notify relatives and kinship caregivers when a child enters DCF custody. Okay, so as we're talking about placement instability and the suggestions you've heard so far, it's important to know the data and the realities that this presents for our youth that are impacted. I know we've heard these data points a bit already, but it feels important to reiterate the need to address these things, such as Kansas not ending the practice of housing youth overnight in offices by the deadline that was set. This last year, 57 children experienced 68 instances of sleeping in offices and other settings that are not licensed child welfare placements. And while we recognize this improvement from 2022, we also want to note that the preliminary data from this year suggests our numbers are now substantially increasing. It's also important to note that children who entered custody in 2023 averaged almost 8 placement moves per 1,000 days, which is almost 60% higher than the goal that was set for this time frame of 4.44 or fewer moves. Also, 822 youth experienced 2,057 one-night placements, which is an increase of 36% from the previous year. And while we're talking about this, along with this issue of placement instability, a narrative we've kind of been running across sometimes is that placement instability is primarily experienced by only some children, and that it's often due to things related to that child, such as their age, them being older, the child having higher needs and behaviors that disrupt their placements, and that these children are also refusing placement options presented to them due to the rules and regulations that might exist at that placement. While we're discussing the children typically experiencing more placement instability, it feels absolutely crucial to point out that often the kids experiencing this level of instability are our children of color who do have worse outcomes in our foster system generally. So when we think about placement stability, something important to consider is decreasing the amount of kids we're putting into foster care to begin with. With this in mind, we suggest a partnership between the Department of Corrections and DCF to look into alternative sentencing for primary guardians or parents to keep them at home and reduce the rates of kids entering the system and taking placement spots when it is actually safe and effective for these kids to remain in home with their parent or guardian. Alternative sentencing also reduces rates of recidivism, saves money, and is generally better for kids' physical, mental, and behavioral health. All right, so moving out of accountability and oversight and into workforce issues and the needed investments we're seeing there. We suggest an increase in investments to support better outcomes for our foster youth. We know high turnover matched with low interest in open positions contributes to the workforce issue we're seeing, and we argue that that's linked strongly with caseloads, compensation, and culture. Currently, there's 3,016 children across the entire state that have been assigned to a permanency caseworker that's handling 30 or more cases throughout the report period of period 3, which accounts for 39% of all assigned children. The argument we're making here is that that is a lot of cases for one person, which really hinders a caseworker's ability to truly connect with the children on their caseload in a meaningful way and sufficiently meet the needs of each of those children. It's also especially important to think about the impacts this issue has on our more rural case managers, who are also going to have more windshield time if they're going and visiting in person with the kids on their caseload, which we argue they should be doing. With regard to compensation, it's vital that DCF and their contractors look into increasing their investment in frontline folks by improving their compensation. and not just improving pay for staff, but also looking into pay for therapeutic home placements and placements for children with higher medical needs. Finally, on the topic of culture, there's a need for examination and partnership with every area of foster care service providers. It's absolutely important that DCF and their contractors speak to their workforce so they can collaboratively build a culture that recognizes staff needs and ultimately centers youth and providing them with the services to fully meet their needs, regardless of how intense those might be. Now, separate from contractor staff workforce issues, it's also important to recognize that Kansas's guardian ad litem workforce is also struggling. And I want to recognize that this does exist outside of DCF, but is very important to look at. We've heard about several concerning issues like children not knowing who their guardian ad litem is, children not being seen before their court dates by their guardian ad litem. So we'd also suggest a continued examination of this system and being thoughtful about how we can improve that aspect of foster youth support. Looking into things like, are there also issues with high caseloads for our guardian ad litems? Is there an issue with travel expectations or limitations or compensation rates? Are there opportunities to be providing better training and changing standards in place for our guardian ad litems? Ultimately, we really want to think about how a guardian ad litem can know what's best for a youth if they're not even speaking to them before their hearings. Because as it stands in Kansas, a guardian ad litem's role is to present what's in the best interest of the child. We do want to recognize that work is being done, again, outside of DCF to look into the guardian ad litem workforce issue and other ways it can be structured. And we're really looking forward to identifying opportunities where we can collaborate to improve the system and seeing where those conversations ultimately lead. Okay, so our final suggestion with regard to workforce is to invest in adequate training for all the people who are engaging in these kids' lives, providing services to them or helping them navigate the system. It's really important that effort be placed in identifying opportunities to improve training and to also ensure that leadership is adequately preparing not just staff, but also foster parents more effectively for what engagement in the system really entails. We also think it's important that more time and energy be put into supporting youth that are aging out of care. According to the Annie E. Casey Foundation, more than 19,000 youth left foster care in 2021 without reuniting with their parents or having another permanent family option. Now, with Soul passing last year, I do want to recognize that there is hope that this number is going to change in Kansas and that we are going to see reduction in our state on that front. Still, though, it's extremely vital that we do more to build out the transition out of care process and set system-impacted youth up for success. This means ensuring that Medicaid forms are taken care of and education is provided on how their insurance works in a deeper way, that they're being set up for any kind of schooling or educational opportunities they may want to pursue, that we're getting them into job training programs. And an aside here, Kansas Appleseed is starting to look into improving job programs here in Kansas to find more evidence-based ways to invest in our system-involved youth generally, especially programs that are providing not just skills training, but also access to mentors, caseworkers, mental health supports, and things like that. Okay, so beyond schooling and jobs, we also think it's important to identify housing for kids that are transitioning out of care and getting them equipped with independent living skills if they're going to be living on their own. This is especially imperative to combat the connection between foster care and experiences of homelessness that we see. Again, more research from the Annie E. Casey Foundation, 29% of youth report being homeless between the ages of 19 to 21. So that's enough about workforce and needed investment. I'm going to move on now to youth's access to mental and behavioral health services. Some quick information, we've already heard some of this, but to center this conversation and our suggestions, I want to reiterate that 75% of cases that were reviewed by CSSP showed evidence of a child with a mental health need, and only 52% of those in need received appropriate mental health services. Of those youth who received appropriate services, 58% experienced a delay in accessing those services. So when you follow that trend down and you see how that pie is continuously sliced up, you see how small the amount of youth who are receiving assessments, appropriate mental health supports in an appropriate amount of time actually are. And we argue that this is unacceptable because 100% of youth should be participating in some kind of mental health service, even if that's just therapy, and all foster youth should be receiving a timely assessment by a qualified professional. The impacts of entering foster care, regardless of assessment outcome and mental health diagnoses, is a traumatic event for youth, and we want to make sure that supports are already in place to catch those kids if that exposure to trauma becomes a more significant issue for them. All right, backing up a bit, as we look into ways that we can kind of merge mental health services, behavioral health services, and ideally keeping children out of the foster care system at the front end, We want to recommend expanding access to respite care to bio and adoptive families prior to a child leaving or being removed from the home, extended access to therapy services after a child has been reintegrated to support that reintegration effort and to keep it from failing, and working to identify other ways we can improve family preservation, again, at that front end of the process. To reiterate, it's incredibly important that we're prioritizing immediate assessments by qualified professionals, and we're also getting immediate mental health supports in place for those who need it. It's also important to address the ongoing lack of access to medications and therapies, or the lapse we see in provision of medication and therapies if a placement is disrupted. For 31% of the youth who did not receive all needed mental health services, placement instability was at least partly the cause. Finally, it's important that a review of the family helpline be completed to gain a better understanding of the outcomes, specifically as it relates to the utilization of the helpline, the effectiveness of the service as it stands, how it can be improved, how often people are being connected to mobile response, and if there's any advantage to consolidating or connecting this service with other services we've seen expand out in Kansas, such as 988 and mobile crisis response. All right. So that was all quite a bit, and with all of that in mind, I want to move on to our last area of concern, which is the effectiveness of privatization, and if the system as it stands is working for our kids. Kansas Appleseed does not want to pretend that we know the answer, but we think it's very important to set up some kind of official examination into this system and question if it's truly working for Kansas foster kids. We recommend creating a workforce to look into this. We believe that could be advantageous. A workforce that could examine the effectiveness of the oversight of foster care contractors, to look into and encourage any legislation that could positively impact this issue, and to think through if it's feasible to improve this system as it is, or if investment in transitioning away from privatization could be worth exploring further. This effort should also be centered in the understanding that when Kansas elected to go private, it was meant to improve outcomes. Clearly, we're still having similar or the same conversations about the realities of these outcomes for our foster children, so alternatives may be worth further exploration. Kansas Appleseed encourages the implementation of these recommendations, as well as those detailed more in depth within the McIntyre Settlement Agreement Period 3 Progress Report. We believe it is crucial that DCF and their contractors take accountability for the realities our foster youth face in their care, and we look forward to seeing continued efforts to better this system and show that it is committed to Kansas children and their ability to thrive. Thank you again so much for your time, and I will now stand for questions and do my best to answer them.
Okay, we're going to hold them till the end, but Susan Humphreys has it.
So my question, it's very.
Sorry, Representative
I'm sorry.
Humphreys.
Oh,
Yeah, you go ahead.
So you had such detail. I feel like you were reading that, but it doesn't match what we have in our packet. And you had a lot of statistics and percentages that I felt like I couldn't find. So would we be able to get what you were
Yes.
reading? That
Yeah.
would be really helpful.
Everything should be directly from the CSSP report if it's not in my testimony, but I can consolidate all my data points and connect them with where you can find those. We can get that to you for sure.
Okay, thank you.
Great, thank you. Okay, we may have questions here for you after a while when we open it up again. So next we will have Secretary Howard with Department of Children and Families.
Thank you, Madam Chair and members of the committee for the opportunity to be here today to talk with you about the Period 3 Progress Report for the McIntyre Settlement. I feel like a lot of things that I'll be talking to you about within the context of the settlement are not that different from the things we talk about regularly at our meetings in terms of some of the challenges, particularly with the cohort of youth that are experiencing placement stability, some of the issues of youth coming into care for access to services, rather than for abuse and those pieces. But right now I want to talk very specifically about the context of the settlement agreement. I would first just like to thank Judith Meltzer and her team. I mean, they have been great to work with over all these years. As she talked with you about the time frame for this, the settlement was The lawsuit was filed in 2018, and when I came into this role in 2019, we began sitting down with the plaintiffs to reach a settlement agreement, and that's what we're really responding to now. So again, I'd also like to thank Appleseed for their presentation today and many of their recommendations as the plaintiffs. So, so as we look at the period 3 report, which is for last calendar year, so we're going back till last December in terms of the closing of that report. Obviously, the report, I'm not going to stand here and say it doesn't show more work needs to be done. It does. It shows there's significantly more work that needs to be done, particularly in the arena of placement stability, and I think particularly as it relates to a cohort of youth in our care. So I just want to talk through things that we already have in place, that we've been doing, even before this report was issued, as well as some more recent initiatives that we're undertaking in partnership with our case management partners to improve performance. And I'll also reference some things and some parts that you certainly have played as a legislature in terms of investments that you've made to help address progress in our system. And the report does come at a time when there are things to be proud of in our Kansas child welfare system. And I think the bright spots confirm much of our work that's being done by DCF and our partners is having an impact for youth in foster care. I mean, as you know from presentations over the years and from your commitment and investment to Family First and other initiatives, we're doing a good job on prevention and reducing the need for foster care. You'll hear me talk about those numbers later today in another presentation. We also know that our work to increase placement with relatives and kin has been substantial, and that has a significant impact in terms of permanency and stability outcomes. For example, we know that in July, 54% of initial placements into care were with relatives. We also know that nearly 2/3 of our children are meeting that federal outcome, that 4.48 or less for placement stability while they're in care. And in 2 of our regions, the federal standard is being met across the board. When you look at the data from the settlement, we know that 87% of our youth are in a stable placement. That's down a little bit from the prior periods, which was at 90%. But again, the vast majority of our youth are in a stable placement. We know that 83% have 1 or fewer moves in 12 months. And we also know that crisis supports continue to be more available across the state, not just the crisis helpline, but many of the crisis supports that the community mental health centers have stood up in terms of crisis stabilization services for youth. But again, despite these bright spots, we continue to fall short, as you've heard, on a number of the settlement performance goals, and that's not acceptable to me. We have to keep working on this, particularly when we think about a cohort of youth who are not being well served, whose needs aren't being met, who aren't experiencing the stability that they need to experience. So despite our collective efforts, despite, I think a lot of investments in strengthening the system as a whole, we really need to move to some next steps that really begin to look at those youth very much in an individual basis. And I'll talk to you about some of our plans with regard to that. But again, I believe that the investments that you all have made, whether that's in therapeutic foster care, resources related to our data system, functional family therapy, other things have certainly made our system stronger. They've made supports more available. So let me talk to you about behavioral health supports and then focus on some of the extreme placement instability as kind of the key areas of focus in my testimony. Across DCF, KDADS, and KDHE, we continue to focus on expanding behavioral health supports. We've added children's behavior interventionist services as a Medicaid covered service that is slowly starting to grow. We now have 5 approved providers using 3 models of service. That's an in-home support that can be in a foster home, or it can be used on the prevention side to support families. We also have been able to expand the availability of functional family therapy, an evidence-based program through $2 million in grants to Cornerstones of Care, Ember Hope, and Eckerd to provide that across the state. That's particularly effective with older youth. We also know that we have some innovations going on within our case management providers. I think you heard from Ember Hope Connections at your last meeting about some of the efforts they've taken as they're coming in as a new provider to partner with ComCare to locate a mental health provider to provide services for youth experiencing placement stability, and also their unique partnership with the University of Kansas to provide psychiatry services to youth experiencing foster care more quickly through the KEEP clinic as well. We also recently opened up the Medicaid behavioral health codes for some categories of services that had only been allowable to community mental health centers, again, to address those issues. And then one of the areas that KDADS has been working on is really looking at the development of some specialized psychiatric residential treatment facility beds. Those of you on the Bethel Committee hear about the waiting list for PRTF beds, and that waiting list always includes some cohort that are foster youth, and some intersection with this cohort that we're talking about here today. So KDADS is right now supporting 2 PRTFs in developing specialized beds, one related to a secure PRTF, one related to substance use. And you'll hear more tomorrow from Drew Atkins, our Behavioral Health Commissioner, about a study that we did at KDADS to try to identify where are the gaps in our psychiatric residential treatment facility system. What kinds of specialized beds do we need? How many do we need? And so we'll be talking with you more about that. But I think that's a key gap that we need to fill. Another thing that we're doing right now is developing some specific memorandum of understanding language for agreements between the CCBHCs, the Certified Community Behavioral Health Clinics, and our case management providers. Under the expectations of being a CCBHC, they have to have memorandums of understanding with a variety of different community-based organizations. Those include child welfare providers. But what we are now saying to them is that those agreements with the case management providers have to include specific expectations related to this settlement and the outcomes in this settlement. So between every CCBHC and the case management providers, they will have memorandums of agreement that include these, and those will be, we're finishing up that MOU, then we'll be getting that out to them to execute at the community level. I think also with regard to behavioral health, I think Judith talked about just the overall issue of capacity in the system, right? We know workforce challenges everywhere. I didn't include this in this testimony, but I do think that the investments that this legislature made last session with regard to the new Behavioral Health Center of Excellence and those resources with regard to trying to grow psychiatrists, trying to grow other professionals are really critical in terms of improving those gaps in workforce. That's not targeted to child welfare per se, but as we think of overall workforce gaps, I think that's going to be critical. We also know how important accountability is in improving performance. One of the measures that is in this report has to do with trauma screens and initial trauma, mental health and trauma screens being done timely within 30 days of entry and by a qualified person. We've been improving on that each period, but had not reached the 90% level. So in period 3 on that measure, we had increased from 43% of youth to 69% of youth. This is a great example of though when we spotlight something. About a year ago, when we saw the data from last year, we began asking our case management providers to report on this monthly. We began tracking it monthly and spotlighting it. So while we didn't reach the total as of last December, as we sit here today, we know now today that 90% or more of those screens are happening timely, and they're happening by a trained professional within the 30 days that are required. So again, an example, when we focus on something, have that accountability, have that reporting, we can make progress on that. So again, as we stand here today, that data would be at 90%, not 69%. I wanted to talk probably most in my testimony today about the youth with extreme placement instability. You know, as I said earlier, when I say we, I mean you as a legislature, the administration have made a number of systemic investments to improve the availability of supports in our system. And those have had an impact when I talked to you about the aggregate data, but they haven't improved performance for that cohort of youth with the most extreme placement instability. Judith talked about some of that data. Appleseed talked about some of that data as well. So in terms of what's next to impact this instability and really reduce those short-term or night-to-night placements, one of the things we saw in Region 7, Sedgwick County, up to prior to the transition from St. Francis Ministries to Ember Hope, one of the things St. Francis did was initiate some placement roundtables, focusing really extensively on those youth who weren't in stable placements. You know, they had some progress from that work. I mean, very, very intensive. I mean, lots and lots of staff time, lots and lots of leadership time. I mean, really making sure to hear the youth voice in that. They identified in some cases family or relatives that hadn't been identified. And each of our case management providers has some similar work going on like that where they're doing those sorts of teamings at some level. And I think to make the progress needed, our laser focus for this next year has to be on these youth and what it really takes for stability or permanence for each one of them. And I always liked, I don't know if any of you were like Annie Lamott fans, that have you ever heard Bird by Bird, a book she wrote about writing many years ago? And there was a story in that book about her, I think it was her brother when she was a child. He was like 10 years old, and he was supposed to write a book about birds, and he was just totally overwhelmed by it. And his father just said, you know, bird by bird, you'll get this report done. And I think right now we have to focus on each one of these youth and what they deserve and need. Not only will that help us find stability for the youth, it will really help us to identify where do there continue to be those gaps? Where do we need added supports in the system? I met last month with the plan presidents for each of our case management providers to identify, you know, some of those next steps to make progress for this cohort of youth. And there's a number of things we're looking to initiate. First is, you know, earlier and enhanced family finding. You know, we do a lot of family finding in the state, but one of the things that the case management providers talked about was the ability to be more engaged with local DCF teams in identifying families or relatives prior to the time of removal into care. And there's one of our regions where some collaboration like that had been happening, and we were seeing better performance with regard to placement with relatives and kin. So we are looking at how to do that. Also with the resources you gave us last session, we have an RFP that will be going out related to a family finding system. That will be a system that will only take a few months to put in place as opposed to our CWIS system. And again, that will be really, really valuable because also our prevention providers can do that. So you'll have the context of having identified relatives and families in earlier interventions with families and have that information available. One of the most significant investments that we are initiating this fiscal year are what we're calling dedicated intervention teams for youth that have significant behavioral challenges. And this was an idea that our case management providers brought to us. You know, we said, what can make a difference with these youth? And so with these behavior intervention teams, we're looking to start 4 teams this fiscal year and then phase this into 11 to 12 teams. These would be teams that have very small caseloads, teams of 4, caseloads of 1 to 5, where they can work very, very intensively with families. And there would be, again, 4 people on those teams. There would be 2 case managers that would provide all of the standard case management services, plus weekly in-home meetings. And then there would be 2 in-home interventionists. Those could be a behavior interventionist, they could be an attendant care worker, they could be a clinician or therapist. And those would engage those youth and those placement providers multiple times a week with flexible hours. Again, you know, you just heard in testimony today, not just about the needs of the youth, but in terms of the support that those foster families may need in terms of supporting those youth. So again, this is a very, very intensive model. Again, we're looking at like 1 to 5 caseloads. You know, our overall in our contract, we've gone to 1 to 15 caseloads. But we think it's is a critical strategy in addressing the long-term stable placement for those youth that are having the most extreme placement. In the model, we're thinking that youth would probably be on that caseload about 6 months until it's clear they're in a stable placement, and then other youth could then come into those caseloads. But again, one of those, again, a new strategy that we're just kicking off. We're identifying where those first teams would be, you know, as we speak. I think another piece that's really important, and this goes back a bit to the context that Judith talked about in terms of kind of a case review. I think we have to have a way to communicate regularly the progress of those youth who aren't in a stable placement. So we meet again with the plan presidents in December, and we're going to come up with a common way that we would be reporting out on a regular basis, you know, those youth who aren't in a stable placement and how we're making progress on that. It may not match exactly the indicators in this report, but again, it's a little bit of a proxy for that. You know, if a case management provider says, you know, we have 20 youth who've not been in a stable placement, they've been in night to nights, you know, let's see, are those numbers going down? Can we really see the progress there? And there'll be a standard way to do that you all will know about. We also believe that the most stable placement for youth is often at home with their family. So to increase parent engagement during a child in need of care case, we're in the final stages of awarding a grant for parent support and parent peer mentorship. I know those of you who maybe were part of the summit last year with the judicial branch. I mean, the power of some of the families who had experienced the child welfare system and the ability to help other parents, I think is really, really significant. So we're really excited about that in terms of the availability of those parent mentors. And then another change that we're just making as well, or have just made, has to do with increasing access to treatment transition foster care. That's a payment, that's an additional payment for families that provide services for youth maybe transitioning from acute care or residential care. We're going to increase the eligibility for that for foster families who are supporting youth who have experienced certain times of placement instability, because there may be added needs or demands. Maybe that foster parent needs to take them to additional appointments. You know, there's a whole variety of reasons why there may need to be additional support to that family. So again, we're excited about that. Another piece that was talked about within the report has to do with improving data and management ability. And I think we've all been challenged, and I'll tell you, during the course of this settlement report, I would agree with Judith in the context of the ability to share data, as the ability to try to validate data from multiple systems. I am pleased to say, although the CWIS award isn't finalized yet for announcement, the final contract is with our federal partners at ACF. So once they have approved that, I think we will be at the place where we can announce a CWIS provider. And I think, again, that will still be a long process in terms of implementation, but that will be very significant in terms of having common data, common systems, and the interaction across agencies, not just our case management providers, but across state agencies. We also have issued a task proposal request to add additional assistance to us with some performance measurement and reporting. This was one of the recommendations from CSSP. I think, again, to help us dive deeper into some of that data, really be able to assess that in real time and be able to react in real time. The other thing we've done is to initiate more frequent reviews of short-term placements. Those would be either one-day placements or 14-day or less placements. So we're going to do quarterly case reviews of that. So we have more timely data, again, to see trends or changes and to be able to drive that performance improvement. You know, I would also note, I mean, obviously, as you all know, progress involves a lot of different systems, a lot of different system partners. I do agree with the Center for Study of Social Policy on some type of an escalating process. I mean, she talked about the ability to escalate maybe certain complex cases to address barriers with mental health or Medicaid services. You know, there is a lot of activity that goes on all the time about specific cases. I talked to my folks at ks and my commissioner and my deputy secretary would say, well, we just spent all of Friday morning with case management providers, MCOs, mental health centers talking about, to youth and what those barriers are, how to find the right placement for those youth where folks just are kind of stymied in some cases. So I do agree with formalizing a process. Some states have done some different things. Some states have identified, I think it's the state of Washington that's created something they've called like a multi-system care coordinator. I think a couple of other states have done some things kind of called like individualized rapid reviews, where there's just a process to escalate complex cases. And I think we need to think about, though, in doing that it really needs to add value. I think sometimes I've been concerned, even on some of the case-specific staffings, that sometimes there still isn't the resource that maybe has the idea or the answer that might work for that youth. So I'm committed to designing that process, and I will bring back something to this group as well to look at, because I think it's really important. I think states that have formalized that have seen some success, but I think it's important to identify, which of is it, based on certain levels of placement stability or other complexity where it just can't get addressed. The solution, the best option for that youth it has not been identified at the local level, and we need to bring some more heads to the table, some more resources to the table. Again, I think that has to include mental health. Sometimes it may need to include disability providers, needs to include our MCOs, obviously our case management providers, DCF, KDADs, and some of the clinical review staff at KDHE as well, so in the Medicaid program. So again, that's another piece, I think, of the report that we certainly agree with. Just two more comments and then I'll stand for questions. I think there was some reference in some of the other testimony related to growing the therapeutic homes. We are now at 31 therapeutic homes, so we're beginning to see a steady uptick with the investments that you gave us and the grants that we've made. So we're beginning to see a steady uptick there. Also, in terms of caseloads, and there was some reference to that within this report, and I think also by Appleseed. I think you'll probably hear that from each of the case management providers tomorrow, but you'll recall in our new contract starting July 1, we reduced the caseload expectations to 1 to 15. I know that at least a couple of entities are already there. I believe KVC is already there in both their regions. I think Amber Hope is around 1 to 20. So they're all making progress to get towards the 1 to 15. And again, I think that's important as well. I'll stand for any questions at the appropriate time.
Okay. Thank you, Secretary Howard. Committee, do we have questions for any of the conferees. Senator Gossage.
Thank you, Madam Chair. Thank you, Secretary Howard, for being here. On the bottom of page 7 of 8 of your presentation, you'll see where the recommendation is more than a recommendation. It says, DCF shall end the practice of night-to-night placements of class members by the end of 2021, and then short-term by the end of 2023. But then when we see in reality, periods 1, 2, and 3 have just gotten progressively worse, and they've not been eliminated. Could you explain that for us?
Yeah, thank you for the question, Senator Gossage. Yes, I mean that's correct. I mean, obviously, when we negotiated this agreement, I had every intention and hope and maybe some naivete and ignorance that we would be able to reach that in that 3-year time period. I think as I said earlier, Senator, for the vast majority of youth, they're in a stable placement. We know that 83% of youth had one placement or less. So we're talking about, this cohort of youth that have had an extreme number of night-to-night and short-term placements. And no, we have not made progress on that. I would agree with that. And this is the youth that we've talked with you about that, folks are really struggling within this system. Some of it, we talked to you, I think in the Appleseed testimony, there was conversation about prevention. And we've talked with you about, is foster care the right place for some of these youth? But the fact is, they're in the foster care system. They deserve to be in a stable placement. We need to do the focused work to find out what they need to meet their needs where they are. And that can be about stable placement. That might be about is there a way to find stable permanency for those youth? So again, that's why I think the focus on saying, let's start some very, very intensive intervention teams that have a far lesser caseload, some of the other strategies that we talked about today. So no, we have not made that. We will continue, the way this settlement works is we will continue to measure that. And in order to reach one and essentially sort of graduate from it, we have to reach that final number and then hold it for another year. So we definitely have work to do on that. That's really the cohort of youth we're talking about that we have to place, I think, very, very laser focus on what do those youth need and what strategies are effective in reaching that.
Thank you. And Madam Chair, if I may, I think I could speak for this committee. We would like to know more about that laser focus. What specifically, as an oversight committee, what specifically can you tell us that, whether that's getting back to us a report, we're taking these steps because this is getting progressively worse?
Yeah, thank you for the question, Senator. And we're happy to continue to report back to you. I mean, as I said today, one of the steps we're taking is we will be initiating these intensive teams that are with a caseload of 1 to 5. We're going to be beginning to initiate those during this fiscal year. And youth will be referred to those teams. We're going to initiate a review process to escalate where there are challenges in meeting those needs. We're adding some different resources to support foster families who are stepping up to serve those youth through treatment transition rates. So there's some very specific things, but there will be more as we continue to do some work together. And we also will, as I said, have a way to give you regular reports on what that progress looks like. And we're happy to do that, Senator. So thank you.
Thank you, and thank you, Madam Chair.
Senator Falscado.
Thank you, Madam Chair. And I apologize for my tardiness. The last email I saw is that we were meeting at 10. And so I'm like, hey, I'm on time, but thank you. Secretary Howard, all of these issues that we're talking about today, some of them I know I've been hearing about and talking about since 2004, and when the passage of the Grandparents as Caregivers Act and other legislation, and I've been talking about these issues since DCF was called SRS, Social Rehabilitation Services. And so my question to you is, So I just have to say this. So my problem as a lawmaker is that it continues to be difficult for me to talk to someone. When I hear from individuals, family members who have children within the in the contract agencies or just throughout the community, they'll call me. I'll listen to the long story. I'll try to reach out to the liaison with DCF or child advocate, or I'll call the contractor's office. They are then limited to what they can say to me. I thought Representative Brenda Landwehr and I and others fixed that problem, whereas there would be a way that that social worker could share a little more with the lawmaker to help that constituent and that citizen. But so when we talk about, and we can only talk about our personal experiences, I want to say that DCF has come a long way. Some great things. I've seen progress. I've heard progress of situations where families are children are reunited with their families. Bravo. However, most recently, Madam Chair, when St. Francis didn't get the contract renewed, and then Amber Hope, I'm still seeing some of the same problems. It's kind of like we've changed the name, but some of the same problems are occurring. From my experience, a recent situation where I was contacted, and it's like, we've got a new name, but some of the same people are there. So therefore, the procedures are kind of still the same. In some recent situations that I've been involved in, and again, and I keep documents of everything. My daughters say, "Mom, throw away some of those papers." But Madam Secretary, so I've got the text messages, the emails, the phone calls where I've called to try to get assistance and help, and then I don't, so then I have to fall back on, calling the governor's office or a lobbyist, and then they will intervene for me. And I just want to ask, how can we all help each other with a better way for, because I talk to law enforcement, and then we're all talking, what's a good way for one streamline of communication between lawmakers, DCF, contractors? I guess that's my question. Thank you.
Yeah, thank you for the question, Senator. Yeah, it's a longstanding issue, right? Because, I mean, ultimately, communication is so critical in a system, well, in all systems, right? But I think particularly in a system like this. I think that, my understanding was that the contractors had contact people, and that we, of course, had our liaison. And what I'm hearing from you is that's not always working. I think I need to understand more about that and to identify ways in which we make sure that those needs are being met. Because, so I appreciate you saying that. Also know that you can always call me. My cell phone number is, I think, readily known by many people. I think until COVID, I was able to keep that pretty quiet and just like have my office number be used, but COVID kind of blew that up. So, I mean, you can always call me,
Madam
and I can
Chair,
always follow up as
and-
well. So I'm happy to make sure that folks have that contact. But again, if there are particular challenges with a specific entity, Senator, or if you're not getting what you need from DCF, I will follow up on that, because you need to be hearing back.
Thank you, Secretary and Madam Chair. And Secretary, somewhere during the meeting, I'll get your cell number. I don't have it. And and just kind of maybe email you exactly what I'm saying, and then maybe we could resolve that issue. Madam Chair, I do have a quick question for the young lady that was speaking for Appleseed, if she's still here. In your one of your bullet points of recommendations to us, you mentioned that children were going into the system really fast, just often. So, Madam Chair, forever since I've been in the legislature, I have to say this, in the report, we see that um, African-American children stay in the system longer. They are more represented in the system. And in this room today, there's only one Black person here, and that's me. And I keep giving a suggestion of how we could fix that. But no, it falls on deaf ears. So even in the audience today, the social workers, the lobbyists, the contractors, they're all Caucasian. And I keep making a suggestion of what we can do to eliminate some of these problems, Madam Chair. And just the other day, I got a call, just something as simple as the way Black children need their hair done. Something that simple would make a big difference in the self-esteem of the kids and Black children in foster care. And I keep making recommendations, but nothing happens. And now I'm just the angry Black woman in the Capitol, and it's just beginning to bother me. And that people really don't care. It's just kind of business as usual, and that's not right. And a lot of times, social workers remove children just because they're poor. They remove children just because their culture is different. The way that we do things might be different from the white social worker who is visiting the home, so they remove children. And I just want to say, I got some solutions. I really do, but it doesn't seem that they're being taken. So perhaps they'll take your recommendation of ways that we could prevent from so many children being removed in the first place. Thank you, Madam Chair.
Absolutely. And I think Kansas Appleseed would also be very interested in having conversations with you about your suggestions as well. So, thank you.
All right, we have Senator Baumgardner online.
Ooh, there. Can you hear me now? Having difficulty unmuting.
Yes, we can hear
Can
you.
you hear me? Okay.
Yeah.
Well, first, I just want to start by applauding Senator Fasco, because actually her comments were what I was going to start with. And that disproportional number of children of color going into foster care, staying longer in foster care, not being adopted, those that were eligible for adoption. That is an area that continues to be particularly grievous to me in the state of Kansas. We know that many of these kids that have been put in foster care from South Central Kansas County are being moved all over to all different points in the state, which makes it impossible for those family visits, which are so critical. And I will take it a step further from the kindness and grace offered by Senator Faust-Godot. We have repeatedly had community of come before this committee and other committees, juvenile corrections as well, and they are not being used as a resource. I think all anyone would need to do is look at those individuals that have come forward that want to be part of a solution, and there's our answer. So thank you, Senator Faust-Godot, for beating that drum, because it's real. The numbers are there. The disparity is, there's no excuse for that. And we haven't moved the dial on that. I would like to have a couple of questions for the secretary. First one has to do with, I mean, those of us that have been on this committee for some time are pretty familiar with what was settled class action lawsuit as far as what those goals were to be. So for the secretary, that increase spike, if you will, of one night stays and then movement. Howard, do you get any type of a like a daily or a weekly heat report of something that has occurred that is in direct violation of what is in the from our, do you get a daily or weekly update from our contractor? Just, you know, we have violated this component of the class action law settlement.
Yeah, thank you, Senator. That's a great question. Let me tell you some of the things that I do get, and then also, as I was referencing earlier, wanting to get to a standard way of reporting some of the pieces around the lack of the placement stability. You know, what I do get as it occurs would be any incident of failure to place. So there is reporting that is required to be done through our critical incident process of youth who spend the night in an office. We initiated that at the beginning of the settlement. You know, and again, so that's something I get on a regular basis. I can see when that happens. I can understand how long that's lasting for a given youth if they're in an office for more than one day. I see what efforts have been made to find a placement, those pieces. I don't get on a daily or weekly basis the other piece that you've asked about, which is why I'm wanting to create kind of a standard way to understand those youth who aren't in a stable placement, how many are with each of our case management providers, and being able to track that then on a more frequent and regular basis. I think I mentioned in my testimony, Senator, that like on the short-term and night-to-night placements, you know, we're going to be doing our case reads on a quarterly basis around those. So that we have a little bit more up-to-date pieces, but I still want to just have a standard way to know, you know, as we sit here today, there's this many youth that are not in a stable placement. And how many youth there are, how long they've been in that situation. So that is on the agenda with our case management providers for a December meeting to identify a way in which to do that. Because I think, as I said earlier, Senator, I think at this stage, we have to be, I have to be looking and my team and our partners really on a youth by youth basis as it relates to those youth who are not experiencing that placement stability.
Well, I guess, Madam Chair, my response and just a follow-up question to what the Secretary shared with us. What Ms. Meltzer shared with us was data that heard from 20. So I guess my question for the Secretary is, since you're routinely receiving these reports, we don't hear from contractors at our quarter meetings where they're falling short. So right as of now, are we improving compared to Ms. Meltzler shared with us where we had been backsliding, or is it continuing to get worse? Because you have essentially, I don't know how often you're getting the reporting, but let's say on a month basis, you would be able to tell where we are compared to the year prior. So what areas are we looking worse in based on the findings of last year, what are we improving in? Right
Thank you.
now,
Yeah. Yeah, thank you, Senator, for that question. I mean, you're correct, Senator. And it depends on the measure, whether we have, the frequency of reporting that we have depends on the measure. Some of these are aggregate data. Some of these, as you understand and are aware, are case reads where you have folks actually reading case files to determine compliance. So it really depends. But for example, one area where we are improving that I highlighted in my testimony is the requirement related to timely mental health and trauma screens. We know that when this report was done for calendar year 23, 69% of the children and youth were receiving timely mental health and trauma screens by a qualified professional. As we sit here today, that number's more than 90%, meeting the placement standard, and has been that way for a while now. And again, it's an area where we put extensive focus. We ask for monthly reporting. Again, we also know, for example, as we look at some of the placement moves, that we can track those on a more regular basis. And we know, for example, that that right now, that we know that for 2024, we know there's been about 360 children who had 6 or more placements in the last 12 months. So again, we can track different pieces of the data. Some of these are getting better, some are not getting better. And I think as we talked earlier, the context of youth in offices, I think you'll recall as we met last time, we had a specific increase with regard to the transition in Region 7 with regard to youth in offices. We continue to be challenged with that as it relates to particularly Region 7, but then we have other of our case management providers that have had no youth in office for the entire year. So again, I think one of the other things I probably didn't say is I think the other important piece is beginning to, regionalize that and to say, where in the state are we having the most challenge with this, because I can tell you today, for example, that in two areas, they're meeting the placement stability. So where is it not being met? How do we focus more with a laser in those areas where it's not and what those barriers are? So, we're happy to share the regular performance reporting that we have with this committee. And I do think that some of the case management providers have gotten into the habit of putting that in their regular reports to this committee. But I know that this committee, only meets quarterly. We're happy to share that data on a more frequent basis. Most of that's right on our website. In terms of we could provide you the link to where that information is, or we could find a way to provide it to you when there's a change in kind of the timeliness of it so that you're aware and when there's updated data, if that would be helpful to the committee.
Are you good, Senator Baumgartner?
I just have, I guess, 2 comments, requests. One, since the secretary did talk about the mental health and trauma screens, I don't think that we've ever received information as to where services that our kids that are in foster care, where they act with the MHIT program, and I don't think it's ever really been shared if the foster kids that happen to be in school districts that have the MHIT program, are they receiving services through the schools? And I think that would be something that it would be positive for us to be tracking. The other thing that I think I've seen, and it isn't directly something out of the report from how we're doing on the class action lawsuit, but sometimes it's in a phone call earlier. I think it was just last week with regard to a child that was in foster care that that had died. And I know that the Youth Facility Review Board reviews all children's deaths, but that is something that the purview of this particular committee hasn't been something that that we've really kind of tracked. But if at all possible, either later today or tomorrow, perhaps would be more appropriate so that there's time to get it accurate. But I think it'd be important for us to have a look back this year, this fiscal year, and at least the 5 prior years, how many fatalities we have had of children that have been in the state's custody. Thank you, Madam Chair.
Thank you. Thank you, Madam Chair. Thank you, Senator. With regard to the MHIT program, we're certainly able to provide that data. I mean, as you're aware, foster youth are a priority for that. So we do have information on that and their engagement with MHIT and continue to prioritize that. And I believe we do have the other data with regard to child deaths in foster care. So we will try to have that available tomorrow. Thank you.
Okay, we have a few more questions. We have Representative Ruiz.
Thank you, Madam Chair. My question is also for the Secretary. I had a question about the, on page 3 of your testimony, you have you have a little sentence there about developing the MOU language. Just great. I'm happy to know that that's there. And I said something about this a little earlier too, about no-show rates. I'm wondering about whether that's something that should be tracked, both from the side of the on the provider side regarding the foster care kids or the case managers, getting the children over to those appointments, and on the other end of the BHCs, whether they're able to keep up with all those no-shows, because I've often hear about that, and many times the CCBHCs get dinged for it when it's not under their control.
Yeah, thank you, Representative. That's a great question as well. I'm happy to talk with my KDAD's hat with the community mental health centers about what data they're tracking today about no-show rates. I also know with the new data warehouse that the community mental health centers that we're developing with regard to the CCBHCs, we're part of, we're becoming part of a federal demonstration related to the CCBHCs. So we have to begin to track a whole series of data measures on the behavioral health side. And there will begin to be some data through that system. So I will also check to see if no-show data will be a part of that, and also what data related to youth in care, when we'll have some of that data from that system, because I think that will be really helpful to all of us. It's been really hard on the behavioral health side as well to get clear, outcomes data and access data. So you get a lot of anecdotes, but we don't really have a very standardized way to assess some of that. So that data warehouse is going to be really, really valuable in terms of having some outcome measures on the behavioral health side for the state.
Representative Howerton.
Thank you, Madam Chair. My question is for Ms. Bukowski. I think I butchered that. I apologize.
Zosky, and it's fine. It's a tough one.
Thank you. So we talked about children. You mentioned children refusing placement. I'd just kind of like to hear your perspective on that and what measures we can take when children actually refuse placement versus best interest of the child. I cannot talk today.
So I think I can speak to that a bit, but ultimately I think that the workforce who are working with those kids are going to have a better perspective than I am on this. What I was speaking to is some conversations we've had where they've noted that children are able to refuse a placement. And when I was saying that things were happening where that was occurring and those children were turning those placements down, it was often related to the restrictions in place at that placement. So things like they're not going to be able to have their cell phone and things like that. And because they have the ability to refuse a placement, they do that, and then there's no other placements available, and they end up in an office setting. I don't know the best way to navigate that. I think that there's personally a need to balance, maintaining that child's right to turn a placement down and what's in the best interest of a child. But I don't know what that looks like. So I don't want to claim to be an expert in that area.
Okay, I was more going at it from the child's rights and making them feel safe and what your perspective was on that. So, thank you.
In what we're hearing, I don't think placements are necessarily being turned down directly because a youth has expressed any safety concerns for a possible placement. But yeah, I think what I'm trying to say is I don't know if I can necessarily speak to where that line is between maintaining a child's safety and where we need to have their rights in terms of their ability to choose where they're going. I don't necessarily know if that's something that I can speak to, that we should, take that right away so that they can get into a safe placement. I don't want to claim to be the expert in that area, I guess is what I'm trying to say. Is that?
I just wanted to hear your perspective. Thank you.
Yeah, okay, thank you.
Thank you.
Representative Howell.
Thank you, Chair. My question would be for Madam Secretary. Thank you.
Thank you.
So I'll try to be concise. I know we're running up against the clock. I'll try to, I really have two questions. One is, do you know off the top of your head, when we are collecting data, when information is reported, the data is reported, such as for, in the case files for review for the, for example, for Ms. Meltzer to look at and those kinds of things, do they have access to information like the minors refusing placement, and also information as far as minors refusing mental health treatment, that options that are available to them? Is that something that they have information, access to that information to in their files?
I mean, thank you for the question. I mean, yes, to the extent to which that's reported in the case file, they would see that information. That's
Is
correct.
that required to be reported in their file?
I don't know that that's specific. I mean, I'd have to check. We'll check and get back with you. Yeah.
And then my second question is, my colleagues have done a good job kind of asking questions on the other side of the coin. I wanted to ask, as far as the McIntyre court case and settlement, to your knowledge and recollection, at the time that settlement was made and during the court case, was there any discussion at that point or data turned over at the time to the judge and during that court case about the number of minors who were sleeping in the office that were turning down placement? Was that even an open discussion or data point that was even acknowledged at that point?
Not to my recollection, Representative. Yeah, not to my recollection. The context, at that time, when I had first come into this role, I mean, recall our system had about 7,600 youth in it. It was very chaotic. I mean, we had reports not just of youth sleeping in offices, but youth being driven around in cars all night, all sorts of things related to placement stability. Obviously, we have a lot fewer number of kids in care, a lot more front-end diversion. But so the issue of the youth turning down placement, I don't recall that being part of any of the settlement discussions. Yeah.
I just want to make sure we are we obviously need accountability, and that is extremely important, and we need to end this practice without question. But I also think we need to make sure we're having a balanced perspective and we're seeing both sides of the coin of this issue.
Yeah, thank you, Representative. I mean, it is an issue we certainly have discussed with our case management providers, and they certainly would have some perspective on when they testify as well, in terms of how do you best engage a youth? How do you take into account maybe some of their issues or concerns with regard to why they might not? I mean, I can understand why a child might not want to have their phone taken away. That is their only lifeline or connection to their sibling or whoever to go to a placement. I mean, there's all kinds of things I can understand about that. And I think there are different ways that if that is a situation where that's a reality with a foster parent, I mean, there's different ways that different case managers deal with that. So again, it might be an appropriate question to ask when our case management providers testify. I think they have some insights into that as well.
Representative Humphreys.
Thank you, Madam Chair. I do have a series of questions. Okay, thank you. So first, I'm going to ask Ms. Meltzer a few questions, and maybe, Madam Secretary, you'll need to weigh in on a few of these. But my first question is, who pays for the work of the neutral in our settlement agreement?
The state of Kansas.
Okay, so it's taxpayers. It seems like your report was really thorough, and I appreciated all the information. Thank you. But I just was wondering about who paid for it. Okay, you also mentioned the Kansas Foster Advisory and Accountability Board that meets monthly. Can you tell us who is on that? Or maybe that would be the secretary. And can we see their recommendations that they're giving DCF? I wasn't familiar with that group until today.
So that group was established, as a condition of the settlement agreement. I don't have before me today the list of all the members, but it includes foster parents. It's a range of providers. I don't know if it's providers. It's a range of stakeholders from around the state, but we can get you that list of who's on the accountability board. They do meet, and I'm pretty sure there are published minutes of their meetings, and they do issue recommendations. So we can get that information for you, although the state has it as well, and share that with you.
Okay, it's either way we get it. I would like that information.
Okay,
Yeah.
we'll pull it together if that makes sense and send it to your staff person on the committee, and then you can she can distribute it to you all.
I'm sorry, I'm interrupting you, but is there any way of getting that today? Or by okay,
tomorrow.
DCF
Yeah.
says I'd just like to have it this is a 2-day meeting, and I'd like for them to be able to have that list in their hands by tomorrow afternoon. So,
Yes.
thank you.
Yes.
I think DCF said that DCF said they would take care of it. So,
Okay, great.
all right, thank you.
Thank you.
Representative Humphreys, do you have more questions?
Yes, thank you. This maybe is a comment. It's kind of a question for the committee. But one of the outcomes that was in the settlement was that a placement stability is to achieve a low rate of placement, ultimately 4.44 moves per 1,000 days. Okay, does anyone think 1,000 days is what our measure is? Like, that's 3 years for a child not to have permanency. And it's just shocking to me that that's what the measurement is. Like, I've known it through the years and I've heard it, but today it just struck me like our timelines for permanency are too long. We've got to do something about that. And wow, 1,000 days, that is just not okay. So, okay, that was a comment, maybe a question for the committee if they thought that also was strange. Okay, my next question is actually, the data showed that Black and African American children are overrepresented. I appreciated Representative Howerton's question about that. But what I want to know about that is, as far as youth and children having 6 or more placements during a 12-month period, and who's sleeping in offices and all that kind of thing. We know, we're saying, so we have data on who are the foster children. I would like data on who are the foster families, because there's no doubt a child who's going into a home where the culture is so different than them, and it might not just be Black and African American children, but Spanish speaking children. What home are they going into? I'd like to know that data on who are our foster parents, who are the foster families, like just that demographic, because it seems like that could help that situation if kiddos feel more comfortable going into a home where the people look like them. And what are we doing to recruit more minority foster families? And I would suggest in Sedgwick County, there are so many amazing churches that fall within that demographic. And are we actively recruiting foster families in those churches? Because that's who we need, to maybe help this, children that are overrepresented of, experiencing multiple placements. So I was wondering if we can get the data for our foster families.
Thank you, Representative. We can get that data. We'll need to run that from the state's Claris data system. I don't know if we'll have that tomorrow, but we'll get that to the committee as soon as we can. I do know, with regard to your other question, I mean, our child placing agencies, as they do recruitment of foster families, a number of them do have very active efforts with churches, and there's a very active effort going on in Sedgwick County in particular right now with regard to some outreach to churches. I can get more information from my regional director or from the child placing agencies there as well.
Thank you. And she's doing a great job in Sedgwick County. I really appreciate her outreach and how often she's communicating with us. But Secretary, while you're up here, if I could just ask a question or two. You mentioned that I think it was 87% of youth are in stable placements.
Mm-hmm.
What about babies and children? What percent of them are in stable placements?
Yeah, when I said youth, I meant the whole population, right? So, yeah, I mean, we have that broken down by age. I don't think I have that in front of me right now.
Uh-huh.
But those numbers would be high. I mean, they would be, in terms of youth who aren't in stable placements, the number breakdowns tends to be older youth. So,
Yeah,
so again,
higher.
but that number was an aggregate number. The youth didn't mean to suggest teens. That meant, 0 to 18.
Yes, and I would love that clarified a little bit, in reports and things as far as children versus youth, because I do think we tend to think of youth as like teenagers.
Sure, yeah, that's really
Okay,
my fault in
and then,
using that language.
the whole CWIS question, like, I feel like even the administration before this one put money into the budget to work on some sort of data system. I think I heard that. And I know we have been talking about this for years. And even when you mentioned it today, you said, oh, it's going to take a long time to get this implemented. I'm just like, why? This seems like it would be really helpful for our whole system. And I will suggest that if this was a private business, that we would be able to do it more quickly. And I know government has bureaucracy, I'm just going to say that, but and I understand that that's has to be approved and this and that and okay that, but this has gone on way too long. What can you do to speed up the process?
All right, thank you, Representative, for the question. So there's been the getting to this point where we're right at the cusp of being able to announce a CWIS provider. All right, so which has taken way too long. You're correct. There was funding put in. I think even in the prior administration, but then in the first years of the Kelly administration, first for planning, because these are federal systems that have to go through a whole planning process, and that takes a couple years, and then for implementation. So Governor recommended, you all funded that. That's been funded. the procurement process has just taken a very long time. Some of that just has to do with all the differences related to IT systems in that process. I mean, it just has, but we're at that cusp. And so as we announce a vendor, I think we will then be able to give you a better idea of what those timeframes are for when we may see any pieces roll into place. So, and we're happy to share that with you as soon as we're able to do that. We will have, as with all large IT projects, a couple of, other contractors connected to it, kind of to your point of how do we make sure this stays in terms of the implementation side of it on time, on budget, happens as quickly as it can. So we will have a lot of eyes on that to move it forward, Representative. So
I appreciate that because, I feel like there's a subtle competition between our CMPs. I mean, not, but, just like when they're reporting, oh, we had this many that's been, we had this, there's a little bit of a competition. So, I know the goal is welfare of children. And so just that, how we can help that along, because sometimes I feel like not sharing that data between the 5 groups could be a little bit of that competition. And I will also mention, it does seem like to me there's a little bit of conflict of interest when our CMPs are also CPAs, child placement providers, or CPPs, whatever it is. I feel like I've always felt like there's a conflict of interest. It's not something we've really dealt with, but in that case, they're competing for families. And of course, it's always about funding, they're competing for funding. So I feel like sharing that data and best practices, like was mentioned, would be really helpful. And I'm just assuming you feel the same way.
Absolutely, I do, Representative. And I think, you always have a little bit in a competitive system, but I actually really think that our CMPs are, really come to the table. I mean, even like, say, with the transition of a new provider coming in, and I think as Ember Hope talked about, just the outreach they had from the other CMPs in terms of helping them to get through some things that maybe were new to them, those things. But no, I think as different entities have different ideas, and as we're able to measure those things that worked, part of my desire in meeting more regularly with the CMPs is really to get that germination of ideas across. So that we're really building on things that work.
Yeah, that would be helpful. Okay, just, I'm almost at the end. You mentioned the RFP for the family finding.
Yes.
Did you say that's out or not out yet? You hope it's out soon, and what's taken that so long?
It's being reviewed by Department of Administration right now. What's taken it a little bit longer than I think I might have anticipated is, with some of the new IT processes that were put in place by legislation related to procurement of IT projects, it's considered as an IT project. I mean, it's really more like a software project. So we have to go through a few more hoops on that. But again, the implementation of that will be quick. So I mean, it's a few months implementation as in not a couple years. So again, I think we will see progress on that, in this fiscal year. So so we are excited about that, and think that that can be really, really helpful. In terms of, lots of reasons. I mean, certainly at the front end, from the prevention side all the way through foster care, in terms of relative placements. So.
Yeah, good. So this fiscal year, so kind of you're looking at by the end of June of 2025.
Yes.
That would be
Yes.
great. Okay, this is my last thing, and it's just a piece of information for people. Our presentation from Kansas Appleseed, you talked a little bit extensively about the guardian ad litem situation. And I just want to make sure everyone knows that the Judicial Council has an advisory committee that is looking at the guardian ad litem situation. So I hope Kansas Appleseed, I hope everybody is kind of talking. I know they're doing a anonymous survey among guardian ad litems around the state. And so I hope that everyone's working together so that we can really come up with some good suggestions with the guardian ad litem. So thank you, Madam Chair. I appreciate it.
Okay, we've got Senator Erickson and then Senator Vascadone will be done.
Thank you. I was beginning to feel left out. Everybody else had a chance. I figured I needed to jump in here. Thank you, Madam Chair. Thank you to all the presenters. And It was great going after Representative Humphries because she did cover some of the questions and concerns that I had as well. But I want to ask Judith Meltzer a few questions.
Yes.
As I look at this, and thank you for being here and for this information, it's very helpful. As I read your report, a couple of things really jumped out to me. This is a legal document. I'm not an attorney, but this is a legal binding agreement. Is that correct?
Yes, it's a contract. It's basically a contract between the state and the plaintiffs. And it was
Okay.
ratified. It was ratified in federal court.
Okay, that to me, it carries a lot of weight. We have knowingly, willingly agreed to the terms of this agreement. And I noticed that you had said that there are other, this is not unique to Kansas, dozens of other states are in this same boat, and that you have worked with some of these other states for them to be successful in meeting the terms of the agreement.
Yes.
So what I want to know is, when the state of Kansas entered into this agreement, all of the issues that have been brought forth as to why we're where we are today, and I've looked at the deadlines, and if we look at the 3 areas that we were supposed to meet, I look at accountability, reporting, and implementation. Okay, some were completed in 2021, some are still in the works. As far as practice improvements, they were supposed to be completed by the end of period 1, which was December 31st, 2021. Is that correct?
Yes.
Outcomes, the third area, they were to be completed by the end of period 3, which was December 31st, 2023, correct?
Some of them were to be completed by end of period 3, and then there are some that are extended to period 4. So as I mentioned before, if you look at the chart that we put in, some of them have basically graduated performance standards, getting them to the end of 2023 or the end of 2024.
Okay, thank you. And Madam Chair, I want to make it abundantly clear. I know the difficulty of this work. I know that there are people working every day with this population to try to solve these problems, and I want to thank them for that work and acknowledge that. My concern, though, is having a legal document, and I want to just read part of the report that we received. However, despite focused efforts by the state, it is far from meeting the majority of the anticipated final targets within the timeframes expected in the settlement agreement. So my question to you, Ms. Metzger, is what is the consequence per the legal agreement for not meeting the targeted? And we're not talking about just a month or 2. We're talking, some of these were supposed to be done 1, 2, 3 years ago. And the sense of urgency, it just seems like we just kind of go, well, we're working on it. That's the way government rolls. We're slow. These kids are suffering. We have kids in dire situations. And the fact that we willingly agreed that we could meet these terms, were we not aware that we didn't have a comprehensive communication system when we entered into this agreement? Were we not aware of the level of difficulties? I mean, what our where we were? I mean, wouldn't we have assessed where we were as a state and said, well, you know, we know we need to do that, but we're going to need more time than what we willingly agreed to. So can you help me understand that a little bit more?
So I was not involved in the negotiation of the agreement, okay? But let me just say that there are provisions in the agreement with consequences. So ultimately, the plaintiffs in this case could decide to go back into federal court and allege essentially breach of the agreement. But the agreement also set up a process before they could do that. That first, before they would go back into federal court, the agreement specified a mediator who, on application by the plaintiffs of breach of the agreement, the mediator would get involved with the parties to discuss why essentially the terms have not been met, and see if it's possible to come up with what, for lack of a better word, a corrective action plan that would get the state toward compliance. The plaintiffs have taken that step. They have asked a mediator to get involved, and they're in the process of, I think, arranging that with the state about those conversations. And those conversations would be designed to see if the state and plaintiffs can come to an agreement on what needs to be done to bring the state into compliance with the terms of the settlement agreement. Hopefully, that's going to be a successful process. If it's not, plaintiffs then have the ability, if they wanted to go back to federal court.
That's very helpful. I wasn't aware of that information, so thank you for sharing that. Madam Chair, I would just like to say that I think all of our concern is with the well-being of these children and families. But when we enter into a legal binding agreement, I think that's extremely serious. And it's felt like, to me, being on this committee, a little bit like rearranging the chairs on the deck of the Titanic. When I look at the data and all of the efforts, and we continue to lose ground and sink a little more every year at the expense of these children and their families, it's unacceptable. And I would like a sense of urgency in light of a legal agreement that we willingly entered into, to see more movement, more urgency, more results than what we've gotten. Thank you, Madam Chair.
Senator Fauskadel.
Thank you, Madam Chair, and I'll be brief, and I don't actually have a question. I just want to acknowledge former Representative Charlotte Esau, because she and I and Representative Susan Humphreys and Susan Rees, we traveled together to Seattle, Washington, or wherever we were together. Yeah, to talk about some of these same issues. And so I appreciate your comments, Representative Humphreys. And just for the record, so that I don't forget, if in your notes, so when we talk about the lack of African-American foster homes or adoptive parents, so over the years, a nationally known organization, the chapters in Wichita, the Wichita chapter, the Council of Elders, and they range from age 55 to 75 maybe, and they are all, either they are currently professors at Wichita State University, they are all former educated professional individuals. Madam Chair, they have attempted to become CASAs. They've all been turned down. They have attempted to be a foster parent, and they've been turned down. And so if someone could get, I didn't see her over there. If someone could please get me the, what are the qualifications, the criteria, so that perhaps I could share it with them so that they could address those issues before they apply again. But they would like to be, but the majority of African Americans in Wichita that apply, they're turned down. And we just don't know why. And I think, Madam Chair, and everybody else on this committee, we heard from a reliable person, Benita Gooch, who is the publisher of the Community Voice newspaper. And her dad was a former senator, Senator Rip Gooch. She applied to be a foster parent and was turned down. And she testified on one of our committees virtually, and she cried because she wanted she has one daughter to this day, and she wanted to foster or adopt another child for a playmate for her daughter. She was turned down. And that's the real question. So if the DCF could provide me with that information so I could share it with them to help solve this problem for the kids that we're talking about. Thank you, Madam Chair.
Yeah, and thank you all for all the questions. I thought you weren't paying any attention. So, no, I'm just kidding. I had a couple questions that were covered by others. But I do have a couple comments to make just of things that were brought up, just to build excitement for this meeting. Um, We do have CASA coming this afternoon. Scheduled at 4. Dina Gage is the new state director for CASA, and so we'll be able to ask her this afternoon some of those questions. There were some questions brought up, or comments, I believe maybe Senator Foscato, that regarding kids being taken into care due to poverty. We are going to have some discussion on neglect, the definition. That will be coming sometime during this meeting. I believe it's tomorrow. And then another thing we've talked a little bit about is reporting, reporting from the providers. And we have been working, we've asked them to go ahead and report this time the way that they have been, but we're working on some questions, criteria, data to get some uniformity to what they're reporting. And we'll have a document for discussion tomorrow afternoon when we look at recommendations, so that we'll all have some input on what we're asking them to report. I think that was all that I had on my mind. So are we ready to move on? Okay. Thank you all, and thank you, Judith, for being with us today on WebEx. So our next presentation, as you know, I've still been working with Casey Family Programs, and Simone is here again. If you haven't seen her, wave, Simone. If you haven't seen her familiar face, she's just been a godsend. She helped me with a speaker again today, and I will, you talk about a difficult last name. I'm going to introduce Ann Heligenstein. Is that right? Yeah. So let me read your bio real quick, because I think it's important for us to all know who we have addressing us. She's here today to discuss strategies for safely narrowing the front door to child welfare. Ann is the Texas Strategic Consultant for Casey Family Programs. She began working for the foundation after retiring from the state of Texas, where she served as the Commissioner of the Department of Family and Protective Services. Prior to leading DFPS, Ann served as the Deputy Executive Commissioner for the Texas Health and Human Services Commission. In that role, she managed the state's Medicaid, CHIP, TANF, SNAP, and refugee assistant eligibility programs. In response to a gubernatorial executive order, she led the effort to reform Texas' child welfare system, including significant improvements in medical and behavioral health care services for children in foster care. Ann served in the White House as the Director of Policy and Projects for First Lady Laura Bush, as Governor George W. Bush's Director of Health and Human Services Policy, and as legislative policy consultant for the Texas Catholic Hospital Association. Ann has a BA from the University of Texas at Austin, and MS from Trinity University, and is a fellow of the Eli Board Foundation Superintendent's Academy, which trains and develops education leaders throughout the country. So thank you. Welcome for being here. The floor is yours.
You're very gracious to read all of that, Madam Chair, and
important to know.
Vice Chair Gossage and Ranking Member Osley. Thank you. The last time I visited with this committee was in 2018. Representative Owsley, I really enjoyed working with you and with then Senator Kelly, who was Vice Chair of the committee. You know, I have to say, when I retired, my 30-year sentence from the state of Texas, I retired and joined Casey. One of the big benefits of working for Casey is the opportunity to have a panoramic view of what's going on across the country. And I learned so much from states like Kansas. Since I was here last, I am so impressed with the work that you have done. As legislators, the investments you've made, the changes in state policy, I really have to acknowledge Secretary Howard and her team, and seeing Governor Kelly just continue her steadfast commitment to improving the lives of children and family. There is a lot other states can learn, from Kansas. Some very, very impressive work. So what do I want to talk to you about today is really some steps your colleagues in Texas, the Texas legislature, took to narrow the front door of children coming into the system. Families being investigated, children being removed. You've had such a rich discussion this morning about the issues and all the steps that you're taking to address that. But this is really to focus on the front door. How can you reduce the number of families being investigated and the number of children coming into care? So I'm going to go to the first slide. I have someone helping me here. One more, yeah, there we go. So, and you guys know this stuff. I'm not telling you anything you don't know. I mean, job one is safety. That's what child welfare, child protection is all about, is safety. We have, huge volume of calls coming into the hotline. Many of them aren't reporting imminent risk. What's going to happen to this child here and now? Do we have time to react in a different way than intervening and removing children? We know nationally 100 calls, only about 15 end up getting services. So it really tells us, well, what about the front door? What are we doing? We have a high volume of intrusive investigations of families. Senator Faust-Godot, you spoke about that and what's happening in your community. And when we have such a system that's so overburdened, we end up diluting our ability to address children who are truly unsafe. And honestly, when we have a system that's like that, we anger families, we frustrate caseworkers, and we certainly alienate mandated reporters. Well, I called and nothing happened. So you certainly have that dynamic as well. So if we look at the next slide in the national data, you'll see that. So you have 69% of the children, and I'm sure Kansas is no different. This is the same number for Texas, but really the reports are for neglect. Only 10.3% are for physical abuse and sexual abuse. So of this, when we look at who comes into foster care, 75% are victims of neglect only, meaning there is no physical or sexual abuse. That's been alleged. One thing that this drives then is disproportionate removals of our African American children. That is the outcome of a system like that. And what is that driven by? Poverty. And we're really looking at issues of how do we help families and not actually go in and take their children, but what do families need to be able to keep their children safe and nurtured? So this slide now is just a little bit of picture of Texas and what we look like. So we are a state-managed system. It's a statewide system that we have. We have 254 counties. We break that down in terms of regions. We are following your footsteps, and we are transforming into a community-based care system. So about half of our children right now are in community-based care. The other half are still with the state agency. It's a big state. It takes a while to roll all of this out and to be sure that our providers are ready to accept this duty. We've taken a lot of steps, and we've actually cut in half the number of children in foster care. And about 82% of our children who are in care are in family-based settings. What the legislature really wanted to focus on was limiting government intrusion, keeping children safe, and supporting families, keeping the families together. So I'll jump to the next slide. And we jumped too far, maybe? Yeah, I think we jumped too far. We should be on a slide that says Texas policy changes. Oh, here we go. Thank you. So as we look at this, these were a lot of changes that the Texas legislature made. And when we were first going in that direction, we were often, people like me who'd been in the business for very many years, are we being blinded by familiarity? We can't make change because this is the way we've always done it. So I'm not going to go through all of this, but I'll touch on each a little bit as we go through the slides. And the kind of things, the steps that the legislature in Texas took. One thing they were really addressing was the overburden of the system, but something that I'd like to call the safety paradox. When you have a very intrusive system, we disrupt our trust in working with families. We create fear and trauma from our families, from government knocking on the door. Do we have a paradoxical effect of children are now less safe? Now, intuitively, like I'm saying, we're not to be blinded by familiarity, but if you think about that, what do families do? They're in fear, they hide, and they won't ask for help. If they ask for help, is government going to knock on the door? So that's really, one of the things we were looking at. So how does Texas prioritize investigations? We have priority 1, priority 2. And priority 1 must be responded to within 24 hours or less. Priority 2 in 72 hours. All reports that meet the legal definition of abuse and neglect are automatically transmitted to law enforcement. Law enforcement has it all. It's all transmitted electronically to hundreds of different law enforcement jurisdictions across the state. So they are aware. But all investigations are done by the state agency, by the Department of Family and Protective Services. They operate a 24/7 hotline. That hotline is available to caseworkers. That hotline is available to law enforcement, not just to report, but if law enforcement is at a home and they need to know, wait a minute, who are the adults in this home? Is there a sexual predator in the home? They can call the hotline 24/7 and immediately find out if there's some pre-existing information on that family to help them understand what the risk might be. I'm going to talk to you a little bit more about the role of law enforcement in Texas in a few more slides. One of the other steps that the legislature took was no anonymous reporting. How many of those calls to the hotline come from anonymous reporting? And if there's truly a safety issue and the individual wants to remain anonymous, they can call 911. They can do that. But the legislature changed that opportunity of taking anonymous reports. On the next slide, we have a couple of opportunities to explore, but you're already doing that on Family First. My encouragement would be continue to leverage Family First, community services, not just for the children, but for the adults, mental health, substance abuse treatment for the adults as well. So continue to do that, and you're doing some great work in that area. So now let's talk about the definitions of neglect. What you're going to see here is this array. And I have to ask you, how many of these are safety? How many of these are risk? And how many are these, gee, I wouldn't raise my child that way, or I wish it were different from this child? But is it safety? So when you talk about educational neglect, that's not a safety issue. Now, I'm not saying that's optimal, obviously. You want kiddos in school. You want them to grow up to be productive adults. But is that really safety? And that's what a child protection system is all about. It's to do that. So Texas legislators looked at the family code, and we had a long array of this is neglect, that's neglect, this is neglect, that's neglect. They finally just cut it all away. And if you look at the next slide, you'll see that they crafted a very specific definition of what is neglect. Now, again, I am not talking physical abuse, I'm not talking sexual abuse. That rises to a whole different standard of safety and immediate intervention, and if you can't keep the child safe, removal. But what we went to is there has to be a blatant disregard to the child's safety in terms of a definition of neglect, not a shopping list of what may and may not be, but actual blatant disregard. The caregiver, the parent, is doing nothing and leaving the child in a risk of immediate danger. That is the difference. And that language changed substantial risk to immediate danger, and that is the standard. We really have to be able to balance safety and risk. That's the trick. If we go to the next slide, you're going to see a lot of other things that the state legislature implemented. And what's really, really important here is judicial process, due process for parents. Can we ensure that that's happening? And that is what the Texas legislature went to address. And they have a number of things. I don't need to read them to you. You can see on the slide here. But what is and isn't, safety issues. And these are the steps that they took to really limit that intervention. We no longer do non-emergency removals, which means that unless something is going to happen here and now, and we don't have time to get to a judge, you do not remove the child. You have the opportunity for judicial review. So along with redefining neglect, eliminating anonymous reporting, and now also not allowing for non-emergency removals. Those are discretionary removals. In that case, then there's time for the department to get to court and have judicial review for the parent. And as they do that, there are many of other opportunities the department can take to keep the child safe in the home. It might be grandma can come over, can get there quick. It might be the non-offending parent will be willing for a parent safety placement. I have my best friend over here. My children are attached to her. She will take care of the children to resolve what's happening in the household. We do immediate check of who that best friend is to make sure that there's not a safety issue. But again, when you have a 24/7 system, you can do that. The next protection for families that the legislature took are Miranda rights. Our DFPS caseworkers actually tell the parent, here are your rights. We do it verbally, we do it in writing. When we knock on that door, we have to have permission to enter the home. The parent can say no. Now we can get a court order, an order of investigation. We can make sure that that's happened. But we make sure that they have that. These are the steps, again, I won't go read them to you, that we take to ensure parents are aware of what are their rights, and now by law. The other thing that we've done is alternative response. Alternative response is very different from a quote-unquote investigation. Just the word investigation is pretty intimidating to any family. Alternative response is a very different process. We've got a call, it's come to the hotline, it's accepted for review to contact the family, find out what is going on and what can we do about that. This approach, it doesn't put blame on the families. It looks for what are the strengths in that family, what can we leverage to keep the child safe. The approach is, okay, what do we need? Ask mom and dad, what do you need to help keep this child safe and keep the child with you? So you take an approach of trying to connect to community resources. We know that parents love their children. And all of you know when you take a children from a home and we think it's so awful and how can it be, that child's trauma and sorrow from being taken from that home is overwhelming, and it lives with them for a lifetime. Again, what's that family's response going to be in the future? Is it the safety paradox? I'm not going to ask for help. I'm not going to do that. I'm going to relocate. I'm going to make sure that you don't find me again. So do we end up having more unsafe children because of an investigative approach? You can see the numbers there. We've done really well. We're increasing. We're expanding alternative response across the state. But of the 41,000 some children and cases that were completed last year, only 132 resulted in removal. Now, some of those families, we offered what we call in-home services, where regular caseworker visits, etc. But only 132 out of 41,000 actually were taken from their home. So that's just some food for thought too. The last thing is having a straightened partnership with law enforcement. We need to support law enforcement, and we need, as the state agency, protection agency, we need their support. And the Texas legislature recognized that. I will tell you, a number of years ago, there was some interest legislatively in taking investigations away from the Child Protection Agency and moving it to law enforcement. And that did not happen. And I can tell you some of the thinking that went on as to whether or not that would have been a solution. Like every state, of course, we said had some horrific child deaths. And so the response was, wait a minute, we need the police to do this, not child welfare. But they didn't go that direction. I can tell you what we did do is we brought in law enforcement experience and expertise. We embedded it into the agency. We have a team across the state called special investigators, and they conduct these types of things right here so that we have that expertise in-house, and that just strengthens the partnership with law enforcement. But let me touch on some of the reasons why the Texas legislature didn't go forward in taking a law enforcement approach for many investigations and removals. First, consistency and fairness. We have one state agency, consistently trained staff, managed through 11 or 12 regions, just given size. When we looked at the number of law enforcement agencies that would have to be consistently trained, that's 2,700 agencies and 60,000 law enforcement officers. The ability to be consistent, to be highly trained, to be fair. What is that community standard? Are we going to remove a child in Dalhart in the Panhandle because mom and dad smoke weed? Never would happen in Austin, Texas, I'll tell you right now. That ain't going to happen. How are we going to do that? What is the difference between how we treat a family in El Paso and how we treat a family in Port Arthur, 800 miles away? The ability to be consistent and fair and training investigators to do so. Trauma. We looked at whether or not having a police officer in uniform with a side weapon. What is that trauma versus a caseworker? Both are intimidating, but I think intuitively we have to know law enforcement knocking on that door must garner a different level of trauma than perhaps a social worker. The other thing is caseworkers can immediately establish a relationship with the family. It's not, hi, I'm here to take your child away. Hopefully that's not. It's, okay, what's happening here? Who are the resources? Where's grandma? Okay, I'll wait for grandma to get here. If you're really gonna work to help the family and keep child safe, you have to establish a relationship. And that relationship is key to safety. And law enforcement does a fabulous job, but that's not their job. is to be able to establish an ongoing relationship with the family. Caseworkers also have the tools. They can immediately find out, wait a minute, we know this boyfriend. We can call the hotline, get information instantaneously. This boyfriend is a sexual predator and he's just moved houses. We can find out that kind of information immediately. We can find out if there's already an open case and who's working on that. So we do all of that. Law enforcement and the state agency work so closely together. Sometimes law enforcement comes to a case, a situation, let's say mom is driving drunk and there's 2 toddlers and it's 1 a.m., 2 toddlers in the back seat. They call the hotline. A caseworker is immediately dispatched to the site to make arrangements for children in the car. Now, it's a big state, 254 counties, a lot of rural area. We place the staff all across the state. Our goal is to meet law enforcement and handle the situation with them within an hour to an hour and a half. In the meantime, the unit supervisor is in constant communication with the officer. We got someone coming, they're this far out, they'll be there soon. Do we need car seats? All of that kind of information. But that is such a strong partnership. When we get cases of abuse, physical and sexual abuse, we may, even though law enforcement already knows of the allegation, we'll reach out to them. Or we know that this is a dangerous situation. So the partnership is very, very strong. And I think that makes a big difference. We cannot lose law enforcement's role in keeping children safe. So some of the things that we're doing there, let me just jump ahead. So does any of this work? Have we made more children unsafe by taking this approach and narrowing the front door and ensuring parental rights and focusing on what does the family need, asking the family what they need? And I have to say, I'm pretty pleased. The data shows, I'm not going to go through it, but yeah, children are no less safe in Texas after we cut the number of children in half in foster care. They are no less safe. And, of course, we measure this data constantly to do that. I have to point out, when we cut the foster population in half, disproportionality is a big problem. And I am pleased to say that when we looked at that 50% reduction, all demographic cohorts were the winners. Do we still have disproportionality? Are we still removing more African American children than what they are in the percentage of the general population? Yes, but we're definitely going in the right direction. And I think that's really key. So here, this next slide, these are some of the things you've already heard about, all of the things that Secretary Howard is already doing. And I have to say, it's so remarkable hearing her and all of the work that she's doing and to do that. So let me just close here. This is one of my most favorite quotes. If we run to the next slide. Don't save me from my family, save my family for me. That's a foster youth talking about what's wrong with the system. And I think that is so key. How often do we ask the youth, what do you want? What do you need? We've talked about placement and children, refusing to go to a placement. Are we bringing the child to the table and say, okay, what do you want? What would work best? How can we find the right place? Texas, too, we're also the subject of a lawsuit. We also have a steep problem in making sure that children are not in offices or hotels, that they're in licensed placements. We have taken that on intensely. And we went from having 400 children in unlicensed placements during COVID. We got it down to about 200, and then it just stayed. We kept pushing forward. We got it to about 60, 70. But we couldn't get it lower than that. In September, we were down to 9 children in the entire state of Texas were in unlicensed placements. Now that number will float, but it has never exceeded 20. When you think about 20 children in that category, but a state that large, I have to credit the state agencies that came together and made that happen. It's excruciatingly intensive work, but they did it. And I have to really give them a lot of compliments for that. So I know you've had a very long morning, and so I'm going to stop there. But please, if you have any questions, anything that you'd like to ask, please do.
Okay, thank you. Could you talk about, it's my understanding you are partially privatized. Could you
Yes.
explain how that works?
Okay. So the legislature decided really that we wanted to be closest to community. So the decision made a few sessions ago, our legislature only meets every other year. They don't meet every year. But several sessions ago, they decided to privatize foster care. Now, what that includes in Texas is not only the placement of children and the management of foster care, but each distinct contract also does the case management. So we're going to have about 10 providers across the state. Again, we have to do work regionally, just by necessity of geography. And we're about halfway through geographically, and halfway, about 52% of the children right now are in community-based care, which includes case management, foster care, adoption, reunification. The other piece of how we did that was we did it in stages. First, the community-based care operator became the broker of building a network of foster homes and caregivers. Then when they're ready, then we moved in case management. We're about to go into the third stage, which is good performance earns more reimbursement. Bad performance means we have to go into corrective action and take other steps. So we're learning a lot, and we studied Kansas, we studied Florida, and we really moved slowly in doing this. We won't be fully rolled out until 2029 to do that. So, but we appreciate Kansas and Florida because we learned so much.
So you will be fully privatized at that point. So when we say you're partially, it's because you haven't completed the process.
Oh, geographically, I'm sorry.
Yeah, well, no, I've just heard it in other
Now,
forums.
investigations will stay with the Department of Family and Protective Services.
Okay.
That activity will stay. Yeah.
Okay. A question from Representative Humphreys.
Thank you, Madam Chair. My question has to do with some of your definitions between neglect and abuse. And so just a couple of examples, like on page 5, in blue, it says restrict the authority of state to remove children for non-safety reasons. So, okay, non-safety. On page 6, the priority 1 and 2, what it differentiates is if it could result in death or serious harm, right? Okay, and then on page 10, I think it is, your new definition of neglect created an immediate danger to the child's physical health and safety. So my question is about mental health.
Right.
Because that new definition of neglect is only talking about physical health and safety is what it says.
Well, no, this is just the definition of neglect.
Yes.
The legislature did not change the definition of physical abuse or sexual abuse.
Yes, I know, but my question is, where does mental health fit into that?
Okay, yeah. So obviously you can that's a really good question. Thank you, Representative. Yes, mental health is a big driver. If we look at the characteristics of the parents from whom children are removed, you're going to see mental health and substance abuse. And you're going to see that quite often, and those are driving factors. So it's really, really key to have the community-based services to meet those needs.
Yeah, and I think maybe you're misunderstanding my question. I'm not talking about the mental health of the parents. I'm talking about the mental health of the child.
The child.
That it seems like you're focusing on It's only neglect if it affects their immediate physical health and safety. And that's concerning to me because I think we know that, children, maybe they're being well fed and maybe they have a place to sleep, but they are neglected in many ways at home. I mean, I'm just going to give this an example. Like, we don't think it's okay for children to stay in offices overnight. Their physical health is not affected by that. It is detrimental to their mental health, right? So we do care about children's mental health, but we're leaving it out of the definition of neglect here. And I just am curious what your explanation for that would be.
Well, for mental health, if we do enter into a family, we get someone that meets the definition. If the child needs services, then it's the caseworker's job to help link that family to services, to be able to do that. But we recognize that the removing of the child isn't going to improve their mental health. We have to find a way to help them do that and to help families know what services are out there. Now, fortunately, and I'm sure the same is here in Kansas, insurance coverage for children is pretty broad between your CHIP program and your Medicaid program. So that's really the effort of reaching out to families and letting them know, here are services that you can leverage to help your child. Behavioral health is a big one, particularly as the children age and become teenagers. Yes, but the presumption isn't that that need should require removal of a child.
Okay, that's helpful. And then my last question is, I don't know if Texas, what they do about truancy, but we still remove children from the home because of truancy. And, that does not meet this definition anywhere. And so I guess maybe, I don't know if that's a question for you or a question for the department, but I am interested if we're thinking of changing that because, yeah, truancy does not fit this definition.
Right, and if you looked at the chart, let me see, if you looked at the chart where kind of the array of what states include, that would be page 9. Yes, you'll see educational neglect, you'll see maybe a harmful environment, you'll see medical neglect, failure to supervise. It's such an array, but what is safety? Now, is it optimal that the child is truant? Is it optimal the child hasn't gone to school? No. But CPS, Child Protective, can't do it all. Their job is safety. Other systems should be addressing many of these things and not the protection agency. It's safety, safety, safety. That's their job. And they can't, there's no way Secretary Howard can do it all. She has to be dependent on mental health, on behavioral health, on Medicaid, on school systems, on communities, on churches. And to expect more of that from a single state agency, my own opinion, won't be productive.
Okay, thank you. That's very helpful. Appreciate that.
Representative Ruiz.
Thank you, Ann, from one Texan to another.
My fellow Texan.
Fellow Texan. The restricting of the anonymous reports of abuse and neglect, I'm so happy to see that. Was there, I'm going to say dramatic, maybe it wasn't dramatic, but was there, could you notice the drop in child removals, or even the calls, dropping once that was taken out?
That's a really good question, Representative. What really, a precipitous drop. The new law went into effect like September of 2021, redefining neglect and not allowing non-emergency removals. If you look at the data, our fiscal year is September 1, September. If you look at what the removal rates were on August 31st and what the removal rates on September 30th, it fell off the cliff. Absolutely fell off the cliff. I was shocked how fast it happened. I have to say, not allowing non-emergency removals and having due process, judicial due process for the parents, made a big difference. But the definition of neglect also made a big difference. Yeah. Those two things happened in the same statute.
And I assume Texas has the law about the duty to report. I mean, to make calls to report abuse. And that is still in effect, and maybe, was it strengthened at all?
That's another great question. So we're talking about mandated reporting. Texas has a universal mandated reporting statute. So you, I, grandma, everyone has an obligation legally to report. Mandated reporters are those who are professionals in the field. So law enforcement, teachers, medical, they are obligated to report within a very short time frame. They have a time limit, 48 hours, they've got to report. Last session, the legislature looked at redefining mandated reporting, all reporting in the state of Texas. And a bill came this close to passing that would have eliminated universal reporting and encouraged mandated reporters, which is where most of your reports come from. That's really where they come from. To see, can you leverage community resource? The pediatrician is kind of worried about mom. You know, is mom really well enough informed, you know, how to take care of this child? What does mom need? I see the child is malnourished. What does the child need? To really encourage mandated reporters to think about how they can direct the reporter in a different direction than having the safety agency knock on the door. One of the things that we've recognized, and I've done work with the American Academy of Pediatrics on our own pediatric society, teachers, law enforcement, you have to have liability protection. If the pediatrician says, hey, here's a really good community resource, I'm gonna send you this direction, and then something tragic happens, she can't afford to lose her medical license. A teacher can't afford to lose her certification. So we're working right now with the legislature to introduce that bill along with legal liability protection. You acted in good faith. You tried to get the family resources. Therefore, the finding against the reporter for failure to report goes away. So we're working right now with members of the legislature to push that forward for next session.
Thank you, Madam Chair, for another follow-up. A follow-up to that, is that going to be extended to all professionals or just the medical professions?
No, oh no, that would be because teachers have certifications, mental health practitioners have licenses. So it would be all of those. Now, I'm encouraged. There seems to be a lot of interest in the Texas legislature to consider such legislation next session.
Senator Erickson.
Thank you, Madam Chair. A follow-up to that. You're sparking all kinds of questions, and thank you for being here today. Is, do we know how many, and maybe this is a question for our research or staff, do we know how many mandated reporters have lost a license or, you know, part of their livelihood for failing to report? I would have no idea. So, thank you.
I can tell you in Texas, we don't know. I can tell you that often the institution that the practitioner works for, maybe it's a hospital, maybe it's a medical practice, maybe it's the school principal, you know, the institution is in fear of a parent coming back and suing and saying, well, or grandma or somebody, dad who's absent, but he comes back and says, well, you should have done something because mom was taking drugs. There's this over-reliance on report everything, just report. And I get it. We taught providers to do that for decades. And now we're asking them, hey, maybe that's not the best solution. So that's why the legal liability is such an important factor, Senator.
Representative Howerton.
Thank you, Madam Chair, and thank you for being here. This was absolutely fascinating. I want to focus on the Miranda rights for families. And if you could just expand on that, maybe some details about that, because this has been a concern for me since I came into the legislature, and I was able to talk with Simone during session about this. And I love this idea because a lot of families aren't aware of their rights. They don't know. They are traumatized by the knock on the door, and I mean, they're just in fear and they're reactive. And
Sure.
I'm very, any details you can get on that would be great.
They're never going to ask for help again, are they? I mean, they're never going to risk that. They may relocate. They're not going to do that. And we all know, all of us in this room, if Child Protection knocked on our door, we'd probably call a lawyer, right? Families don't know that. Now, I'm not saying call a lawyer. I'm just saying they have a right to know what their rights are. And if we still have concern that, no, we need to investigate, the safety of this child, we can get a court order. And we get a court order to do that. And I have to say, the judges in Texas, they have been a big, big, big moving force in making these changes, and especially in the racial inequity. Our judges have really been at the forefront in addressing racial inequity and how we investigate and remove children. Our Supreme Court has a Children's Commission with members of the Supreme Court and others. I happen to serve on it. The commissioner serves on it, and has really taken the leadership in educating judges across a large state on how important that is.
Thank you, Madam Chair. And just to kind of change a little bit of direction here, we've had some cases where the judges have decided or made some decisions for foster care or adoption. Does Texas have any kind of appeal process for that? If it doesn't line up with DCF or some kind of other recommendations?
Yes. I mean, there is a judicial appeal process. Now, that, like in any state, for any family, that could be very expensive. But yes, that is possible. The role of the Supreme Court Children's Commission is to educate judges. It's hard to do. There are a lot of judges out there. Some are just child protection judges, and they're experts. And then some are doing, I got a criminal case, oh, now I got a mom and dad case, I got to go back. And that education is so critical. We have jurists in residence that judges can call and seek advice. What is happening in this case? What can I do? So that's really important too, because they're trying to do the best they can, but it's complicated.
Senator Pascal.
Thank you, Madam Chair. And I want to say that your speakers and the lineup of individuals speaking today here is, I love it. It's amazing. Thank you. And thank you, ma'am, for your presentation. And as they say, they do it big in Texas, right? So when you talk about law enforcement, I want to ask, so how does that look? So for me, in my district, sometimes if, let's say that there's a domestic violence issue and the police come, and a lot of those individuals don't know their rights and they are afraid to call. So they will call me. And so then, they'll put a police on the phone, and then, even our law enforcement have spoke before this committee before, saying that sometimes if it's after hours, they have no alternative other than to take a child to the children's home, or maybe they stay in the police station. I think Kansas has moved forward somewhat of an 800 number, I think, whereas law enforcement can call, but still, it's hard for everybody to kind of communicate. We're still working in our silos. And so how does your program look that includes law enforcement?
It is complicated. Again, Senator, you're absolutely right. First of all, we do not intervene in law enforcement. So if there's domestic violence and boyfriend is beating up on mom, and the 911 call is, we're not called out on that. that is, criminal action, something's happening. Law
Madam Chair,
enforcement might
but
remove the.
a lot of times, so they will remove children.
Okay.
They will remove children. Let's say that both parties go to jail. So we need somewhere for the children to go. And like I said, they are afraid, so they call me, and we would want those children to maybe go to grandma's house, etc. But I just try to give that as an example of how the police might become involved. Maybe there's a phone call that something's going on, but I just want to know, how does it look for your law enforcement, their involvement of what you presented? Thank you.
Sure. Law enforcement would not remove the children. Law enforcement would handle the perpetrating adults. They would immediately call the Department of Family and Protective Services, and a caseworker will be deployed to the home. While we're getting there, we'll be asking the police, will Mom give you any names? Does Grandma, does Aunt Jane, who can come over? We're immediately trying to work on the phone to find out what the solutions are before the caseworker can even get there. Because it's a big state, it might take a while. We had a case I was visiting about the other day where Grandma was in Oklahoma, was more than willing to get to Dallas, but she needed time to get to Dallas. The police, we would hold the child in the home until Grandma got there. But police do not remove, law enforcement do not remove. They immediately contact the 24/7 hotline, and from the hotline, a caseworker is deployed to the home. Now, police would have to stay there, to keep an eye on the children. Someone would have to be there until the caseworker comes. And then it's the caseworker's job to find out all the information they possibly can from mom or dad, whoever, from the children, if they're verbal, about who do you know? Where's your auntie? Who's this? Who's that? And we start establishing that relationship on site. And police can call at 1 a.m. on a Saturday night, and we go. We have to go to meet that need. So the presumption is we will first find a way to keep those children safe. Mom and dad might be going to jail, and that's law enforcement's decision. But, we will try and find a way to keep those children safe. If there's no other way, then of course that's an emergency removal, and we'd have to immediately follow up with a court order for having taken the children.
And just be aware, that's the way they do it in Texas. That is not the way it's done here.
I'm sorry.
About half of our intake is through a law enforcement.
Okay, I apologize.
No,
we're the experts on Kansas.
No. I wasn't trying to correct you on anything. I just wanted to make sure the committee realized that that's the way you guys, and we could learn from you with some of that. So.
Well, and likewise, I've learned a lot from Kansas when I look at your mobile health hotline, when I look at the investments that you've made in mental health, when I look at Family First, when I look at all of those things, I learn a lot from other states. And I've learned a lot just preparing for today's meeting about the things that I can take home to Texas.
Soul, take soul home. That's a great one. Yeah. Representative Johnson.
Thank you, Madam Chair. I am former law enforcement, and then I also did child abuse cases for the state. I found the special investigator position at that time was very helpful. That was in the early stages because there was such a discommunication between law enforcement and the social work aspect of it. I am very interested in knowing the statutes or getting some information from you on this anonymous bill that's being presented, because I have had to investigate how many of those are divorce cases, and then they just keep throwing them in, and the social workers are stuck with it. I'd really like to take a look at that this year in our legislation at some level. So I'll get that from you. I will be in Texas in 7 or 8 days to meet with some of my friends that are in sheriff's offices and down in the Washington County, Brenham, Texas area. Yeah. Yeah, I've always worked, I have several close friends there, and they would have access to that. I could start asking and getting some of the information from them on this. Okay, because I find that very helpful to one-on-one to be able to talk to them. And you're telling me Texas may still consider it? The anonymous,
It's law. That is law. So I'm
but
not,
doing away with the changes on mandated is what I'm hearing.
so in terms of moving forward and first of all, not requiring everybody who lives in Texas to report, the discussions on the table for next session are to eliminate that and then to give mandated reporters, professionals,
Correct.
other routes to take and have the legal liability protection by trying to help a family without just calling Child Protective Services for everything.
Who would you say in the Texas legislative system would be a really good contact?
Sure, I can gladly get you that.
I would like that.
Okay, absolutely.
I know
We
a
can get
couple
you
of the
lot more
legislators
information.
down at, like I said, in the Washington County,
Okay, sure.
what's the next county, Somerville, in that area. So I really appreciate what you've said today. Thank you. Thank you, Madam Chair.
Representative, if you would like to meet or visit with, we can do it by Zoom, we can do it in person with the leadership of the Department of Family and Protective Services and learn more about how we do investigations. I will be more than pleased to set that up for you. In fact, our number 2 person over the whole division of investigations for the state is a former sheriff. And a lot of the special investigators that we hire are retired, or, maybe it was, how long can you do Houston? Some really tough jurisdictions. And so we've been able to attract some terrific law enforcement to come into our culture, and we learn more about their culture. Because as you know, social work and law enforcement, that translation wasn't always there, so it helps a lot. Thank you.
So any other questions? Oh, Representative Ousley.
Thank you, Madam Chair, and thank you, Ann. Welcome back to Kansas. I think the committee's really taken all my questions, but you've given us a lot to think about, and I'm glad to see, Kansas learning from Texas and Texas learning from Kansas, and I just wanted to say thank you. Since I heard about the reforms and the removal and the redefinition of neglect from the Parents' Miranda rights, I've been intrigued. So I just wanted to say thank you and welcome back.
Thank you. I enjoyed reconnecting with you, Representative. It's been a while.
So, you've talked mostly about Texas, and I was aware that of the changes in your definition of neglect. Are you familiar with other states moving that direction? Is that kind of a trend across the country?
Chair Kunkanen, that's a good question. I know that this is a national issue. And it's certainly one that, Casey has been working with states across the country on. I don't actually have an inventory. There is a federal website where you can read the definitions online. So there's a federal website where you can read the definitions for every state of what is abuse and neglect. And we can certainly get you that link if you'd like to look at that. But no, this is a national movement. It really is to do that.
Okay. All right, good. Any other questions? So committee, we've had a lot of information this morning. Keep in mind, tomorrow afternoon, we will be talking about recommendations. So if there's something that you've heard today, I know that we did a bill, we had the Child Welfare Bill of Rights, and that addressed the child's rights and the foster parents' rights, but we have not done anything on the parents. And I really feel like it's time to look at that. And so that's something that we need to bring up for tomorrow.
If I could say, the political nuance of Kansas and Texas, it's very similar, very, very similar. And I will say that it was conservatives in the legislature who really moved this kind of change. And to recognize the trauma of children and the rights of parents. And it really was both sides of the aisle were on board. This was not a political issue at all. And, whether you're from Austin, Texas, blue Austin, or red Amarillo, the legislature came together. They really did.
Oh, that's good. I think that's been part of the success of some of the things that we've gotten done is that if you watch our Child Welfare Committee, you don't know the Democrats from the Republicans. It's very apolitical.
It's very impressive. It really is. I wish I could say all states behave that way. Not so.
Yeah, when we're talking about the kids, it shouldn't be politics.
Shouldn't be.
Okay, are we good with questions? Okay.
Thank you all for having.
Thank you very much for traveling and being with us today. Somehow or another, we finished on time. It kind of happens that way. So we are going to break now for lunch, and we will come back at 2:00. So thank you. I think we've got enough of us here to get started again. So next up, we will welcome back Secretary Howard to give us the DCF update.
Thank you, Madam Chair. Yes, so this will be more the regular foster care update that we do each meeting. So today we'll do some of the by the numbers pieces that we do. We also wanted to talk a little bit about efforts underway for timely permanency, which I know we spend a lot of time talking about diversion from care and placement stability. We probably don't spend as much time as we should talking about timely permanency. I know that came up as well this morning. Some basic foster care updates, and then I have a couple of deeper dives related to the technology-assisted HCBS waiver, and then a little bit of a snapshot related to foster youth and the PRTF waitlist. And then I'll close my testimony with just a heads up on some legislation that DCF is looking at proposing for introduction this session. So starting out on page 4, you're familiar with this slide. The number of children in foster care, again, continues to decline. It's been fairly static actually in the kind of the first quarter of this year, but again, continuing to see that 24%, 25% reduction since 2019 reflected in our numbers. We also like to look at the number of children entering care, not just the total number. So on page 5, you see that number. And if you look at the far right side, if you see the 2,578, that's how we ended the last fiscal year. With 2,578 youth. So again, as we talked about last time, that's a 42% reduction since 2018, and the lowest I think we've seen in terms of entries since about 2007. For the first quarter of this fiscal year, you'll see that number of 659. Those are the number of entries we've had in July, August, and September. So if you were to multiply that out, you'd see that we would continue, I think, if those numbers stayed throughout the year, we'd again continue to see numbers close to last year or possibly a little bit less. Let's see, page 6, just again, kind of a reminder related to the rate of entry into foster care. You can see how the Kansas numbers have gone down. But again, I would remind you, and you'll see something on a couple of slides from here, that we're still far above the national average and certainly above, when Texas talked about their numbers today, they were significantly lower than the 3.84. And actually our numbers for, as we go into 24, I think have gone down to 3.7. That'll be on an upcoming slide. But again, even though we've made a lot of progress there with our efforts around prevention, some of our case model pieces, I think the sorts of things you all have been talking about related to just the construction of our statutes and the wide front door that we have, certainly contributes to the rate of removal of children into care. So we're pleased with the progress, but we know we're still really out of line with some other states nationally. A couple more data slides on page 7. Just comparing the children entering and exiting care. So again, just a reminder of state fiscal year 24. When we ended last fiscal year, we had about 325 more children leave care than enter care. And so far this year, it's been fairly even, but about 25 more children leaving care than entering care in the first quarter of this fiscal year. So as you can see on that slide from 2019, we've continued that pattern of having more children enter care than exit care than enter care each year. So again, contributing to the overall decline in the total number. I mentioned slide 8 already, the decreased rate of entry into foster care. This looks at some data really through March of 2024, which was the most recent data we had available, which would show that Kansas number again beginning to go down a little bit. But again, as we know, we're still above those national numbers. As we look at the context of children entering care, I wanted to maybe try to dive just a little bit deeper. And as we looked statewide at the reduction in the number of youth entering care between 2023 and 2024, we had a 13% reduction of children entering care. And we kind of wanted to dig deeper and say, with our various efforts in prevention, some of the other front-end efforts, how does that distributed? Are there certain age groups where we're seeing more of a decrease than others? Are those happening among children? Are they happening among older youth? But what we found was that the decrease in children entering care was evenly distributed across age groups. We're talking about a number of about 382 children and youth here. So we saw 108 fewer youth age 13 and older entering care, but there really wasn't a substantive difference in the percentage of youth entering care as a proportion of total entries into care. So again, just trying to dig deeper and understand, sort of the breadth of the efforts and where they're having impact. The next couple pages are a couple of slides you've also seen the last few meetings that look into both the primary removal reason and the requester source for entry into care. So on slide 10, again, the primary removal reason, that as we look at, I'm going to go to state fiscal year 24, the next to the last set of bars, 61% of youth were removed for a reason of abuse or neglect. 39% fell into that family in need of assessment category, which could be behavioral issues, could be the truancy, parental substance use, things like that. And as we look at the current year, just looking at the first 3 months, where we captured just that first quarter, those numbers were pretty similar. A little bit higher on the abuse and neglect side, a little bit less on the family in need of assessment side. I think, again, back to many of the conversations you were having this morning about what that front door looks like and what those definitions look like in terms of entry into care. The next slide you've also seen a few times, and this has to do with kind of the requester source for foster care, whether that requesting source is DCF or not DCF, and not DCF would be, law enforcement or the prosecutor's office. And so again, as we looked at state fiscal year 24, less than half of the requests for entry into care came from DCF. 54% came from law enforcement. That shifted a little bit in the current year, where we're seeing about 60% in the first quarter with the requests coming directly from DCF, about 40% through law enforcement or the prosecutor's office. So, but again, as you look over the last few years at least, you see some variation of around, a 60-40, 57-43 split in terms of those entries into care. So again, that's kind of just more a update of data that we share with you every time, but I think it's maybe particularly relevant given some of the conversations and discussions we've already had today. I wanted to spend a little bit of time talking about efforts underway for timely permanency. We spent a lot of time with this committee talking about the 4 questions, but we talked about the 4 questions at the front end in terms of the kinds of questions that could be asked before a child was removed into custody. Coming out of the Judicial Summit, we developed 4 permanency questions. So not just asking at the front end, but when a youth is in care or a child is in care, what might be appropriate questions to ask in terms of why that child can't go home safely. And so on the right side of slide 13, you kind of see those 4 questions. And again, these are kind of still being morphed a little bit, and maybe a little bit different in different districts that are trying find this out, but, what's the current safety concern that prevents us from sending the child home? If there is a safety concern, are there aftercare or other services that can address that concern? If not, what needs to happen by, a reasonable time frame, right? Next week, 2 weeks, tomorrow, to satisfy the safety concern. And if a safe return isn't possible, is the current permanency plan appropriate? And that kind of gets into sometimes into like the concurrent planning. If at some point a safe return isn't possible, when do we move to a different permanency option? So we're participating in some local implementation teams, and there's a project through the University of Kansas, through the Kansas Brave, where 4 judges in Douglas, Geary, Lyon, and Wyandotte County are working with KU on the implementation of these. And then Shawnee County, at the local level, decided after the summit that they wanted to do this as well. So again, Shawnee County is currently reviewing the questions, looking at adjustments for how they might, how they might use those questions. And KVC is using the questions in their work and documents alongside families in Shawnee County. We are going to have a common evaluation tool because we want to know what impact this has. Is it leading to more timely permanency? Is it not? Is it leading maybe to some differences in the sorts of case plan expectations that are put at the front end? I think one of the things that was really powerful at the judicial summit was that conversation that sometimes the family may be, asked to do, 15 different things, but how many of those have to do with the actual safety of the child and their ability to be safely at home? So again, we're working with KU, and we'll have a common evaluation tool of the counties that are doing that. So again, just intersecting some different things in the practice to get to whether or not that can have an impact on having more timely permanency. On page 14, also relating to permanency, although these also impact placement stability. I actually talked about some of this morning in my testimony about the settlement, but I think a number of the behavioral health efforts are also really intended to get at the issue of timely permanency. The availability of functional family therapy, the MHIT in schools that Senator Baumgartner talked about, the expansion of some of the therapeutic foster homes with coaching and positive supports for parents, the parent peer program that we're getting ready to award as well as the caseload size reduction on July 1. And then incorporating, lasting safety planning into the court reports, kind of what I just talked about in those 5 counties. Because, in many cases, if we can provide the right supports and services to the family, can the child go home safely with that family if they're assured to have the appropriate aftercare supports? And you can see in this circumstance, we're really talking about a lot of those circumstances where there may be some behavioral health issues. So we're excited about some of that because as the data would tell us, and I think that the data on the next couple pages, tells us that the average time in foster care for all children who ended care in Kansas in state fiscal year 24 was 24 months. Most children have achieved permanency through reunification. 53% of youth in fiscal year 24, their average length of time in care was 11 months. We also know that the average months in care for adoption is 42 months. And we're on a federal performance improvement plan because we're not meeting the federal standards related to permanency. And you can see that on the next couple pages, pages 16 and 17. Just kind of can show you that we're just a little bit less than the national expected standards in terms of permanency, lengths of stay. So permanency in 12 months, you can see our data show 30.1% of permanency in 12 months. So that's short of the national performance of 35.2%. And that includes no matter what the permanency was. It could be reintegration, could be adoption, could be custodianship. guardianship. And as you extend that out, for those youth who didn't achieve permanency in 12 months, we also have standards to meet there. And we're not meeting that in terms of those youth who didn't achieve permanency in 12 months. 36.3% of those are achieving permanency. They're exceeding the permanency in the subsequent 12 months. The national standard would be 43.8%. And again, when you stretch that out a little bit more. So I think even though we don't talk as much about this, and there's certainly a huge impact and connection with courts on this factor in terms of the length of time to permanency, it's an important facet to focus on. We've spent a lot of time on placement stability, but sometimes I think that sometimes with the same youth, we might be able to find a way to find stability through permanency, as well as, in lieu of a stable placement. Sometimes the best stable placement for the child is to be able to go home. So again, some specific work there. We'll have some measuring of those outcomes and sort of see what those efforts look like. Let's see the next area, more generally around foster care. On page 19, just reminding you of the case management areas and the new contract that started July 1 with Area 7, changing from St. Francis Ministries to Ember Hope. And then a couple of updates on some very specific pieces. On page 20, this committee talked a number of times about federal funding for legal representation. And in fact, a few years ago, heard a presentation from one of our states north of us, and then talked about this again at a few other meetings. Last August, we notified the Office of Judicial Administration and the tribes of our intent to take advantage of the federal funding opportunity. So we've been doing some intensive work, particularly with the counties. We've had an information call that the Kansas Association of Counties helped us to host that we sent to county courts and managers. And so, I mean, this isn't like an answer like it funds all of the costs of having legal representation in a county, but it does allow some match. So, and so just a reminder of that. Assuming a county pays an appointed attorney $1,000, the total allowable 4E costs would be $230. And that's a long, complicated formula that has to do with the number of youth who were, quote, 4E eligible, which goes way back to welfare reform and AFDC and TANF. It doesn't really matter. But again, 50% of that can be drawn from the 4E foster care grant. There has to be a match of the other 50%. So bottom line, if a county is paying an appointed attorney $1,000, we can give $115 towards that. So again, it helps. I mean, it helps if counties and localities are trying to, provide those attorneys and support that. So the county would still cover about 89% of the cost. We'd cover about 11% of it. I think we've had a couple of inquiries this week from Douglas County, and I think Douglas County and Norton County are the first two counties who've reached out to say we'd like to understand more about, what do we need to do to get this going. So we're excited about that. We'll keep you posted as more counties come to the table because we've had to design kind of a whole process for how we'll reimburse them for those costs. So excited to get that going. The second foster care update I wanted to give had to do with SOL. Since July 1st, we have had the first two SOL family legal permanencies have happened where those youth are actually out of custody. They were both in Northwest Kansas, I think one in Republic County, one in Cloud County. And we have one additional youth right now who has a case plan goal of SOL. So we're excited about that, the first two youth. And when I think about that, I mean, these are youth who, might otherwise, be in our care until they age out. So these are two youth now who have found permanency through SOL and another one with a case plan of SOL. So again, I really wanted to bring that to you because I feel so grateful to this legislature for your support of an entirely new concept in the nation, and so I think a lot of states, it might have taken more than a year in front of a legislature to get approval for that, and I appreciate your willingness to travel along with us and to support that and to support those young people who came and made such a compelling case for that. So let's see, page 22. I talked about this earlier today, but again, in terms of a new initiative, what we're calling the Family Support Network that will provide parent peer support. We're getting ready to issue an RFP. So there will be statewide psychoeducational support groups for parents of youth in foster care. There will be opportunities for advocacy services and to help those parents who might be facing barriers. And then there'll be a development of peer supports, and then just working with the case management partners to provide educational materials, resources, advocates, and supports to parents of youth in foster care with a goal of reintegration. You know, you had some of those conversations this morning. I don't think this answers every need that parents have, but I think it's an important step in terms of having both peer mentors and making sure that those good resources for those parents who are struggling with the system. I remember, gosh, 25 years ago, a friend of mine in the system always said, you know, we have, we have GALs and we have CASAs, and she was always like, where's the FASA? Where's the family appointed special advocate? So again, I think this is one tool I think that can help support that can help support parents. So we're excited about that RFP going out. One more piece I wanted to mention. So I know sometimes we talk about some of the education pieces in this committee. And for the longest time, we've had some challenges of youth in foster care not reflecting correctly in the Kansas State Department of Education's, data systems. And so when they're not correctly matched, there can be a lot of things that happen that that can impact those youth in important ways. So, for example, it could impact access to free and reduced lunches. It could also impact other added supports given to foster youth in schools. So, folks have been working really, really hard. I mean, sometimes this is as simple as like, a middle initial isn't there, or things like that for the whole compatibility piece. So, it could be an issue with a hyphen or a birth name, a date. So DCF is working really, really hard on this with partners to reduce this. So in the month of October, we went from having over 1,000 children incorrectly matched down to 150. So we made a lot of progress in that. And so we're really excited about that going forward and how that can make that education experience and the supports to those youth more beneficial. So, every single one of these things, I mean, it's just a lot of just digging deep down into the details, right? And so I really give a lot of credit to my team members who worked with others to achieve this. So. All right, a couple more maybe specific topics. I think last quarter we talked a bit about youth who were on the intellectual and developmental disability waiver in the HCBS program. And how those supports are offered. And I think we were asked to talk a little bit about the technology-assisted waiver. And for those of you who may not know what that is, if you don't live and breathe the Bethel Committee and Medicaid every single day, the technology-assisted home and community-based services waiver, those are Medicaid services that can be provided to allow kids to live in a home setting, could be with their parents, could be with a foster parent who would otherwise be growing up in a hospital because of the complex technologies that they need. So these youth are they're likely attached to technologies related to feeding, related to breathing, very, very complex, medically fragile. Without the life-sustaining technology, they would not be alive. So this waiver has been in place in Kansas for a long time. We do have some youth in foster care who are on the TA waiver. And similar to the IDD waiver, these youth are getting services through the TA waiver, but then we also pay foster care case management payment to those families. And that daily rate can vary, based on the family's needs and the needs of that child. We don't currently have a specific rate that we apply to each youth on a TA waiver. And unlike the HCBS waiver, on the Medicaid side, these are individualized rates for each of those youth. There's not kind of tier levels like there are on the IDD side. So we start out with youth who are on the TA waiver being eligible to receive certain rates that can be higher than the basic rate, but the rate they actually receive is made through an assessment by the case management provider of each child. They assess the level of the care. They assess the needs that are being met through Medicaid. And then there's also the ability to request an exception to get an exception to increase the payment rate to the highest eligible rate. And I would have to say that I think we've approved every exception that I've seen. I mean, these are really, really vulnerable youth. The foster parents who've taken on this care, I mean, lots of demands on those foster families. But you can see on page 28 just a graph that would show that out of the 26 youth, we have 26 youth on technology-assisted waiver who are in foster care. 38% get the highest level of care possible. 58% receive an exception to what would be the equivalent tier rates in IDD, and 88% are getting a rate of more than $90 per day. So again, we're trying to pay close attention to that. I know we've had some cases that kind of slipped through, and we followed up individually with some of those families. I would say as part of the work group I talked about last time that's been working on the IDD side, we're looking at how can we have a better process for establishment of these rates. And so we're working with advocates and partners, and we'll have some proposals that come back to us to look at some processes and rate structures that don't necessarily call out any specific waiver, but really look at what are the needs of that youth and that family so that they can meet those needs. I mean, the foster parents who've stepped up to take care of youth with these intensive needs, I mean, just incredible gift to the state. We need to support them in any way that we can to make sure that their needs are being met. Sometimes it can be hard because, for example, what might happen is there may be a workforce challenge on the Medicaid side. So perhaps the specialized nursing service that's supposed to be in the home a certain number of hours a week suddenly isn't in the home that many hours, or some other specialized support. And so sometimes it's making up for those pieces and making sure that there's enough resources to support the family as they're trying to address those needs. So again, just a little bit more detail on those TA foster youth. The last large area I was going to talk about before sort of giving a highlight of our legislative pieces has to do with some work that we recently did looking more deeply at foster youth who are experiencing a wait time for getting into a psychiatric residential treatment facility. As I said earlier, those of you on the Bethel Committee see the wait list for PRTFs every quarter, and that wait list always includes some youth who are in the foster care system. So we wanted to get a better sense of who are those foster youth. And so really looking just for a month in October, looking at those youth, what are their characteristics? And so just kind of did a deep dive. And I think it goes back to some things we talked about today. We wanted to find out, are these the same youth who are experiencing high placement instability? What are the characteristics of these youth? So again, just a couple pages about that, and then maybe some reflections about what we think that means. So we looked at, in late October, we looked at 32 youth who were on the PRTF wait list and 3 youth who had been on the list but had recently been denied admission to a PRTF. We wanted to understand the population and figure out some ways to concentrate our future efforts. So as we look at that, just on a snapshot of a date, 60% of them were in the 15 to 17 year range, 21 of the youth. 9 of the youth, or a quarter, were 12 to 14 years. And then we had 5 who were within 6 to 11 years old. I mean, in terms of those youth awaiting the PRTF placement. When we looked at those youth, we found that almost 60% of them, 57% of them have a goal of reunification. You know, again, pretty consistent with the total foster care population. However, very few of them were placed with relatives or kin in care. Less than 6% placed with relative or kin compared to, you know, almost 50% in the general foster population. And that most of these were included in some of those regular staffing reviews that I talked about that our case management providers are doing. So a couple more pieces there. You can see some graphics that just sort of reflect what I just talked about. You know, a high proportion in group or residential care. You can see in the graphic on page 33. So 37% in group or residential care. You know, we're a state that doesn't rely on group or residential care very much, and we're always around 90% in family-based care, you know, family foster care or relative. And again, so more in group or residential care, 14% actually in a hospital setting, a more acute setting, waiting then for that step down to a PRTF. And again, significant proportion with the reintegration as their goal. So as I just said, kind of you can show the details of their placements again on slide 34. I mean, again, nearly 1/3 in a family foster home compared to 47% of all children in foster care. So far fewer and higher proportions in group care. We also know that 57% of that youth had 6 or more placements. So when we talk about that unstable cohort of youth we were talking about, in this just group of kids in this month, 57% of those were youth who'd had 6 or more placements in the past 12 months. But about 40% had not experienced any one-night placements, and 3/4 had had 2 or fewer one-night placements. So again, a little more than half of those youth having 6 or more placements. And as you look at that chart, you can kind of see as well just how that plays out in terms of the number of placements. So just a couple more pieces of data and just maybe a reflection. 83% had not had a previous PRTF admission. Almost 50% had not been placed in a QRTP, but again, 57% had those 6 or more placements. So if I mean, just in terms of just some reflections on that, I think there's still a lot more to learn about it, but we do see, you know, a high number of youth age 16 or older who came into care in the past 12 months, not as part of a sibling group, and who have reunification as their case plan goal. I mean, so if you've got older youth coming into care without a sibling, reintegration as their case plan goal, I mean, this really talks about really those youth who are coming into care, I think, unfortunately, to try to access services because families don't know what to do with those youth who have some serious mental health issues. They're coming into care. And so I just tend to think, you know, wouldn't it be great if we could really concentrate those supports on what their families need at home to be able to support those youth? And so I think that tells us a lot about that, and also about additional strategies we might need to put in place related to entry and exit from some of our therapeutic settings, whether that's PRTFs or acute care hospitals. And so again, just kind of one snapshot, but I think it helps us again to understand at least part of that cohort of youth we're talking about with their significant mental health needs. You know, I feel like my whole career, we've had conversations about kids coming into care to get services, and we know there's nothing special about foster care for getting access to mental health services. And so again, this tells us a lot about what we could do at the front end, or even if they've come into care, what would that family need in terms of intensive supports for them to provide those supports for their youth. So again, just a snapshot. There's probably more that can be learned from that, and we will as we dig deeper into that. But I just wanted to share just some of the kinds of, kind of deep dives that we're trying to do to better understand that population and what some strategies might be. All right. The last thing I was just going to talk about today briefly was just to sort of give you a heads up on what might be DCF's legislative agenda pieces. And so on page 38, we have 3 priorities that we hope to work on with all of you. Some of those may end up overlapping, and some things maybe the committee already wants to work on. The first has to do with secure care. We would like to, we want to introduce legislation that would reduce the number of days a child in the custody of the secretary can be authorized for secure care placement by a court from 60 to 45 days. This would make it parallel to what the requirement is on the juvenile justice side. I mean, so that kids in foster care would not be committed to secure care longer than, juvenile justice youth can now be. So this would make the law parallel to what it is for juvenile justice. The second has to do with permanency. We plan to introduce legislation that would reduce the number of months within which courts must hold a permanency hearing from 12 months to 9 months. And there could be some other variations in there as we work on that legislation related to age of the child or things like that. But reducing that number of months within which courts must hold a permanency hearing from 12 months to 9 months. And then the third one that you've already been talking about today would have to do with the definition of neglect in our statutes, so that we can distinguish that poverty is not neglect and prevent separation of a child from a parent solely due to poverty. We'll have some other front-end pieces in that legislation as well, as similar to some things this committee has talked about, as we think about really understanding and making sure that there's an assessment of the child being at risk of harm and the harm that can come from just entry into care. And obviously, I think this neglect piece, it probably goes without being said, but I think the distinguishing poverty from neglect is also, again, one of those really important tools as we think about the whole issue of disproportionality in foster care and the high representation of African-American youth in care. So again, more details to come. We'll begin to reach out to stakeholders and other partners as we begin to work on this legislation. So those are our priorities for the 2025 legislative session. Be happy to stand for questions.
All righty, thank you. That's whizzed right through all of that. We've got, okay. Senator Foscadell.
Thank you, Madam Chair, Secretary. That was a really, really good presentation, great information. So I'll start from the bottom up, just a couple of quick questions. So the legislation changing from 12 months to 9 months. So would you be taking in consideration of something you said earlier, which I really, really appreciated on page 15, where you talked about 53% of the reunification. That's amazing. Thank you. So, but would you be taking in consideration of your legislation changing that time frame of those biological parents, let's say, completing that list that they may?
Yeah, thank you for the question, Senator. I think our focus with wanting to change this time frame is, I think, just to put a bit more emphasis in our statutes on the importance of permanency in child time. It's not necessarily intended to say this is an exact time frame by which parents would complete a list. And we also want to make sure that list is focused on what it takes for that child to be safe to go home, right? But I think to put more emphasis on that, nothing stops the courts from meeting more frequently or those sorts of things. But we have seen that there's been an increasing trend across the country in changing that in statute, sometimes to 9 months, sometimes to 6 months, or sometimes to 9 months, but then maybe a lesser amount of time for the youngest children, knowing that when you think about if you're an infant and you're in care, 3 months is that can be 100% of your life or 75% of your life. 3 months in care for a 14-year-old is a much smaller fraction of their life. So again, our point though is the opportunity, I think, to focus more on ensuring that permanencies are happening timely and that we're getting to the right case plan in a timely manner too.
And thank you, and Madam Chair. So in that list that you talked about, if the parents are completing the requirements for that reunification, and you said as long as they're moving forward, you're addressing that. Anyway, I've been talking about that for a long time. I just want to say thank you. I appreciate that. And then finally, I want to say the legislation soul. So the other night, I was with Alexandria Ware.
Sure.
She received an award with the Kansas Urban League for her advocacy for kids in foster care. And it was beautiful. So
Oh, that's fantastic.
yeah, so thank you.
I wish I would have been there. I probably would have cried. So congratulations to her. So
Thank you, Madam
yeah,
Chair.
absolutely.
Representative Humphreys.
Thank you, Madam Chair. Just a few clarifying questions. This is, we were just discussing this on your slide number 13. Those 4 questions, are those the same questions? I was thinking the 4 questions that we got from Iowa were about deciding if children are going to need to be out of the home. Are they, but so this is something separate.
Yeah, let me clarify. I might have gone through that a little bit too fast, Representative. Thank you for the question. Yes, the 4 questions from Iowa were at the front end to set before a child would come into care, and asking things about the child's safety. Could someone move into the home? Could the child go someplace else? But just asking these questions, what could be put in place to provide safety? So that was really about diverting from care. What this is really about is when kids come into care, what's getting in the way of them being able to go home? And are we focusing on safety or are we focusing on other things at that point? And so it's based off of the 4 questions at the front end, but it's intended to be, as workers might be doing the court reports and as the judges, because it's the judges that are really working on this, like with KU, when they're looking at, when they have a family in front of them for a hearing, that they're asking themselves that question. They're not just, well, the family did, they've made progress on these things on their case plan and they're going to their therapy and they're doing this and that, but they're then asking themselves additional questions. What's the safety concern today that prevents us from sending this child home? Maybe the parent hasn't checked off everything on their list, but is there a safety concern? So again, looking at that piece of, are there some just artificial things we've sort of put in place, or just having a different mindset that says, if we really believe that the best place for a child is with their parents, if they can be there safely, let's make sure we're talking about safety when we're making our decisions. And so again, these are new questions, but they're based on the Iowa questions. But again, instead of trying to divert from care, it's about how do we get youth out of care in a timely manner back home safely with their families.
Okay, that makes sense. Yeah, thank you. And then that 4th question, if a safe return is not possible, is the current permanency plan appropriate? That's a hard, like, when do you ask that question? That's kind of, that is the question. When do we decide that it's time to change the case plan from, and you don't really have to answer, but if you have a thought on when you wrote that, or whoever wrote that number, question 4, was how did you think about when is that appropriate to ask that question?
I think the point of that question, I didn't write the question, but I think the point of that question was to make sure that that's always in people's minds, to say that you don't necessarily say, let's just wait for another year and come back and look at it again. So I don't think there's obviously not a global answer to that, because every circumstance is going to be different. But I think Perhaps asking that question might lead to some efforts to do more concurrent case planning. If it would appear that things maybe aren't progressing as one would like them to, maybe one's not looking at changing that case plan today, but maybe one begins to do some concurrent planning so that at the next check-in, maybe it is time to do that. So again, there's no global answer. Every circumstance is different, but this is really just about having folks remember that, time in the life of a child is really, really important.
Yep.
So.
Yeah, that's good. That's interesting. Concurrent case plan. I've never heard anyone mention that before. So, I mean, if, it's the cases I've seen, it's reintegration. Okay, now we have a whole new team. The family, the child gets a whole new team. Now we're into adoption. So if we're doing concurrent case planning, that's awesome. So
that would be the sort of thing that could happen in this kind of.
Yeah, that would be great.
Sure.
Okay, Madam Chair, may I ask, okay, thank you. And then the next slide on 14 about the parent peer program. So that I'm kind of understanding that that's one of the things that I'm just curious if like those peers could be awarding a parent peer program. So that's like someone who's going to be paid to be a peer.
Mm-hmm.
Because I'm just curious, is there not any opportunity for like people to volunteer to be peers for families that, big brothers and sisters, but more one family to another family? Or, I mean, have we ever had that, or have we considered that rather than paid parent peers?
I think there have been circumstances where that's been in play, in different communities or things like that. I think the part of the value of this is making sure that they're more, directly connected with the case team, that the voice of that person who is a peer is considered in planning and in that work and in that support. So I just think it's really valuing that voice and knowing that for many parents with lived experience, like in the foster care system, it might be important for them to be able to have that, as a reimbursement or as a job or those sorts of things in order to be able to do that on a regular basis. So I don't think it rules out volunteers, but
Yeah.
I think.
I mean, even if it was organized, because someone, was it you that just mentioned instead of CASA, FASA?
I did.
Yeah, so CASA they're volunteers. It's a program, but they're volunteers, so it would sort of be a similar kind of thing. I just was curious if that was but FASA sounds very interesting.
Yeah, it wasn't the concept of the process. I mean, and like I said, I think a lot of this came out of really some of the conversations at the summit, and some of the parents who spoke at the summit, and then some of our case management providers have tried to bring on peers, and some have had some barriers to doing that. So we felt like maybe having a statewide contract that would help identify some of those families and those peers might be really helpful. Plus, we could build in some of those education pieces that families don't receive today.
And I remember that at the summit, and one of the things I was interested in, though, was, of course, families or peers who have lived that same experience, but other people who haven't necessarily lived it, but could still be helpful in being mentors and that kind of thing. I mean, I just wouldn't want to rule out.
Oh, no doubt. And I think different providers may use different strategies. And I mean, gosh, I remember just myself as an individual, when I was like in college, I was like in the Big Brothers Big Sisters program, and I actually was a big sister to a kid who was in foster care. I mean, so I think all those things I think are really valuable. Some of those mentor programs, some of those other kinds of youth programs that are more volunteer based within given communities, I think often include the foster care population as part of the population they provide supports to.
Okay, and then this is a super quick question. So, on the slide 20, the legal representation for the 4E funding, that I'm glad we're kind of looking into, because we've all been wondering about that. But remind me, that's legal representation for the natural families? Who is that for?
Yes.
Natural families. Okay, thank you. And then my last question. Kansas is in a federal performance improvement plan to improve timely permanency. What can you give us specifics about that plan? What are they saying we need to do?
Sure. I mean, well, they don't tell us what we should do. I mean, they, so states go through what's called the Children and Family Services Review every, 6 or 7 years. I might have my time frame wrong. We went through it a year or so ago, maybe 2 years ago. Time flies. But so for any area where where you're not meeting performance as a state, every state has to then create their own performance improvement plan. And that's not just like DCF doing it. It's DCF with court partners, with community partners, with case management providers. And so this happens to be one of those areas where, as you can see on those charts, we're less than the national standard for that. So we've put in different strategies in our performance improvement plan. One of those is the 4 questions for permanency that we talked about. I think there's some other things in there as well. Our performance improvement plan is actually on our public website, so we can actually make sure the committee has a link to that if you.
Okay, that would be great. That's what I was wondering. Okay, thank you. Thank you, Madam Chair.
I am going to jump in here because I have a question that follows up on what one of Representative Humphrey's, when talking about the Family Support Network, is that, where's the funding for that coming from? Is that something that you'll request in the new budget, or what's the status on that?
We funded it internally. You won't see that as a funding request.
You won't, okay.
Yeah.
It's just helpful for us to know that, or my colleagues anyway. I won't be there. And I don't want to get too much in the weeds asking about any questions on the tier rates that you discussed, because I know I can get too detailed on that. But I do want to ask you on so if a family has a disagreement on what their assigned rate is, what kind of a process do they have to dispute that or appeal it?
Can I defer to Deputy Secretary Keys just for
a second? Of course you can, yeah. Hi, Tanya, welcome.
Hi, I'm Tanya Keys, Deputy Secretary, DCF. So that's managed. Certainly they could escalate or elevate that worry through a supervisor or through a manager at the foster care case management provider. Also, the exceptions for rates, if that would be coming into play, are heard by our administrative teams. And so they can also, that individual foster parent could reach out to DCF, administration. So there are a number of different doors for that.
Okay.
Yeah.
So I think that the situation that we had talked about previously must have just fallen through the cracks, because I think that they had tried to reach out to DCF, and when they had talked to their contractor, they'd hit a ceiling on that. But thank you very much for taking care of that. I've followed up with them, and they're very, very satisfied.
You're welcome. We put in place 2 or 3 years ago, we do have at DCF itself some specialized staff related to Medicaid and mental health. So they work really, really closely on all of these kinds of cases and the policies around it. So.
Okay. And then one more question on this. There's a name that was provided to me by that family that was making these decisions. Her name was Shane Height. Does that sound familiar? We found testimony that she had testified. I must have been the Child Welfare Task Force, but she lives in California. And so I'm just wondering, does DCF contract with somebody in California, or is that one of the contractors that does that? Or okay,
I understand she's related to KBC. Is that right?
Okay. I could not get to the bottom of why she was making decisions on a case in Kansas, and so KVC contracts with her. Okay. All right. Thank you. That's all the questions I have. We have Representative Howell. Oh, you have, okay. We'll let you cut in front of your friend.
There we go. Thank you for letting me cut. So on those grants, on the parent-to-peer, who does that money go to? Who is doing the bidding for the applications for the grant?
DCF is putting out an RFP for an organization that would manage that parent-peer network. So,
And what organizations are you anticipating would apply?
I don't know at this point because I mean the RFP is on the street. So do we have ideas?
Sorry, thank you.
Thank you for the question. So when we send those out, they're sent to child placing agencies, other organizations that we work with that organize peer support programs. So for example, maybe Kansas Family Advisory Network, Foster Adopt Connect. There are other organizations out there that gather and convene or facilitate groups of work for our agency or KDAD. So there's lists of potential bidders that we send RFPs out to.
Okay, thank you for that clarification.
Thank you, Madam Chair. So my question is in regards to slide 32, the data point that talked about less than 6% of children are that are waiting admission for PRTF. 6% of them are placed with a relative or kin compared to 47% in the general foster care population. Yes. I assume that you guys are working just as diligently to place these children with relatives and kin as you are the general population. So I'm assuming that would probably be because of behavioral health type behaviors and those kinds of things. And that's why that placement rate is so low.
Yep.
Okay.
Mm-hmm. That's right, Representative.
I just think that's worth the reasoning behind that and why it's challenging is worth noting. Thank you.
Senator Gossage.
Thank you, Madam Chair. Thank you, Madam Secretary. Tomorrow we will have lots of testimonies that are personal testimonies, written testimonies. Looking at some of those already and people that have reached out to me, Senator Falscato and I have shared stories of, not with names, but just issues. And so I wanted to ask you, when we have parents who call us, when we have foster parents, when we have relatives that called on behalf of others and said, this is what's happened, this is what's going on. These children were taken wrongfully. How can we ever get them back? Now we think they're going to be adopted out. Who would be the best person for us to call?
Yeah, I mean, I think the best person for you to contact would be Andrea Warnke, our legislative liaison.
Okay.
And then when she receives that, and sometimes I receive them from you directly as well, I usually then kind of ask for kind of a deep dive to understand, what's going on in that particular circumstance. And then, what happens after that kind of depends on, what that deep dive, says, right? Or where things are in the process. Sometimes it's about connecting those individuals to the right people to talk to. Sometimes there's not an understanding maybe of what's going on. Other times there may be a disagreement or there may be more to the story. So, but again, if you reach out to Andrea, she will work with our regions and with the case management providers to sort of pull together the kinds of details that we need on each of those circumstances. And we do that every day.
Please understand that we realize that there are lots of different sides to every story. We're hearing one. But all we can do is listen,
right?
Take notes, and then try to reach out to the department and say, can you tell where we are in this situation? And
I would also say, I'm sorry to interrupt you, Senator, go ahead.
No, that's all. And so I just said, I agree, it would be nice for us to have, I will call this person, so we could call Andrea and say, this is what I heard, this is what's going on, or I could send you an email, or here's the person that maybe would like to talk to you.
Exactly, yes.
Is there additional information that you would need from us?
No, I mean, I think just information about the individual. Sometimes, just based on confidentiality, there's only so much we can share back with you sometimes. But depending upon the circumstance, There is a process that we also can use where, and I think some of you have done this in the past, where if you can get permission from, say, the individual involved, and they sign for that, then we're able to share more confidential information with you. And Andrea also has access to those kinds of forms and things like that. So again, I mean, know that we follow up on each one. Sometimes the information we can give back to you is more general than you might want to see. Sometimes we're able to share more based on, whether or not we have, that sort of permission and the right person is involved in the case to give that permission. So
Thank you very much. Thank you, Madam Chair.
Any other questions? Okay, all right. Thank you. Thank you. I would say another avenue when you have stories like that would be to call the child advocate, which is a segue to Carrie Leonard coming to the well at this point, our child advocate. Do you have a question before she even speaks?
Yeah,
Okay.
for
For me, Senator Frascado.
Thank you, Madam Chair. To your comment there, I've done both. And so the Child Advocate Center only deals with certain issues, certain situations I found. So where I've got the help was texting Adrian first, and then she's able to say, this is a DCF issue, this is a contracting issue, or it's an issue that the child advocate could handle. I'm just trying to save people some time.
Yeah. Well, yeah, they handle, there are different things to call different people for, but I will say, mine aren't just my constituents. I get calls from all over Kansas now, and those calls have been reduced substantially since the child advocate's been doing her job and her name's out there. And so I would hope that that's a reflection of that. So anyway, welcome.
Good afternoon, and I guess that was a perfect segue. So, good afternoon, Chair Kincannon, Vice Chair Gossage, and Ranking Minority Member Owsley, and members of the committee. Glad to be back here this afternoon to provide an update regarding the Office of the Child Advocate. My name is Carrie Leonard, and I'm the current Child Advocate for the state of Kansas. So just to start, a quick update. You'll find in the testimony a quarterly snapshot, which I've tried to provide as I come and share with you an update about what's going on with our office, as well as just a map to show you where those current complaints are coming from. Since we were just here, I believe a month and a half or 2 months ago. There may not be a lot of new information as far as the complaints are. This quarterly snapshot, I just want to give a little caveat that it just looks at October 1st to November 8th for this last quarter. So it's a small reduced number, so we'll be able to provide more updated information moving forward. So what I'm referring to is the snapshot that provides you some information regarding the investigation outcomes, the complaint investigation activities, and those concerns that we're receiving. So what I will tell you, and as I've pointed out, the main reasons that we receive as far as concerns that are coming to our office continue to be fairly consistent. You'll see a little bit of change in the numbers themselves, but again, agency conduct, child safety, dependent child health, family separation, those remain those top issues. You'll see an increase in the number of complaints that we're receiving around family time. What I will share around that is that we are hearing a lot more from parents around not having family time with their children, having restrictions, having cancellations, issues with transportation, what they're perceiving as maybe some unreasonable restrictions on that time. And so we're really taking a close look at some of the policies and practices around family time because of those concerns. Another area that I just want to point out, because we've talked a little bit about it with the folks that you heard from this morning and a little bit this afternoon, is around dependent child health, well-being, and permanency. So one of the top reasons that we continue to hear is failure to provide the child with adequate medical and/or mental health services. So we heard that's something that we know the settlement is tracking. We hear it continuously as a concern. Appleseed provided some additional information. So it's an area that we know we need to do better here in Kansas. And some of the things that I will share around that is not just are there barriers around accessing mental health services because of placement instability and moves, but just timely referrals and maybe utilizing family. Let me give you an example. We have a case where a child was already engaged with a particular therapist. Rather than continuing that service, the provider is looking at trying to find something that may be closer to where the current placement is, where there may have been some creative solutions or some other ways around being able to maintain those services. So just some food for thought around that area of making sure that we're providing both mental health and medical services for our children. Another area that we're hearing, and I think it's contributing to some of that placement instability, are what is being perceived as unnecessary or inappropriate change of a child's placement. Those can be for a number of different reasons. Sometimes it's communication barriers or conflict between the placement and the case management provider. Some of the folks that have brought concerns to us have shared that they feel like if they're advocating or asking questions, then they're perceived as too difficult. And so that's an area that I think that we could improve those relationships for our foster parents, family members that are providing care for our children in their relationships with our providers, as well as the courts. Some of those decisions are made outside of the providers and are being made within the court system as well. The first one, the other kind of area that is agency conduct that we continue to hear about. And we've talked before about what may play into some of those concerns or complaints that our office is receiving. What I will share is as our office is pulling together our annual report, we're looking at recommendations that we've made over this last year in case-specific circumstances. And just to kind of give you a real quick look into a potential recommendation that we'll be making or sharing a little bit more information is around providing or exploring some certification programs or models that other states have had. We know that workforce is a challenge. We are using a lot of unlicensed workers. We know that our CMPs are struggling with having qualified individuals even apply for jobs. So we know that that's a challenge. So some states have implemented certification models to then provide education and different certifications that then those individuals can work towards receiving. It also provides just a higher level of expectations for those workers. And monitoring. We know that when there's complaints or concerns regarding unlicensed workers, there's really the Behavioral Sciences Regulatory Board is not overseeing those individuals. So this certification program may provide some additional oversight when there are concerns, as well as maybe just some general supervision requirements for unlicensed workers. So those are some things that our office has been exploring as we're hearing concerns around just agency conduct. Something else just to share that we're tracking, in addition to what you'll see here on this snapshot, is in following and reviewing the State Child Death Review annual report, which I know you'll be hearing from them over the next 2 days. But we are going to start tracking in those cases where it's appropriate, whether Adrian's Law and the care referrals are being complied with, noting that that was an area of recommendation coming out of that report. So I'm going to shift to really just a general update around our office. Last time we were here, there had been a question around just our processes and timelines. And I think it's only fair, as our office receives concerns and we're looking at best practices for those who are providing services to our children and families, that we're also taking a critical look at our own internal processes, and we're being transparent about some of our own challenges and things that we're working on. So just to provide you some information around our turnaround, we know that that has been a challenge from day one as we built the office and we established practices and protocols and things that we're looking and tracking at. So one of those was an internal goal was to complete an investigation and be able to close a case within 160 days. Now we know that there may be a number of factors that may impact that timeline. But as we set that for a goal, early on, we weren't doing so great at it. So we have made a very cognizant effort internally to do better in that area. So in 2024, just a quick look at our average investigation completion rate. In Q1, we were at 153 days. And as of Q3, we were at an average of 72 days. So we are making progress and improvement there. And we hope to continue to do better. Something else that I think I've shared before is that we've been having some quarterly meetings with our case management providers and with DCF. Part of the new statute allows us to not just, before we received, if we made a recommendation, the DCF or the case management provider would have the opportunity to provide a response regarding those recommendations, whether they agreed with it, whether they disagreed, whether there was any intention of implementing something. With the new statute, we are making very specific requests that the agencies respond to those recommendations and whether they intend to implement anything. And as part of those quarterly meetings, we're then tracking those implementations. If we make a recommendation and they say, yes, we're going to do X, Y, Z, then we're able to now to come back together with our tracking and say, how is that going? Were you able to meet that implementation that you had stated to us that you were going to do? So I look forward to being able to report back and share some of those changes and implementations of some of those recommendations. So we've talked a lot about so many themes and policies. And what I will say is it's very much in line. The speakers that you've heard today that are on the agenda for tomorrow, the conversations that are happening across the state are very much in line with recommendations and themes that we have seen over the last several years that we have made and that we will most likely be making also in our annual report coming out prior to session starting in January. There's a lot of different collaborations that are happening involving all three branches, which is extremely exciting to me. I think that there's a lot of folks in this room who are participating in those conversations statewide around making some of those changes. And so I look forward to really seeing some wonderful recommendations, whether it's legislative changes, policy changes, moving forward. So a couple of those things, I want to just take a couple minutes just to touch on things that you've heard earlier today. We heard from the neutral regarding just a couple of things that we have shared as concerns, and I am glad to hear that it's on the radar of not only the neutral, but of our agencies and our providers, is that windshield time for our youth that are experiencing placement instability. And as they talked about the sleeping placements, so as we reduce those numbers of children that are maybe staying in offices, what we're hearing and seeing was that they were spending a lot of time in vehicles. They were being picked up really early and being dropped off late at night. And so I'm glad to hear that that's on the radar across the board so that we can be looking at what is happening specifically for that individual youth and being creative with our solutions and hearing from them what's going on. And so with that, the idea of those intensive case reviews and that recommendation and hearing from the secretary that they're going to be looking at a more intensive case management model and case teams for those youth, I look forward to seeing how that's impacting that particular population. We heard from Appleseed around hearing from foster parents, particularly those that may no longer be fostering and what are the reasons why. And what I will tell you is some of the things that she shared are very much in line with our foster parent survey that we did back in 2022 or 3. And so I would just encourage you, as you heard from some of her testimony, maybe look back at that report and some of those recommendations that we made and some of those statements that we received from those foster parents and thinking about ways that we can improve recruitment and communication and relationships. The other pieces that we have continued, our office has talked a lot about aftercare and thinking about foster care. If removal is necessary, thinking about foster care is very short term and intentional and intensive, and then returning the children home as soon as possible in a safe way. And so we have made recommendations around really amping up some of those aftercare services. So we heard that today, and I would encourage those in the room to be thinking about what is it that we need to then support children in their home around aftercare services and being able to really beef that idea and program up a little bit and lift it up. Safely narrowing the door. We've continued to have those conversations. So I know that there's a lot of discussion around what that definition should look like and some really great guidance from other states. And our office would continue to support those conversations as well. And after me, we're going to hear from regarding law enforcement. So that's another piece that our office hears a number of concerns about, and I don't have it included on our snapshot, but a component of many of the conversations and the concerns that our office receives does include communication with law enforcement, the interplay between our departments and law enforcement involvement and what that looks like. And so I look forward to hearing that presentation and be thinking about in our state where we can make some changes and improvements there. So on the themes and policy considerations on testimony, I think I've touched on most of those that I wanted to highlight this afternoon. I will say, Representative Humphreys, you had noted that you hadn't heard the term concurrent case planning before. We actually included that in the testimony. So it's something that our office has been discussing as we look at the concerns that are coming into our office and thinking about where is it that we need to be doing better in our state. And part of that is there's so many different factors that are playing into that piece, but concurrent case planning has been around for a long time. I think there's different implementations of it. In some ways there's some criticism around it as well. Because there's concerns that it may not be, if we do it too early, maybe we're not supporting reunification as our primary goal. But the bottom line is that for the most part it supports sibling relationships. It's encouraging some of those family findings that we're talking about and making sure that we're identifying family and kin and non-relative kin as placements and those supports for our children and our families. And it's talking about making sure that we're really wrapping around families early on so that whatever the permanency may look like, it's successful. And if reunification is not a viable option, then we're already moving forward with ensuring that we're finding permanency for children in the best possible way. One of the areas where we feel like concurrent planning would have a significant impact if we were doing a better job is around those cases that children are placed with non-relative kin, they're in a foster home, and they've been there for years. And now we've identified family. And now we've created a situation where we're pitting family against foster families where there's connections. And it means that there's loss. It means that there's potential loss for this family. It means there's potential loss for this foster family and their children. But most importantly, it's loss one way or the other for the child. And so that's where we could be doing a better job with concurrent planning. I think, and on that, I'll just end with, there was a message from the Children's Bureau that just came out this last week, very much talking about how we need to be engaging families, identifying their supports in their communities, identifying those family members, whether they're in the state, outside of the state, and then fostering those relationships between family, parents, and if foster parents are involved, also then those supports, so that they're supporting each other and wrapping around this child and this family. So I just felt that that was a timely message given a lot of the things that we're talking about here today and across the state as through a lot of the different initiatives. So Chair Kincannon, I will close there and be happy to stand for questions.
All right, we'll just take a few minutes for questions to Senator Fascadell.
Thank you, Madam Chair. First of all, I think that everybody in this room, you know, we care about children. We just play different roles. And each of our districts are different, Madam Chair, and our experiences are different. I think that the Child Advocate Agency, which is the face of Carrie Larnert, I think she's doing a great job too. And I've had constituents that they've called me, I've given them the number, and they've called me back and said, she was awesome, I got the help I needed. There have been times, Madam Chair, that I've personally called and shared a whole story with Carrie, and she's like, Senator, I'm sorry, that's not what I do from here. So my comment earlier was not saying she wasn't doing a great job, because she is. And we need all the help that we can get. And I think we're all on the same side. We just have different situations that come to us. And so I was just saying that it would be helpful to me to help those children in my district if I, you know, a stitch in time saves 9. And so if the issue is related to something you can do, I want to call you. If not, I was just saying that, you know, sometimes it's might be, you know, directed in a different area. So if you would please, Madam Chair, Carrie, if you would just tell me what are the calls, what are the topics that you can deal with. Just give me that example. A person calls, they do what? You make a recommendation that they call DCF or the contractor or how does that work? Because you know, time is of the essence for me after I've sit on the phone for 30 minutes. I don't want to call you and then you tell me to call someone else and now it's 2 weeks down the road. And so, but Madam Chair, I think she's doing a great job too. Thank you.
Senator, no, I think that's a good question because, and I'll try to answer it in the best way possible. As far as the scope of our office. And then as people call us and trying to direct them, because I think you're right. Time is of the essence in so many of these circumstances. So I think looking at our statute and what our scope is number one is important. So under the statute, it is a child who is, you know, under 18, who is either
Madam Chair, I think you misunderstood my question, Carrie. So a person calls you. It's usually a foster parent. Usually it's a biological parent, and they're upset with something that is going on already with DCF or the contractors. So then you hear the story, and then do you act on it? Do you fix it? Or do you refer them somewhere else?
Senator, thank you. I was going down a different lane, so thank you for bringing me back. Yes, so if a person calls us and they have a particular concern regarding DCF, it's a foster parent, or they have a concern about something else, it depends on the situation. So we may suggest or ask them, have you tried to utilize the grievance procedure through, and I'm just going to say through Ember Hope. So they have a grievance process. Have you tried to utilize that? And they may say, yes, we haven't, we weren't successful, or I didn't know they had one. And so we may encourage them to exercise that opportunity to work through that process. Or they may say, we don't feel comfortable doing that. Same with, you know, have you utilized the DCF customer service? So those are questions that we are asking individuals who are contacting us to get a better idea of what they've tried or attempted and what they feel comfortable doing. Then depending on the circumstances, then our office then we'll either identify, is there additional information that we need? Is there information and resources we can provide the individual? Or is it a case that we feel like we can have an impact? It may just take a phone call. Really, it depends on the complexity of the concern that's been brought to us. If it just takes a quick phone call to try to reach a resolution, I hate to say the word fix the problem because that's challenging just depending on what's going on to say we were able to fix it. But if it's just making a connection, then we can try to do that. But it's trying to help that individual find a resolution to the concern.
And Madam Chair, this is my last point. So how many are staffed with you? Is it just you?
No, Senator, so we have a total staff of 5. So there's myself, and then I have our office administrator, and then who it really is that primary initial contact with individuals who are contacting our office. She's gathering information for us. And then I have 3 case investigators who are working directly in assigned cases if they're opened.
I just want to say again, my experience is different. Whenever I've called lately, I don't get anybody. I leave a message and I've got it on my phone here, and I'm just saying, so maybe we should appropriate them more staff to take calls. I don't know. Thank you, Madam Chair.
Bring that up at next session. But, and Senator Fasquedo, please don't misunderstand me. I wasn't saying that you weren't, I was just making a segue. Yeah, I wasn't saying that you were being critical of it. I actually, when I get a call, I call everybody. I call Andrea and I call Carrie and a lobbyist. I what? I'm sorry. That's why I call all of them, so that maybe somebody will help me. So yeah, you just got to try it all. But yeah, I can tell. I appreciate how much you care about it. Anybody else have questions? Okay, thank you, Carrie.
Madam Chair, I got to say this, if it weren't for a couple of people on the committee or Senator Molly Baumgartner supporting my statements, a lot of things wouldn't get done. It's like, and I've never sit on the end before, and so I don't get to see the face of the chair. Usually I'm there. I guess I'm being sentient sitting on the end. But wait. So I've never really seen the face of the chair, like annoyed if I'm asking a question. This is serious stuff. And I know we want to stay on time, but it's like since 2004, Madam Chair, I'm dealing with the same issues, and it's frustrating for me, but it's sad to see the families going through what they go through. And when I share the concerns that I hear from them, it's kind of like, no big deal, or that's the look I'm getting. But
me?
Yeah, Madam Chair.
Okay, well, you turn that way because you are completely misreading me. Okay. Senator Gossage.
Yes, thank you, Madam Chair. I just want the committee and the people in the room to know that in a few minutes I'm going to have to leave, and I apologize for having to leave the committee early. But as I shared with you, I have a meeting in DeSoto with KDOT about what's going on in their town and 10 Highway, and I promised that I would be there. So if you see me walking out, you'll know why, but I think this is all extremely important, and I will see you tomorrow.
Okay. Thanks for letting us know. All right, next up we have Ed Klump with the law enforcement agencies. Hey, Ed, welcome.
Thank you, Madam Chair. My name is Ed Klump. I'm here representing the Kansas Sheriff's Association, Kansas Association Chiefs of Police, Kansas Peace Officers Association. And you should have my written testimony there. I know it's lengthy. I'm not going to cover it all in what I'm saying today because I've only got 15 minutes. But I wanted
to take
put
what
some
time you need
in there. So before I start, if I could, Madam Chair, I'd like to introduce someone that's here with me today. Is that okay?
Oh, I'm Yeah, I was pulling your testimony out.
Yeah.
Yes, please.
Okay. Lieutenant Donna Eubanks, she is in the investigative division at Topeka Police Department. When I come and speak to the legislature, I depend heavily on my contacts with active officers. Donna is one of my go-to people when it comes to child welfare issues. She specializes in this area. I asked her to be here not just simply to introduce you, but she has my back. So when we get to questions, you ask me one and stump me. I don't have to call a friend. I can ask her. So hopefully she can fill in the blanks that I can't. One other thing before I start on the testimony. 3 years ago, I came before this committee and shared with you some results from a survey we had done within our associations about the concerns we had with some things going on. And as a result of that, in 2022 session, a bill was presented and passed, supported by DCF, and clarified some of the rules that were in statute about sharing information. And I wanted to report to you that I have done another survey recently, just started last week. I'm still getting responses to it, but I have over 150 responses now, which, by the way, is a large number of responses when I send a survey out. So this is a topic that law enforcement's interested in. But they report 83% of them said there's been improvements from the change in that law. And so thank you very much for listening. Thank you very much for taking the action. Thanks DCF for supporting the changes and attempting to implement it. I'll throw a little bit of cold water on it in that 52% said we need to do more. But at least 83% said yes, we are, and 8% said they are now getting everything they need when they request it from DCF. So that's a good thing to note, and I just want to let you know the results of that request we made from you several years ago. So I'm going to start with this on the first page of my testimony, in the second paragraph there. We were invited to come and speak on police protective custody, and I think what brought that up is a concern that had arisen that there was a large percentage of the children that were going into foster care being brought in through the PPC process. And so that's the premise of what my testimony surrounds. I personally don't know if that experience is equal in other states or not. And if we are higher, I'm not sure what the cause of that is. I'm going to speculate a little bit here and point out some things in the Kansas process that might lead to that. But it's something we certainly need to look at is why are those numbers where they're at? So to start out with, the DCF is only available to respond generally to complaints during normal business hours. Law enforcement's available 24/7. And that accounts to a lot of the calls coming to us directly instead of going to DCF. The other is, if you're not a mandatory reporter, general public really doesn't know they can call the hotline at DCF and make a report. So like so many things that the public wants from the government, when they can't figure out who else to call, including the traffic signals not working right or anything else, it's usually 911. And so we get those calls and we respond to them. And so keep this in mind. When you talk about the DCF normal business hours, you're talking about 27% of the work of the calendar week. So they're only available to respond typically 27% of the time. So that's going to account to a lot of those calls going to us, especially when it's an immediate situation. And so, again, they're not available for immediate response like we are, because they may be, when you get in Western Kansas, they may be 5 counties away. So law enforcement is always right there to immediately respond. So we get to those cases a lot quicker when it's an immediate situation where activity is going on, putting a child at risk. We're also in a position to see a lot of these cases just in the routine of our other work. We go to a domestic violence call. We go to any number of calls, and noise complaints, neighborhood disturbances, check the welfare, barking dogs. Anytime we're in contact with people in the home, we oftentimes see conditions that relate to neglect or hazardous conditions to a child. Sometimes those are abuse cases, mostly they're neglect cases, but we're in a position to see those things. And I think the fact that those numbers are high might be because law enforcement is very tuned in Kansas to child welfare. We see that in the results of the survey, over 150 responses in just a few days. And we see that in the number of cases that we have. So we also get calls from neighbors that see things that don't look right to them with children, and so we go investigate. And oftentimes, those will lead to these cases as well. A lot of calls, as you know, goes to DCF first. They screen those calls. If they see something that is an immediate issue, they will typically call law enforcement in that jurisdiction and ask us to respond. Sometimes they will do some kind of initial screening, assign it to a DCF worker. They will look at it for a while, and then they will call law enforcement because they think it's something that we need to get involved in. So sometimes we get those referrals. Sometimes we'll get referrals at 4 o'clock in the afternoon to do one of these. And we go out, we investigate, we find a need to take some kind of action. And it's us then that has to do that because DCF's not there with us because it's after the normal business hours. So those are things that happen that kind of put us in the situation to see a lot more of these cases, to be involved with them. And I think that's probably generally what is happening, but we don't have, I don't think, the adequate data to really drill down to it and see, and I'll get to that in a little bit. So the next section of my testimony, I talk about the process. What is the police protective custody process? And I'm going to skip over that. I wanted to put it in my written so it was there for you to look at. And I'm going to jump over to page 4 in the section titled Law Enforcement Challenges. And as you'll see on those 2.5 pages prior to that, this is not a simple issue. It's a pretty complex issue. And we have to look at these issues and judge what action we need to take right now based on what we know right now. And that is the big challenge for law enforcement, because we know oftentimes when we are in a house or in a situation where a child appears to be suffering from neglect or abuse, there is more to that story than we're going to be able to collect right there on that scene. For example, we have one of these cases, we're seeing what we see at 2 o'clock in the morning or 10 o'clock at night, and we don't have the opportunity to go do more investigation, but we will do follow-up investigation after we take what action we need to take. So we may put a child in the PPC, and then we'll go do some follow-up investigation. We may go talk to the school if they're school age, find out what's going on there. Do they see signs? Daycare center, we may go talk to them. Neighbors, we may go talk to. We're not going to knock on the door at 3 in the morning. But, those are the things that we do after the fact, and we gather more information. So it's just important you realize when we're making these calls on whether to put one of these children in a PPC, we have to base it on that information we have right now. Just like we do when we make an arrest for a crime, we have to base our probable cause on what we know right now. That's what we base that on. And then as we do more investigation, sometimes that becomes stronger, and sometimes it produces information that tells us, well, maybe it's not what we thought it was. And that's just the way the system works throughout, not just in PPC, but in criminal investigation as well. I would say it's probably unusual that there's not additional information that comes in after we make that decision to take a child into PPC. And some of that information will help confirm our suspicions, and some of it is going to mitigate some of those suspicions. In some cases, we contact this child, they're not in the home. We contact the child somewhere else, and we discover there that something is going on that puts this child in danger. The source of that danger may not even be in the home. The source of that danger may be right here. And under the law, we still take that child into PPC, although they're never going to go to foster care at that point, but it's still called police protective custody. We have the authority under the statute to take that child into our custody, remove them from that danger, and in that case, get them back home. where they're safe. So we're not going to take them out of the home. We're not going to put them into the system. But at that point, we have used that police protective custody in a very limited way, and those aren't being recorded in the data you see from DCF. So keep that in mind as you look at statutes, that plays a very important role in our ability to take that child into custody, some other place they are where they're in danger, and get them back to the safety of their family and homes. So that's an important factor. Police protective custody is designed to err on the side of the child's safety. However, we are also very aware that when you remove a child from the home, you are also creating trauma. So it has to be balanced with what's the trauma of the risk they're in and what's the trauma of taking that child out of the home in that particular situation. And we're always going to lean towards the side of what we need to do right now to make sure this child's safe. But we are always aware of that, and we are always looking at ways to not take the child out of the home. For example, in the home, there's a risk there. There's a danger there. Who's creating that risk? Is it the environment of the home, something that can be fixed relatively easy? Is it a person who's temporarily in the home that's creating the risk that can leave, therefore alleviating the risk? No need for taking that child into PPC and getting them in the DCF system. So we're always looking at alternatives to that removing the child from the home. We don't want to remove a child from the home except as a last resort. And that's the way that process works. And in our opinion, it's working relatively well. I'm not going to say it couldn't be better. It probably can. But I think we need to be very careful if we look at changing statutes, raising the bar for when we can utilize PPC, because we may then put children at risk that we otherwise would have been able to remove from that environment. I think what we need is we need to take a deeper dive into the data. Why is that number the way it is? If we can identify situations in which law enforcement has taken a child into protective custody, putting them in the DCF system, and then DCF has a different opinion of whether that should have happened or not, or maybe the court has a different opinion, we ought to be looking at that and saying, well, okay, what is it that triggered our decision that isn't working when we get into the rest of the system? And then those are things we need to address through training and potentially changing the law if that's what it points to. But I'm always not hesitant to say that in this building, it's like a clock with pendulum, and that pendulum's banging over here, and our fix is to bang it over here instead of bring it in the middle. And we need to be very, very careful with this particular thing because we are talking about the welfare of these kids one way or the other. And no matter what you do, that child's suffering trauma, no matter what we do. They're suffering trauma from the circumstance they're in. They're going to suffer trauma when we take them out of the home. And we've got to be very aware of that and get that right balance. So next, I just want to move over to the last page. And I called it points to ponder. I didn't want to really call it recommendations, but these are some thoughts that I want you to have. And I think I voiced this in another setting, and that's probably another reason I'm here today. So first of all, am I right, Madam Chair? Okay. So first of all, is a risk assessment tool. Risk assessments have become a very common thing in the justice work, including juvenile justice, adult justice, and judicial system. I'm not aware, and nobody has seemed to point me to any so far, any risk assessment tool that is designed specifically for law enforcement when they're making a decision of whether to take a child out of their home or not. If one is out there that we can find, we need to look at it and then ask ourselves, does it work in Kansas statutes and Kansas environment? And then how do we get it validated for Kansas to use? I think, and the response I've got from law enforcement on this issue has been very positive. They would like to see some kind of a risk assessment tool that we could use in making that determination. Um, I want to just reemphasize that just because there is a tool out there that works for DCF or a tool out there that works for the courts doesn't mean it's a tool that works for us in the environment that we're operating in. It has to be one specific for the environment we're making that decision in. And so it's important that if we're going to go down that path, we do it right. It has to be validated. We have to do testing to make sure that it gives us the result that we're expecting before we implement it as the Bible of when we take a child out of the home. And I would also caution that it should never be check the boxes, put in a number. If the number is this, then that's the answer. There always has to be wiggle room for those conditions that are out of the ordinary. Just as we do in our risk assessment for juvenile offenders, there's that catch-all that allows us to go outside that risk tool if there's certain cause to. There's things we have to do to justify that, but the ability's there. The second one is data analysis, and I touched on this a little bit. I think we need to do a deeper dive into the data of police protective custody. I'm not sure the data is out there. I've had a few offline conversation with DCF, and I think some of that information is probably lacking. But I think we should really look at that data process and see if there's a way we can identify better when PPC does take place from law enforcement, what is the results of that? What's the outcome? And are there things that we're doing that we need to do better that we can do in training? The third thing is the law enforcement ability to contact DCF experts after business hours. This is one that I hear frequently from officers. And so I put it in the survey that I just put out. And the responses I've got so far floored me. I didn't think it'd be this strong. 80% so I did two surveys. I did one for field officers. It's your uniformed officers and supervisors on the street 24/7, and one for investigators that come in and do these investigations. So for the field officers, 80% that when they're investigating an abuse case said this would be very helpful to them. 83% said it would be very helpful in a neglect case. And when I asked the investigators the same question, 84% said it would help them in their investigation. 76% said it would help them in a PPC decision. So both of these relate to that decision of making the call of whether we remove a child from the home or not. We need to rely, and that communication needs to be stronger between the DCF experts that have been trained and work every day in this field versus what the law enforcement experience is. There is 435 law enforcement agencies in this state. Only a handful are large enough that have an investigator like Lieutenant Eubanks. Most of them are street officers making these decisions, making these investigations. And they need somebody they can call. Half of our law enforcement agencies have 15 or fewer officers. So they don't get a lot of these calls, but when they do, it is a critical call that we get right. And we need to afford them all the opportunity we can get them the best information we can to make that decision and make the right decision. Lastly is training. This always comes up. And I want to say that I asked this question in the survey 3 years ago. I did it again this time. I asked them about their level of training and how they felt, whether if that was adequate or not, and how much they had had. So from the field officers, 0% said they had no training. That's a good sign, right? At least they're getting some training. 30% said it was limited. 49% said it was adequate, but they would like to have more. And 21% said they were getting all they needed. When I asked the investigators that question, 0% said none again. 10% said it was limited. That's way down from what the field officers were. 56%, which is more than the field officers, said they were getting adequate training, but they would like more. and 34%, which is higher than field officers, said they were getting all they needed. So we're doing a pretty good job of those larger agencies that have investigators that work on these cases of getting them into training. So we need some training focused on this issue. And the best way to do that is working together, DCF, us, now the Child Advocate's Office, working together to frame training through the Kansas Law Enforcement Training Center, that we can put online training out there. Because when you got 8,000 plus law enforcement officers in the state, the only way you're going to reach all of them is in online training. You're not going to reach all of those officers through going out in the field and doing on-scene training. I've tried that through the AG's Office on Human Trafficking. It doesn't work. You're lucky if you reach 10% of them. But if you do online training, the interest law enforcement shows in this topic tells me they are going to go to that online training and follow it. So those are my 4 points to ponder. I'm falling short of calling them recommendations. You do with them what you might. And I will work with you and DCF and the Office of Child Advocacy to do what we can on our end to make this system stronger. And with that, I'll stand for questions.
All right, thank you, Ed. We have questions. Representative Howerton.
Thank you, Madam Chair. Do you know how many police departments are using the 4 questions that have been referenced?
I do not. I have no idea on that, and I didn't have that information when I built the survey, so I didn't ask.
Okay.
But I know that DCF has been going out and doing on-site training, and that has included law enforcement from what they've told me. And so I know some training is going on. But again, my experience in trying to reach existing officers, not talking about recruit officers that all go through KLTC, but existing officers, you will not reach very many of them through that process. We need to develop online training, and then we'll reach more. But I don't have that answer.
That's a good start to like the risk assessment, like those 4 questions, in my opinion. Thank you.
Senator Fauske.
Thank you, Madam Chair, for acknowledging me. Ed Klump, thank you. You know, after all these years now, I finally believe everything you say. So the scenario that you gave of when the officers go out to a call, whatever the situation is, and they have to make that decision. So that's when, so in Wichita, in my inner city area, when those calls are made, so in whatever decision that the office law enforcement make, so then, Madam Chair, the families, they call me, and it never fails. It's right after I've finished watching a movie, I've stayed up to see the end, and it's 1 o'clock in the morning or midnight maybe, and I fall off to sleep. Then I get this call, and so they are saying, okay, they took my children, what happens? So within DCF, Child in Need of Care System, the bylaws, there's, I don't know, maybe it's changed. People keep changing things on me. 72 hours investigation time on DCF site. So then I'll get then I said, if I'm awake, I'm calling somebody else too. So then I call Sheriff Jeff Easter, and he always answers. I'm like, wow, do you ever sleep? And so what I think would be helpful, but nobody else thinks so, I guess, because I've been asking for years. So when that police goes out to that call, do you leave, I've suggested and recommended that 3x5 card and give it to those parents or whomever's there when you take the children, so they will know that there will be another investigation. Maybe in Wichita, police officers take children to our Wichita Children's Home. And so do you, or I don't know, maybe you could just, I'll print you some, you know, to give to your officers a card that says, call the Child Advocate Center, and it's going to be 72 hours of investigation for you to get your children back, and here's where we're taking them. Those are the questions they call and ask me. So do we have anything like that in place? Thank you, Madam Chair.
And again, I'm not sure I can answer that fully for you. That's going to be a local decision of what they're doing in that process, and I would imagine some are doing that. But I can't answer whether everybody's doing that. I don't know of any standardized.
Madam Chair, Ed Klump, everybody, I've asked my police chief, Joe Sullivan. I've asked my sheriff, Jeff Easter. They say they can't do it until DCF tells them what to do because they don't work for DCF. So anyway, I'm just asking, or maybe I'm suggesting that that would be something good for the parents. You're making your decision. They're calling me. I'm just trying to help and say, give them a card so that they don't call me so much because I got all these bags and suitcases under my eyes. I just want a little sleep and I want to help children and families. Thank you, Madam Chair.
I would suspect that there's information being given to them, but in that moment, parents are very upset and they're probably not listening to everything. Donna, is there anything you'd want to add to that? Come up here.
Donna Eubanks. So when we respond to the call, if we PPC a child, we go to the JIAC here, the Juvenile Intake Center here. So we give all that information to JIAC, where the child was taken from. We have to fill out a report of why we removed the child from the home. And then the JIAC Center usually makes contact with the parents. And then we refer our reports over to DCF and the courts at the same time. So usually within 24 to 48 hours, there's a hearing set up for the PPC of the child. And then the parents are notified of the hearing and everybody goes in front of the judge, and the officer that took the child will go in front of the judge and talk about what the situation was and what happened. And then that's all done in the hearing, and the DA's office will contact them also. So I hear what you're saying, and I think maybe that's something we can look into, just a little more explanation on what's going to happen, the next steps that are going to happen. So yeah, and I understand that. I know we try to explain that to the parent, that your child's going here. JIAC will have placement for the child tonight. You'll go in front of the judge will decide, and it's all within no more than a 48-hour time frame. And then if the judge decides to remove that child, not permanently, but for the time being until the investigation is completed, then our detectives will stay in contact with the family to kind of give updates of the investigation that's ongoing. So I hope that answered your question.
It did, and Madam Chair, if I may, in the recommendations, like the Secretary Laura Howard gave us out the little square spongy deals with the 4 questions. Maybe police officers could carry some and, give them to the parent. They're all upset. They don't know what to do, but give them that, and it releases stress, and it has a number on it. Call this number. I'm just trying to help. Thank you, Madam Chair. Thank you.
Yep, thank you. Representative Howerton.
Just a quick follow-up to what the officer just said. Are parents allowed to come to the PPC court hearing?
Yes.
They're notified?
Yes.
And what?
Yes.
Who notifies? Is this JIAC? Is that what you said? They notify the parents?
JIAC is the juvenile intake.
Right.
And that's where we take a child when we take them into custody, like on a crime or in a child in need of care. And so they're not the ones that would notify them on court cases. That would be the court would notify them, or the prosecuting attorney. Prosecuting attorney also gets involved.
That's a quick turnaround. That's why I'm just like 24, 40. I was just wondering.
Yeah.
Thank you.
Yeah.
I'm going to call on Representative Ruiz, but I just thought of a follow-up. When you were talking about something very specific to what you do, were you referring to the 4 questions that maybe that works for DCF and for the courts? But no, that's not what you were, okay.
I'm talking about an actual risk assessment. We use those now in domestic violence cases. We use them at intake for the juvenile offenders to see if they will be held or released back to the parents. And this process just seems to be ripe for that kind of a tested and validated system to help the officer. And that's what we wanted to do, is help the officer make that decision.
Yeah.
Because we can see that 80% of the officers are wanting help. Let's give it to them.
Yeah, yep, yep. Okay, Representative Ruiz.
Thank you, Madam Chair. Thank you, Ed. In your testimony, on page 3, you've got the definition of neglect, abuse, or abandonment allegations. So as far as the training to law enforcement, is there training just around neglect, not abuse or abandonment, but neglect? What neglect looks like, and when it comes to safety, and then making the decision to remove a child because of neglect?
Good question. And I think that the reason 0% said they had no training is because for years, their basic training from the Law Enforcement Training Center when they become a police officer includes this topic. It is a big topic, and it's one that is very important to get right. And it's not something we deal with infrequently. But that training is there. I think what the officers are asking for is we need more training. We need more clarity in help in looking at what are our options, what does the law allow us to do in options and things like that.
And I think you're right, Ed. This is the ripe time. You know, this is a good moment, because this is something that the whole nation is struggling with. Just the definition of neglect, and when we look at the percentage of children that are in custody because of neglect that wouldn't necessarily need to be removed, but we've not really tackled this enough, and we've left law enforcement out in the dark. So, but yeah.
I don't know, maybe we're right 100% of the time. It's probably one of the few areas we are, but maybe that's the case. Maybe we're only right 20% of the time. I think that deserves looking at. If there's 20% we're wrong, that's a big number, and we need to look at what it is and how do we give the guidance to the officers to fix that.
Senator Fascadell.
Thank you, Madam Chair. This is serious to me, and we've talked about these things for years. And for years I've sat here and I've watched presentations of videos and testimony, and we talk about the high percentage of African Americans that are children that are removed from the home. This is honest to God, for real reason. It's an explanation to what you just said, and a follow-up on Representative Reese's comment, is that in Wichita, Kansas, in Sedgwick County, the majority of the police officers and sheriffs, they live in rural areas. They live outside of the inner city. They only come into the area to go to work. And so when they go into an African American's home, it may not be as fancy as theirs is in Andover. And so a lot of times children are removed just because there's not, that atmosphere and culture isn't like theirs. And that has, I've been to cadet training. Well, they're not cadets, but they're newly police officers. They've just finished their training before they go out on their beats. And they appreciate learning more about, okay, here's how this Black family lives. And they're not doing anything, and it's not neglect, it's just different. And so sometimes they are moved for that reason, and I have factual information. So I'm just saying you could kind of look into that. Let them come down and talk to me. I'll help them out. And well, thank you, Madam Chair.
I'll say this, under the law, just because their house doesn't look like our house doesn't lead to neglect. You gotta be able to articulate to the court what it was specifically that made you believe this child would be harmed, that's the language of the statute, this child would be harmed if I don't remove them from that place.
Madam Chair, Ed Klump, I agree with you.
Yeah.
We have so many laws in this state, but laws are broken sometimes. And I'm saying, so that small percentage, sometimes it's just because we don't know. And I went to a NCSL conference, which on a national level did an sent out questionnaires too and investigations and found that to be true a little bit, not always. And so I still love you, Ed Klump. Thank you, Madam Chair.
This still goes back to training. And that's one of the things we talked about is better training.
Okay, we're going to take 2 more questions and move on. We've got Representative Johnson and then Humphreys.
Thank you, Madam Chair. Thank you, Chief. 4 years ago, when I came to the legislature, got to start working with the chief. And I will tell you, the fact that he represents all 3 of the key law enforcement agencies has unified our system. A lot of times we hear from one agency, one group, another. And with Ed, or with Chief, putting those all together, what we're getting here in Topeka the last 4 years is so much more efficient. And so when he brings this data to you, I am very thankful because he is representing a huge portion. The only one not listed here is your highway patrol, pretty much, the troopers, and they don't even deal with it the same way. Chief, the suggestion on the training that is online, are we doing that at the academy now where we're setting up a lot? Do we have audio visual training programs there that they're originating that we could plug into? Because I haven't been down there in years. I just haven't. But I know from my teaching experience, a lot of places have that and can develop the high level of training that we want. What do you know?
So we used to do these trainings on a video, like a Zoom meeting, a big Zoom meeting. And those didn't work out very well because again, you got to pull people into that room to do it. So what KLATC has been using for a number of years now is an online training program that is designed to not only provide the information, but to provide testing throughout the program. So people have to stop, answer questions and get them right before they go on and watch the rest of it. And so it's the process that's in place at KLATC, which is why it's essential we do it through them. They have a wide variety of topics that they have these programs on now, and it is very well used across the state.
Yes, and I was still teaching when COVID hit, and we had to change to that for a lot of what we were doing. I think that is an excellent point, and I think we should work on that. Final comment would be, I think as we go to the corrections juvenile justice program, that might be a place for us to approach that right away. I'm very much interested in supporting that. The juvenile justice committee actually meets tomorrow with a number of their prompts. I think the training issue is what we're looking for law enforcement. So I want to thank you personally for all you have done to bring this to us. Thank you. Thank you, Madam Chair.
Representative Humphreys.
Thank you, Madam Chair. This is a question about your third point to ponder, which is more availability to DCF after hours. So they do have a hotline. Does someone not answer that hotline, or is it just leaving a message, or what? Can someone there actually?
I actually have some data on that. I'm not sure I'm ready to share that yet, but I can tell you that we don't always get contact with a real person. A lot of times a real person can't give us the information we need. They don't have it. It may be buried in reports in the system someplace that they would have to go research and get back with us. That's generally not a person who goes out and investigates these cases, to my understanding. So that is there. It doesn't address the needs that we are talking about in these situations where we can be standing in somebody's home, get on the cell phone and call a DCF worker and say, this is what I got, what do you think? It doesn't work that way.
That's interesting. And even more reason why we need better data online, you know. Okay, and then another quick question is, if you do have to take someone into police protective custody, like an infant, but I mean, I don't think you're taking a baby to JIAC. I don't know. Do they have facilities there? Or what if I know Wichita Children's home can take any age, but what if you're in Pittsburgh or Colby or something? I don't know.
Yes, and if we PPC an infant, we take them to JIAC. JIAC has clothing, diapers,
Okay.
formula, everything like that there to deal with an infant. And then they will work on finding placement for that child. So yes, any child that we PPC goes through JIAC. So a 1-month-old, a 17-year-old.
Here in town, but in other places in the state, do they have something like that?
I know there's other assessment centers in the state. I don't know how they work. I know that we take our infants and all of our children, anybody we PPC through JIAC.
Yeah, I know we don't have any type of facility like that in Beloit, but they drive to Salina.
Right.
It's an
Every
hour.
jurisdiction has a juvenile intake. It may not be in their community.
Yeah.
But everybody has one. And when you get out in Western Kansas, that's part of the problem, whether we're talking about child welfare, juvenile offenders, or mental health, is those services are there, but they're 5 counties away. And, but everybody has that. One of the things that come up in another setting was talking about JIAC being involved in this. I think most jurisdictions are doing what Topeka does and taking the child to the JIAC because they help us get those placements, and it's kind of a neutral place we can go with that child immediately after we take them into police protective custody. But I can't stand here and tell you everybody's doing that.
And that placement is like a licensed foster? I mean, who is that placement?
JIAC, and I'm going to get this wrong, Juvenile Assessment and Intake Center.
Yes.
So that's where we take them to. So they communicate with DCF. So
Okay. Okay, I'm sorry, I don't mean to interrupt. I know it's short on time. I just want to, so JIAC then contacts DCF and DCF places them like in a licensed foster home.
So when we take the kid to JIAC will, yes, get in contact, but they'll start looking at other places the child could go. Sometimes we'll recommend non-family placement depending on our investigation. So we'll specifically ask them that the child can't be placed with another family member. Sometimes it's not an issue for us, so they may look for other family members to place that child with. So JIAC does most of that, because at 3 o'clock in the morning, they're the ones taking on that role. If we PPC a kid at 3 o'clock in the morning, or a child at 3 o'clock in the morning, they're going to take on that role to find a placement. So they have contact with foster families. They have contact with all those placements.
Thank you. Thank you. Thank you, Madam Chair.
Okay.
For bringing this information. It's important for us to hear. Thank you. Okay, next up we have Dr. Nanette Perrin. Oh, yeah, hi. With Sunflower Health Plans to talk to us about the MCO role in caring for. What I asked for was to have some description of how your involvement with our system to care for the physical and mental health of foster kids in care. So.
Okay, there we go. Now that I got the technology figured out, thank you so much. So we wanted to start with a quick overview. You guys have probably heard all of these, but and it's in the PowerPoint, but just some of the entities in foster care and their roles. So obviously, you're very familiar with DCF, CMPs, the case management providers, and those are the contractors who act as the child's legal guardian. The child placing agency, those are the agencies that oversee the foster home. And then the foster parent home is that individual home that they reside in. Managed care organizations, so currently we have 3. We will have 3 in January as well, with Healthy Blue joining Sunflower and United as we move forward. Our role really is to work with DCF, with the contractors, with those foster parents that often the contractors defer for us to coordinate with them in regards to that child's medical care, that child's coordination of waiver services if they're eligible. So just to give you kind of those overview. And so we wanted to start with just a little bit about kind of how does a child who's in foster care become involved with the MCO as well as the foster care agency. So if a child who's not already on Medicaid enters foster care, they get Medicaid. So then they are assigned to a new managed care. They're assigned to a managed care organization, and we begin starting that coordination. If that child's needs are such that they should look at a waiver, there are currently 7 waivers. I was asked to kind of focus on the intellectual and developmental disability waiver as well as the technology assisted waiver, which I know Secretary Howard kind of talked about a little bit ago. So you guys are familiar with that just even from today. But the MCOs really do work with those case management providers to make sure they have the steps and navigate the system. I know we've talked about lots of systems just in the time I've been here this afternoon. Can you imagine as a case management provider or as a foster parent having to navigate all of these systems? So one of the roles that we as a managed care organization really has is assisting with that coordination. So we work very closely with the case management providers as well as with the DCF representatives. And I'm happy to answer questions. I did not, we didn't gather any information specific to like the SCD waiver, which is for those individuals with severe and emotional disturbance, but happy to talk about that as well if you have questions. So what's another way? Another situation may be that the child is already on the waiver and then enters foster care. And again, we would have a care coordinator who is actively working with that team, and they would just bring the case management provider and the foster parents into the discussion to make sure that the supports that child is receiving are appropriate and meet their needs. Then there's a third way, and that is that the child is Medicaid but does not have IDD waiver eligibility. And this is really where that navigation comes in. The community developmental disability organizations in each of the areas of the state is the eligibility determiner for IDD waiver supports. But we would help those case management providers to connect with them and make sure that they give all of the information in order to do that. You'll see a note on this slide. Children in foster care may bypass the wait list. I'm sure all of you have heard that the IDD waiver has a very lengthy wait list here in Kansas, but if a child is in foster care, or to be honest, this isn't on my slide, but if they are at risk of going into foster care, they can also skip the wait list. So that is absolutely a way for those children who are still in a family home to receive those waiver services prior to, or hopefully to divert that opportunity of them going into foster care. Here's a little bit of information about how the case management provider decides on a reimbursement model. Secretary Howard gave more details about that and definitely more specifics as far as the funding. But we as a managed care organization have nothing to do with that rate establishment with the case management providers. They do that client assessment level of care tool, and they assign them either Basic 1, Basic 2, or Basic 3. Intensive 1 and 2 are often those members who are on the intellectual and developmental disability either waiver or even the wait list, and those who are utilizing medical supports, such as those on the technology-assisted waiver. So kind of how does it work? So the CMP is the legal guardian. They are the person that makes, so when we're doing our person-centered support planning, when we are talking about what the individual needs are, the case management provider is the one that signs that. So they're the ones that consent to what the plan looks like. They do involve the foster parent in information, but the legal guardian is the one that really makes that determination of which services the child can receive. So the foster parents, really one of the things, although supporting an individual with more intense needs may look different, foster parents really still are responsible for that guidance and supervision of a child, that food and shelter, ensuring that their activities of daily living, as well as their instrumental activities of daily living. So those are things like shopping, transportation, other things like that are all met. That all falls under foster parent responsibility. Recreation, making sure that they have those activities to do. The foster parent also supports those visits with their biological parents. They also make sure that the child receives the medications and treatment, and they participate, again, in those treatment plans, those behavior plans, that the case management provider then signs and identifies what those services are. So the case management provider, in collaboration with the child placing agency and the foster parents, will determine that payment structure. The CPA, child placing agency, determines their own rates. So many have adopted what are called the tier rates that are currently utilized on the intellectual and developmental disability waiver. And so sometimes they will choose to get that higher rate. Medically fragile children often will use something similar. But again, that negotiation is all with the case management provider and the CPA and DCF in the background. So when you look at that payment, it's confusing, right? Like, okay, well, the foster parents negotiate, they figure this out, they're looking at that service. What they do as part of this treatment plan, and it's all in collaboration with the child placing agency, the foster parent, and the case management provider, the legal guardian again, they talk and they say, this child is eligible potentially for the IDD waiver. Would you like the MCO to assess for waiver services, or would you like to have the flexibility to utilize a higher rate to hire your own staff? And in many cases, the foster parents have elected to not utilize the waiver and to get that higher rate, so that when they're looking at who can help today, Johnny needs some support after school, maybe even going to a football game. Johnny needs support. Do I want to be, I don't want to say restricted, but it is sort of restricted to waiver services in order to do that? Or do I want the flexibility to be able to utilize individuals, of course, who have passed background checks and all of that, but to utilize other supports and have that flexibility? And so many foster parents elect to have the higher rate and have the flexibility and not receive the waiver services during the time that they are in their foster home. So, okay. When we look at medical and behavioral needs outside potentially of the waiver, all routine medical needs, scheduling necessary appointments, all of that are worked on in collaboration with the CMP and the foster parent. But of course, they're reimbursed through their medical card. And behavioral health needs as well. Referrals for specialists, all of those things are things that are worked together by that team. The foster parents are responsible for transportation They do have access to transportation reimbursement, just like they would if just like a parent has for their child in Medicaid. If they're attending those appointments, they can. If they're over 16, they can utilize transportation, but if they're under 16, they can get mileage reimbursement and/or travel with them. And so the managed care organizations really make sure that all those providers are paid, and any prior authorizations are done timely, and we help navigate that with the foster parent and/or the case management provider. Sometimes the case management provider will say, hey, this particular foster parent has a question, they're having challenges accessing DME. Will you work directly with them? Absolutely. We're more than happy to do that. Sometimes they actually say, can you talk to the foster parent more often than you talk to us and just let us know when we need to sign something? Yep, you know what? You are the legal guardian, and you direct how we support this child's care. And so we all work together on that. And so it really is about kind of that coordination. And I must have thought this was a super important slide because you get it twice. But you don't have to listen to me twice. There you go. So, and this just talks a little bit more about specifically, as we kind of look at that system navigation, it can be confusing. So when we talk about like durable medical equipment, say for example, an individual who maybe utilizes briefs for incontinence, those obviously are provided. And so we work with them to get a physician order from a provider. If it's a covered benefit, the child will automatically get it. It just gets mailed out there. It's actually probably one of the smoothest processes there are in all of these systems that we talk about. So that durable medical equipment is absolutely there. If for some reason it's not a covered benefit, one of the things that is always in play for individuals under 21 in Kansas is something called early periodic screening, diagnosis and treatment. Those little EPSDT, which I don't know why we didn't put on the first definition, because that one's probably more confusing than the rest. But even if something does not fall in a regularly covered benefit for Medicaid, for those children, individuals under 21, we review that to say, will it correct or ameliorate? Is it something that is directly related to that child's disability and will make a difference? If so, then that's reviewed under that criteria. It's way more technical than that, but I made it. But yes, it's reviewed. If it's approved, then the same thing. It's covered and we move on, even if it's not a listed covered benefit. There are a few additional options within managed care organizations. They're called in lieu of services, and those are services that we can look at potentially covering that the state has approved. So there's a pretty list that we're happy to share if you would like. Most things for the individuals we're talking about are going to fall under EPSDT versus in lieu of services. So we do have the ability to work with whatever providers we're working on to identify if there is potentially a different contract that they want. And so as we're looking at gaps, either regionally or with a particular child's needs, if they need to see a provider who maybe isn't in network, again, that's something that we, as the managed care organization, are happy to work with the team to identify that the best scenario for that.
Great.
I'm sorry, I talk really fast.
No.
And I was like, oh, I can make this go fast.
Yeah, you did. You did.
Questions?
So yeah, I've got a few questions. I'm glad you covered the EPSDT because I had that written down here that I was wondering how that figured in. So I appreciate your comments on that. And some of the discussion that we've had today, that we've talked about, that we know that there's two sides to a lot of situations. We have had some discussion lately of phone calls on the, I've just lost the TA waiver. And some of the medical needs that the foster parents have requested and been denied that are kind of simple and seem obvious, such as a hospital bed and a new wheelchair for a child that was brought home as an infant and 3 or 4 years old, but it's too big for that. So what would their process, is there like an appeals process? And
Absolutely, yep.
yeah, so if they're having problems with the appeals process, can you give us a recommendation of?
Yeah, so the appeals process should be very simple, to be honest. It is calling customer service or anyone, like they can call me, they call anyone at Sunflower or with the other two MCOs, whichever MCO they're with, and say, I want to file an appeal. That's it. We pull in the appeals department and they handle the rest of it. Now, here's where it gets complicated. I just said it was super easy, and now you just told me it was the foster parent. The foster parent is not the legal guardian of the child. So the foster parent needs to work very closely with the case management provider to say, hey, can we work together? Now, a provider can also appeal, but as far as being able to have that more robust interaction, it's gonna be a lot easier if it is the legal guardian of.
And I'm not sure, I think maybe they were working with the physician, maybe, that
Yep.
kind of a provider. So I don't know, I can check back, but they've been denied a couple of times. And it is Aetna, so it's not something I'm going to dig into right now, but
Well, it's gonna be one of us soon. So
it is. It is, but that's,
One of the
I
other
just
three.
thought it was important to have you here and for the whole committee to see what that process is for these children that are the responsibility of the state.
Absolutely. So I'll elaborate just a little bit. So they can ask anyone. It will start the appeal process. If they aren't satisfied with that outcome, they then have a higher level of appeal. They can go to state fair hearing, which is where they actually go, the state reviews that. So the process is very lined out. And if they are having any challenges navigating it, they should absolutely reach out to the MCO, go up within the MCO as well. Like, hey, I don't understand why my appeal's not working. Who can call me? And, absolutely, we are happy. I don't deal with appeals, but I am more than happy to chase down if a member ever has a question. I'm more than happy to call around and, phone a friend, figure out where it sits and what needs to happen and get that next step.
Okay.
For the member.
There's one thing that I asked for, I don't see in your testimony, and that is, I sit on the Bethel committee as does Representative Reese and I can't think who else, but anyway, we're familiar with contacting the MCOs. And since there was just you were the only one presenting, I would like for the foster care, for our oversight committee to know who to contact when they get phone calls.
Okay.
So,
Absolutely.
yeah, if we could have information to our staff that we could get out to the committee members so that when they get their phone calls, they know who to contact for help if they have issues.
Yeah, so we provide monthly or whenever it changes, we do provide, we call it a foster care desk aid that lists everyone. So all 3 MCOs give that to KDHE and they share it among the case management providers. But
Right.
I can definitely just see if we can't get you guys a copy of that.
Right.
So you have our.
Right. Do we have Representative Reese?
Thank you so much for the presentation. On the appeal process, who does the appeal? Is it the case manager or the foster care parent?
So who can file an appeal?
Yes, who can file the appeal?
So it can come from the legal guardian or from a provider.
Okay.
It makes you just say that you're appealing the decision, you want a secondary. They can also ask for what's called a peer-to-peer. So just from that initial one, they can ask to speak to the doctor. So usually, obviously, I just said peer-to-peer. So typically the provider, the medical doctor would talk with our medical director who is overseeing that.
So I've done appeals before, not for a constituent, just in my own family. Like, for instance, lab work that was not covered under our insurance. And so I go in and there's an appeal form online, so I just download the appeal form. I'm a social worker also, so I know all the language that needs, and I know all the documentation that needs to go. Is it the same way for this, or is this much simpler?
Yes and no, both are available. So you can do a form, but you do not have to. So it is much simpler.
Thank you.
I believe anyway. And it's never and when you said case manager, I was thinking you meant on our side, because I said they could call anyone. The individuals who made original decisions, the person who's working directly with them is not the one that handles the appeal. It would be our appeals and grievances department, which follows all of their protocols very well.
Okay, we have Senator Baumgardner online, who is the other person I was trying to think of. She wasn't in the room. That's why I didn't think of it. She's also on the Bethel Committee. Senator, you have a question?
I did, and it is a follow-up of your as well as the representative's question on that appeal. So just how long is the turnaround on that? Because it seems as if at least a couple of the cases that we're familiar with, this came up at our last meeting, which was several months ago and still isn't resolved. So is it the physician that needs to say a different wheelchair is needed, but then the foster parent as well as the case manager for the contractor, the DCF contractor, that's who needs to work on that appeal?
So any one of those can do the appeal. So I don't have the timeframes in front of me, but I can get that to you as well. It definitely shouldn't be from a previous meeting. That would be outside of the timeframe, in my understanding of kind of that answer. Now, they could be further in the process. So they may have appealed, gotten a secondary denial, and then are now at the process of wanting to look at a state fair hearing or something like that.
I think the secondary denial was back before the last meeting.
Okay.
It's been a while.
So, and definitely, that would be something that oftentimes KDHE would follow up with us weekly on. So, yep. But I can get you the timeline if that would be helpful.
Do you have any more, Senator?
Well, I am just a little confused when a child is in the care of the state. They're in foster care. So that is the care of the state. Or be that months and months and months go on, particularly a child that has, and they wouldn't have to have multiple issues going on, but if just over 2 to 3 dozen kids that have very significant needs, why would that take a foster parent and a caseworker months and months to work through when we are then at risk of losing that foster parent and the child having to be hospitalized for lack of a place for that child to be in care? How is it that this could just continue to drag on for months and months?
I don't know that I have a good answer for you on that. It should not. So following, the process, contacting others at the MCO, making sure I would contact Brenda Soto, who's the MCO liaison. I would I would get that group, sorry, not to throw, but volunteer. But I would say, hey, we need, one of the things that foster parents, case management providers can also do is ask for a complex case. I need you to bring the MCO and, the MCO and the case management provider and the foster parent together to say what's going on with this kid. We get those requests fairly regularly to make sure that we are doing everything we can to coordinate care. So if I was seeing something that was taking that amount of time, I would likely say, hey, is there a better meeting format for that? A better way for it?
And so, Madam Chair, am I correct to assume you did not hear this discussion at our last meeting? You were not aware that this is an ongoing issue?
Yes, I'm aware.
I'm asking, you are,
Right.
I'm
Yeah,
asking, Madam Chair, for our
okay.
speaker
Oh.
to address.
Oh, well, it wasn't sunflower, so I believe was what I was, so I was
Okay.
not at the previous meeting, so I did not have that context to bring that information. But I'm happy to provide it
Thank you very
later.
much. Thank you, Madam Chair.
Yeah, and thank you for being here.
Of course.
Yeah, we appreciate it. Oh, do you have a question for, I'm sorry, I missed it. Senator Pascal.
Thank you, Madam Chair. So I'm just curious, has there ever been a survey taken or data collected to show whether or not a child that, because we've heard it all day and in other meetings, that a child, for whatever reason, being removed from the home, they are traumatized. So, and then we then later have to treat them for depression, etc. So have we ever looked into, is that trauma caused by what was going on in the home and the removal and how they were prior to that removal? Because it can be devastating, strangers, and they maybe look different, the whole gamut. And so now we have to treat them. So I'm just wondering, have you ever looked into that aspect?
So there has been a lot of research around what they call adverse childhood experiences that impact the impact of trauma across individuals, both in foster care and not. But definitely, trauma-informed care is one of the trainings that we provide. We do work with our case management providers to make sure that they receive it as well as all of our care coordinators.
And Madam Chair and ma'am, I guess I'm asking, are we seeing that they are even more traumatized and we're treating them now because they're in the well-meaning, loving family, foster family home that wants to help them, although we are drugging them now as opposed to them receiving whatever kind of love they had prior to. So I'm just wondering, we've impacted that trauma, and are you seeing that as part of the treatment you've had to increase trauma? Is anybody following me?
Yeah, no, absolutely, Senator.
Because the looks on people's faces are like they don't know what the heck I'm talking about.
No, absolutely. That is 100% a valid point. And there are research articles out there about many of those things. And yes,
And so, Madam Chair, I'll close here. I was just making the point that sometimes, I'm hearing a lot of it now from Secretary Howard, and I love it and appreciate it, that we're going to try to work more effectively and efficiently of helping children stay in their homes and connected with those so that we can treat the trauma that they originally had and not compound or be impacted more so. Thank you, Madam Chair.
Okay, any further questions? Okay, thank you. Okay, you guys, bear with us. We have a couple more presentations, and we're going to push on through here. Next up, we have Dina Gage with Kansas CASA Association. First time that we've had Dina. Welcome.
Thank you. Tall.
You are tall.
And I do have some slides for here to go with this as well. Committee Chair Representative Concanon, Vice Chair Senator Gossage, Ranking Member Representative Ousley, and members of the committee, thank you for the invitation to present today. My name is Dina Gage, and I'm the State Director for Kansas CASA Association. CASA stands for Court-Appointed Special Advocates and was founded in 1977 by Superior Court Judge Sukup in Seattle, Washington. As he was tasked to make decisions for children, he often wondered if he had enough information. And that is when CASA was formed. Judge Sukup envisioned citizen volunteers advocating for abused and neglected children. The mission has remained consistent to ensure each child's voice is heard and that they receive the individualized attention they deserve. This model has proven to be an invaluable resource to the pursuit of safe, permanent, loving homes for children in foster care. Kansas CASA Association and Kansas CASA Advocates serve as a vital pillar within the child welfare system, giving vulnerable children across Kansas a voice in the courtroom. There are CASA programs in 49 states and the District of Columbia, and there are 941 state and local organizations across the nation, just to give you a little information on that. At the heart of CASA's work is the one-on-one advocacy that our volunteers provide. Each CASA volunteer typically takes on one sibling case at a time. This is an intentional approach to allow deep, meaningful engagement with each child that they serve. There are the other professionals in the child welfare system on the child's case may manage a dozen or more cases, whereas CASA volunteers are able to truly know each child and their unique needs. GALs and caseworkers, at no fault of their own, have a large caseload, so they typically don't have that opportunity to really get to know the child, make frequent home visits, and see the true picture of what the child's needs are. This is what makes CASA an integral part of the equation. It takes a village, and we're proud to be a part of that village. They meet with the child, speak to family members, school staff, healthcare providers, and others in the child's life, gathering the insights that inform the court and support the child's best interests. CASA volunteers stay with each case until it reaches a conclusion, offering children a dependable, positive presence during times of significant upheaval. And for many children, their CASA volunteer is the only constant in a system that often changes rapidly around them. In this slide, you will see this is the CASA model nationwide, and that the center of the model is the child. So we learned from the child about their lifestyle and everything that's going on in their life at the time. We engage with them, we make recommendations, and then we monitor to ensure that the needs are being met of the child. We collaborate not only with the people we had mentioned before, but also with the GALs, with the caseworkers. We really, like I said before, it takes a village, so we really work together to make sure all of the information is there. And then we make the court reports with the recommendations and findings. Across Kansas, Kansas CASA currently supports 20 local programs that serve 60 of the state's 105 counties, providing that vital one-on-one advocacy to children in the child welfare system. As you can see, the map has some gray on there. That means those are the areas that do not currently have a CASA program, and we look forward to reaching out to judicial districts with no CASA program to share our mission with the goal of more programs to be formed so we can serve even more children in the state of Kansas. We serve SINC cases, or child in need of care cases, and a CASA advocate must be appointed by the judge to the court system. Once a CASA has been appointed and then assigned to the child, the CASA remains on the case until conclusion of permanency. The child may be moved from one county to a different county across the state, and if that happens, our CASA still stays assigned to that child. So let's say you have a placement where a child may be in Shawnee County, but then they get moved to Bourbon County. The CASA remains the same. They will travel and make sure and visit that child no matter where they are across the state to make sure that they are that one constant during all of the other changes that may be happening in their life. Our volunteers are unpaid volunteers who give their time and are sometimes traveling across those multiple counties, but they do the work because they know how important they are to that child's success. In 2023, 1,242 children were served by CASAs, and 99.9% of them did not experience a reoccurrence of abuse or neglect during that year. And of those children served in 2023, 98% of them remained with the same CASA volunteer. We always strive to be data informed, and the local programs collect this data and complete a growth and outcomes report for us, so we have data from across the state. According to the most recent out-of-home placement settings DCF report, there were 5,665 children in foster care at the end of the first quarter of the state fiscal year of 2025. In response to that need, the Kansas CASA program served approximately 1,000 children per quarter during our calendar year of 2024. In the first quarter, we supported 973 children and contributed to the closure of 108 sync cases. This work continued with 1,004 children served and 110 cases in the second quarter, and in the third quarter, 1,011 children were served and 112 cases closed. We celebrate those cases as well because each sync closure means, each sync case closure means a child has reached permanency and a foundational goal in CASA's mission. We are continuously inspired by the work of our CASA volunteers, but we know there's always more work to be done. We will be working to raise awareness in the 45 counties that currently lack CASA programs. Many more children are still waiting for a dedicated advocate by their side, and Kansas CASA is committed to expanding awareness and recruiting more volunteers to ensure that no child who has experienced abuse and neglect in Kansas is left without a voice. National CASA Association has conducted numerous studies that confirm the life-changing impact of best interest advocacy. This research can be found on their website, and I have some of that information to share with you today. According to their national research, judges have reported that CASA volunteers have the most significant influence on promoting long-term well-being, ensuring appropriate services for children and families, and fostering psychological resilience. Some of their research also shows that CASA advocates often support children facing some of the most complex cases, offering stability and consistency. And then their research also highlights that children with a CASA advocate are half as likely to re-enter the child welfare system, are more likely to succeed in school, and are less likely to face disciplinary issues or be expelled, thanks to the positive role models the CASA volunteers provide. I do have a video that showcases 2 former foster children and their CASAs, and that will help demonstrate the true impact a CASA has on the children that they serve. If we can get this to work. Nope. Okay, thank you. Yep, thank you, I appreciate it. I was living in a shed after aunt and my uncle and stuff. We all got evicted from the house, and we were living in the shed in winter. And then I had a cousin, and I stayed with her for a little bit, and then I went back to living in the shed with my mom and my aunt and my uncle. Then I went to another, and after I left my first foster home, I went to a group home, stayed there for a year, went to another foster home that was sitting on adopting me, abandoned me, and then I went to children's home again. I was there for a year and 6 months, and then I ended up in my last foster home. Tamara was my very first CASA case. I was very nervous. I had just, gone through all the training, and I was so excited, so nervous. I had to navigate getting in touch with foster parents, and I knew a little bit about her. I
certainly knew more about her than she knew about me. But I was really excited. Tamara was easy to meet. She has always been a super joyful young woman, and even then, with all the things she was going through, she was.
In my life has changed my life. Now I'm going to get teary-eyed. I think just watching her grow up has been a real pleasure, and seeing her find her forever family was unbelievable.
Before CASA, I pretty much was in foster care my whole life. So I was first put in the foster care system when I was in Las Vegas, Nevada, which where I was born. I ended up getting adopted by my cousins, which is my dad's side of the family, and me and my siblings, we all got placed there, and then they decided to adopt us. Unfortunately, it didn't last very long because my cousin decided to sexually abuse me. So at that point, pretty much for a while, until at least I was like maybe 12-ish or something, is when I met this one family, and me and my siblings fell in love with them. We liked them a lot. What ended up happening is like they were gonna go push forward to this adoption, and I got scared just from the trauma response from my first adoption. It was just like, well, this happened the first time. I'm worried that this is gonna happen again. But then they mentioned the word adoption, which at the time I think was really a trigger word for me. So I ended up just acting up again, and then it was just the last straw. And then I got put back in the system after that, and they ended up keeping my siblings, and then my siblings ended up getting adopted.
Well, I worked for the juvenile justice system in Missouri for about 12 years, and each of our abuse neglect cases had a CASA assigned to it, and I saw with my own eyes what CASA did for these kids.
I met my CASA worker for the first time. I was 15 years old. I was living at the group home at the time, and I just felt very dubious. I just felt like this was just going to be another person that was going to walk into my life and then just leave.
I saw so much potential in Frank. He was getting straight A's while he was living in a group home with very little support. Group homes are tough because there's a new staff coming in every 8 or 10 hours. You don't know what mood they're going to be in. You don't know what the kids are going to be like. There may be new kids there when you get home from school, and there may be kids gone when you get home from school. And so you never know what your day is going to be like, and he was still able to maintain straight A's through all of that. I just knew there was something special about this kid, and I wanted to nurture and foster whatever that was, and see where he would decide to take his life.
If it wasn't for Susie, to be honest, I probably wouldn't have graduated valedictorian from my school.
I just think that if everyone could love a kid that's not theirs, if everyone could just be there to pick up the phone when they have a question, or, it doesn't take money, it doesn't take a lot of time even, but to be there for a kid when they need you, that can make an entire world of difference for that kid in their lifetime.
That is why we do what we do. Just speaking from those children and the CASAs, I get emotional thinking about it as well, but they deserve to have the individualized attention that our CASAs provide, so we're very proud to do that. And I listened to the presentations earlier today, and when I was here previously, just to do an introduction to the last meeting, Senator Faustido, you brought up some comments, and I'm so thankful you did, so thank you so much for those comments. I'm very appreciative of that, so we can continue to work towards solving those concerns. We definitely hear you, and you should have some correspondence in your inbox from with a communication from CASA from recently. Our strategic plan includes efforts to recruit more volunteers who are people of color, and inclusiveness and representation are a priority for CASA across the state. So we are continuing to work towards that. Thank you for the invitation to share about CASA and for considering the crucial role CASA plays in the lives of children across Kansas. We truly appreciate your continued support as we help change a child's story. And I've also provided written testimony for your review, and I will stand for questions. Thank you.
Do we have questions? Okay. Senator Pascal.
Thank you for that comment. What are the ages of the children that the CASA workers start with? What, I see a lot of youth, and I look at youth 12, 13 and up. So what's your age category?
We can be appointed to a case from infants to 18 when they age out. So we can take any case whenever the judge appoints to us. Absolutely. Yeah.
Okay, thank you. Thanks for being.
Yeah. Thank
yeah.
you very much. Thank you.
Okay, Mallory's ready to go. She's up and ready to go. So Mallory Lutz with Little Government Relations is here to talk about the Child Abuse Review Examination Network, the CARE bill that the bill that we passed a couple of years ago. And since we're continuing to fund that, I just wanted to hear an update.
Yes, I'm
What's happening?
happy to be here to provide an update. You get me today, Mallory Lutz. As you said, I'm here today on behalf of the Kansas Chapter American Academy of Pediatrics, and I feel like I need to give a disclaimer since I'm not a medical provider. I have no medical expertise, but our child abuse pediatricians, I guess it's residency interview season, and so they tried their best to be here, as they always do. I think you know that. They enjoy coming up here, but I will be speaking from a brief report that we provided to the committee, so if you have that in front of you, that might be helpful. So the Child Abuse Review and Evaluation, or CARE Network, many of you were extremely supportive and helpful getting that through in 2023. And so wanted to provide you some numbers and data and kind of two pieces to this. So the first one I will talk about, you're welcome to look at the tables on page 2. This refers to the referral portion of this, or as I call it, kind of the triage system. And so the referrals that DCF, the cases of suspected abuse, the medical resource centers where the child abuse pediatricians are, they review those and then they sort of triage that case and say, okay, this child needs to be seen maybe by their family doc, or they need to be seen by a care provider, or maybe no follow-up is needed. Those are some of the examples. Table 2 shows DCF region, the number of referrals per region, and this is over an 18-month period from April of 2023 through September of this year. So those are the referrals and outcomes. And then the second piece, of course, is the training portion of this, which I think maybe 1 or 2 of you have attended some of these trainings. And so to date, we have held 3 trainings. It's been in the fall in 2022, 2023, and 2024. To date, we have 34 providers across the state, and I would draw your attention to the map on page 3. And for those of you that have been around the last few sessions, when we came to talk to you about this program initially, the map looked very different. I think we only had dots on the map in Kansas City and Wichita, maybe Topeka, but as you can see, the map now looks very different, and we're very excited about that. I think we even have the training date for 2025 set. So we expect medical providers, docs, APRNs, PAs to continue to be interested in this program. What the training looks like, that initial training is a 2-day intensive in-person training, and then there's continuous ongoing training, those ECHO series that are webinars that are held monthly. We just held one of those and had 11 doctors and 23 APRNs participate. And then the chapter also this year in the spring began offering a one-day in-person annual update training, and they had 6 doctors and 11 APRNs participate in that this year. One last thing I would draw your attention to, I'm not going to read it, but I will leave you to do that. Every time we come here, I think we share a different story from a provider perspective to talk about what does this look like in day-to-day practice. And so in the past, I know we've shared stories about how by having this added layer of expert eyes on these children, that has saved kids from abusive situations. The story today from Western Kansas, it highlights how the network also ensures that children are not unnecessarily removed from the home. So getting at what we've heard today. So again, want to thank you for your support of this program, and I'm happy to take any questions, though my expertise will be somewhat limited on these, but thank you.
Yeah, you know how to summarize. Committee, do we have any questions for Mallory? Yeah, well, yeah. Jared just said it. Representative Owsley just said, thanks for the update. We really do appreciate hearing about it. You know, we pass bills and set up things, and it's nice to get some follow-up about how it's working. And thanks for the story about how it's working to disprove any abuse. I think that was just a very important part of the starting the program too, to have that understanding. Oh, we do have a question. Representative Ruiz.
Probably more of a comment than a question. I think this really also speaks to the quality of the training that practitioners are interested in taking the training, because people talk to each other, and encourage each other to take the training. So I just want to commend whoever's doing the training. They must be doing a really good job.
Well, thank you for that. One of my questions actually to our providers was, you're only doing one intensive training per year, but of course, as we all know, I mean, it's very difficult for physicians to get away from their practices. So I said, are you planning to do more in the future? And well, that's not certain yet. Based on the feedback that they've been getting from providers, I only expect that the interest in the program will grow.
Yeah, I would agree. And I visited for, I think, maybe a half a day. It was amazing. Well, tell them thank you, pass that on. And sorry, we scheduled our meeting during the residency interview week, but I do understand that.
So thank you.
Right, thanks for being here. Is there a committee, is there anyone that will not be here tomorrow? Okay, thanks. We just need signature, because Sky needs your signature on your expense form if you won't be here tomorrow. With that, we